Alawalia, who is a physician and public health scientist of great distinction at Brown University in the United States. His specializations include nicotine, smoking cessation, and the associated racial health disparities. He's published so many papers that I wonder if he ever end. Welcome, Jazz.
Thank you very much. Delightful to be here.
And alongside Jazz is Nancy Lucas, who is a leading international advocate. Her long track record includes organizing with vapers in New Zealand to ensure regulated access to vapes and heated tobacco products. And she's the founder and leader of CAFRA, which is a regional organization advocating for tobacco harm reduction across Asia Pacific and beyond.
Yes.
Delighted to have you with us,
Thank you
Nancy.
for having me.
So yeah, we'll get started. I mean, even though the conference is still young,
Yes.
there have been side events going on. There have been many conversations, and no doubt, Nancy, you're still struggling a little bit with the jet lag, having arrived from New Zealand. But just interested in any sort of early thoughts and observations from what you've been hearing from folks here in Warsaw.
Well, I mean, the main thing that has impressed me is Latin America. It's good. It makes me happy to see all the people from Latin America are here. They're engaging. You know, the main highlight for me so far was Roberto's oration yesterday. That was great.
It was fantastic,
It was
wasn't it?
fabulous. Spot on, dead on, given with humor. Roberto being Roberto. I mean,
it made me feel as if I could understand science.
Yes, yes. So I'm very impressed with that. And like I said, I'm really happy to see so many people from Latin America here. So that's my take on it.
Great. And Jazz, you've been here a day or two longer than Nancy. I know you've been throwing yourself into various events and conversations. Any sort of takeaways or standouts for you so far?
Well, yeah, no, I think Nancy's right to have so many people from, I was told this morning, there are people from 80 countries at this meeting. You know, that's really fantastic. I mean, the combustible tobacco issue, you know, speaking as a physician, is not just a U.S. problem. Of course, everything we think is in the United States. That's why we call it the World Series for baseball, even though there's no world involved. You know, the bigger problems with combustible tobacco are really around the world in LMICs. And so to have countries represented at scientific meetings, advocacy meetings, it's critically important if we're going to make a difference, for sure. There's no question about it. This is my first time attending GFN.
Is it?
So
Oh,
yeah, so
welcome.
this is a new thing for me. You know, I tend to go to science meetings, tend to be asked to speak at science meetings, since that's sort of what I do. But I think in the end, if we're going to make some changes, especially with such a controversial topic, a difficult topic from a political standpoint, and you know, and from a legal standpoint, it's going to require quite a bit of advocacy, actually.
Well, certainly Nancy
Yeah,
knows all
yeah,
about that.
yeah.
But yeah, I mean, one of the reasons this is always a standout event of the year for me is the sheer diversity in terms of both international representation, but also the diversity of perspectives. Like we've got academics, we've got advocates, consumers, scientists. It really
That's
is.
the beautiful thing, and that's why I'm so glad that you're here, because, you know, working in the field, you see your patients, okay, but to see other people and other consumers from other countries and their experiences, and it will broaden the understanding. Because that's one of the things in many of the LMIC countries is that the medical profession themselves, they're so disconnected from all of this because of whatever, okay? So it makes me happy to see you here and to see other scientists coming here, because it humanizes all of us.
Do you think that's a fair characterization of the medical profession, Jazz?
Yeah, I mean, you know, physicians, you know, they tend to obviously be higher income. They live in an ivory tower if they're in the academy. You know, I say it's a fake world that we often live in. It's just sort of this, you know, world that's not real. And people are real, and real things happen in the real world. I think physicians, unfortunately, are more judgmental than they should be, and we'd like them to be. I think sometimes they have trouble empathizing with those from different backgrounds, those with, I'm not stereotyping or generalizing, but those with, you know, maybe substance use issues related to, let's say, opioids, heroines, and things like that. Ironically, they have more empathy for people with sort of, you know, so-called serious substance use issues. And they tend to have limited empathy, maybe more for smokers a bit, but very little for people who use recreational nicotine. I think it's just the atmosphere in the United States. The question is there a role for recreational nicotine? And I think generally the federal government, the FDA, the CDC sort of is really sending a pretty strong message of resounding no, which is interesting as they legalize cannabis. I just find it absolutely
Yeah, I don't
fascinating.
understand that because it's the same in Thailand. Cannabis is legal. It's not regulated. But vaping is verboten. And it's happening in a lot of countries along the way. Now, I want to ask you a question. Sorry, Will. I want to ask you a question as a physician. What is the general, I don't know if this is a generalization and it won't apply to everybody, but what is the general mindset in the medical community about the use of cannabis?
So, without again generalizing, but I have to generalize the answer, is that, youth in the United States, maybe globally in Western Europe, believe that cannabis is perfectly safe. I mean, when you decriminalize, but then when you go further to legalize a product, you're sending a strong message that, almost to some extent, that the government has sort of blessed the product, that it's safe. And so, in general, the feeling about cannabis amongst people, probably physicians too as well, is that it's fine to use, it's safe to use. And ironically, the feeling about, let's say, e-cigarettes or vaping is that it's not fine to use for a variety of reasons, whatever they may be, and that it's very dangerous, which I think is not an accurate statement. I mean, no one says it's safe. The manufacturers of e-cigarettes don't say it's safe. But to say it's very dangerous, I mean, the perception is, as you know, as well as I do, that 80% of U.S. physicians think nicotine causes cancer. That's unbelievable.
I was going to bring that up.
Mind-blowing,
Or
yeah.
cause COPD, or cause heart disease, and I'm stunned by that. And then 70% of Americans think e-cigarettes are as dangerous or more dangerous than cigarettes. And unfortunately, the United States government is complicit in that misinformation. The media is complicit, the government's complicit, and it's really tragic.
It's
It is. It's
absolutely
very much so.
scandalous, isn't it? I'm very glad that you're a member of the 20% of physicians who do not believe that. But bringing it back here now, you're obviously, the listening that we do here is so important, the dialogues are so important, but you're also both here to proactively engage in events and impart certain messages. And I would like to ask you, what are some of the key things that you're looking to get across during these days?
My number one message is to the advocates, and it usually revolves, jet lag, usually revolves around, it can be very hard to do what we do. It's very hard to be an advocate and sit there and constantly be fighting these people. And my main message is there's always somebody there to pick up your slack. A lot of people are isolated. They live in different countries. Some people are, a single advocate in a country by themselves. I mean, we are a community. And the beautiful thing about GFN is that community is now everywhere because now we're online. Hi, everybody. And also when you're here. And that's what we're here to do, is we are here to engage with one another. We're here to learn from each other, and we're here to support each other. And that's why I'm here.
There's a board that we just walked past on the way here in the corner there, which I had to stop and look at because it's got kind of the logos of, I think, several dozen international tobacco harm reduction advocacy organizations from all over the world. And I kind of, my jaw dropped a little bit. I didn't realize there were quite so many, and that they're all connected. And there is just an incredible network now, which perhaps didn't exist a decade ago.
No, it did not. Absolutely did not exist a decade ago. I was talking to Harry Shapiro this morning, and I said, it's funny because my first GFN was in 2016. And I look at what it was like in 2016, and I look at what it is now, and I'm like, wow, it's exploded. And in a good way. In a good way. I mean, never would have imagined that we'd have people from Latin America. I never would have imagined there would be people from Africa. This is a good thing, and this shows me, even though the battle is hard, that we're winning, we're gaining ground. The more people that are out there advocating, the more people that are out there educating, the more people that are out there supporting each other. We'll get there. It's just not going to happen tomorrow. It might be another 10 years. Hopefully not. But that's what I see. And that heartens me, because I remember being, three of us in New Zealand out in the middle of the South Pacific trying to do this. And now somebody will come up to me from, like, say, Malawi or from Uganda, and I'm like, okay, yeah, been there, done that. Here, let me help you, because I think that's the goal, is to help each other along.
Yes, there was an extraordinary graphic that came up during the session yesterday evening, just showing the sort of exponential increase in the millions and millions of people using safer nicotine products around the world. Obviously, we would like that to increase further while smoking declines. Jazz, how would we look to accelerate that from your perspective?
Well, you know, I think it's hard, I would say. And colleagues of mine who work in other substance use fields like alcohol and other things, you know, remind me, they say, Jazz, you just don't remember about alcohol, that you know, it was a marathon, not a sprint, that we have to work 20, 30 years. Because as you may or may not know, Alcoholics Anonymous was always about abstinence. And it was always about quitting alcohol. And in the field of alcohol research, you know, this is sort of like a research issue, for studies generally to show an outcome of success in the alcohol field, it's often not abstinence, it's drinks per day.
Yeah.
Now, it turns out we've now discovered that even one alcohol drink, this may disappoint you, is actually dangerous. And the evidence about red wine is almost completely gone with regards to cardiovascular benefit. So alcohol, unfortunately, is dangerous at all levels. Alcohol is a toxic.
That is disputed by some in the field, is it not?
People can dispute lots of things.
Yes.
I've been very comfortable with people disputing things, but science speaks for itself. I mean, this is not my work. This is other people's work, and that's a consensus. I mean, people will dispute things with agendas, conflicts of interest, or just to sort of justify what they do. So I have no trouble with people saying whatever they want, because it's quite common. Cigarettes are interesting because in the world of research and smoking, it's all about abstinence. Now, there has become more flexibility about cigarettes per day. It's a little concerning to me because it turns out it's very curvilinear. 10 cigarettes is not half as dangerous or half safer than 20 cigarettes.
Right.
It's very curvilinear. I've done a lot of work with actually light smokers, that is, people who smoke sort of less than 10 cigarettes a day, and the carcinogen levels of NNAL, you heard about that yesterday, is quite high, actually.
Yes. Yes.
Just to actually give you an example, we did a study years ago in Minnesota where we measured babies' urine. Babies that were less than 5 years old, so often they were actually 1 or 2, and we collected their urine. It turns out you can collect it from diapers and squeeze the urine out of it somehow. It's really quite
What a
fascinating.
great job for somebody to have.
Yeah, we have students and researchers who do that.
That's what they do,
Yeah, that's what we do. And we measured, the criteria to be in the study was there had to be a parent who smoked in the house
Yes.
and exposed the child to smoke. Of the 70 babies' urine, 69 of the 70 had high levels of the most potent carcinogen in the world, which is NNNL, which is a breakdown of NNN. And this is a highly carcinogenic product. And so, you know, that's quite scary, of course, I think. You know, so I like to let science inform policy, whatever the science is. So I think at meetings like this, people enjoy having, good, and you know, there are only about 3 academics at this meeting, I think about maybe 5 or so, a very small number. And so sometimes they like hearing what I say, and sometimes they don't like hearing what I say, you know, which I'm comfortable with. But I think sort of radical thought on either side, you know, anti this or pro this, is not good. It's not good for anything, whether we talk about abortion, or we talk about this, or talk about that, you know, sort of sensible talk. And, you know, misrepresenting science on either side is just not a good thing to do.
Yes. You touched on abstinence, and that's sort of an interesting, as somebody who, not from the States, but who now lives there, both of you no longer live there, but it does seem to me a particularly characteristic of US culture to have this desire for, I mean, we think back, obviously the formation of AA, but also alcohol prohibition, also drug prohibition and the so-called war on drugs that's been exported around the world, and now almost the sort of the nicotine attitude that we're seeing is perhaps an extension of that in the United States.
American culture, yeah, it's very black and white. And it's very, you're either with us or against us. It's always been that way. It's still that way. It's gotten worse, I think. I don't live there anymore, but from what I can see from looking in, it's gotten worse. A lot of black and white. They don't want to deal with the shades of gray. Absolutely.
Yeah, there's a lot of, you're absolutely right. There's polarization in every topic. It sort of scares me a bit, transgender issues have become very hot, polarizing sort of culture. And it's not healthy at all. It's funny about the black and white and gray. I start off my classes, I teach, not too much, I do more research, but I teach 1 or 2 classes. I teach a graduate class on tobacco, actually, for the last number of years. And I start off my class with a cartoon. I think there's a special name for it. It's from the late 1800s by an Austrian sketch artist. And when you look at it a certain way, you may have seen it, it looks like a duck. If you look at it again,
yes,
it looks
I've
like
seen
a
that.
rabbit.
Yes, yes, yes.
Well, I love showing that to students, and then I asked them to vote on what they think. It's usually 50-50, and I asked them to say, why am I showing you this? And some of them sort of get it, and I said, we all have different perceptions of the same thing. And then we go into war about, your side versus the other side, but it's about perceptions. And I actually told one of our KAC scholars, I think they're called at this meeting.
Yes.
She's from Armenia, and she's a medical student.
I spoke with her myself, yes.
Yeah. And she's very bright. And I said to her, we were talking about something, and I don't know how it came up, but I said exactly this. I said, you guys are young. It's great. You're idealist. And you should be. It's good. But the world will knock sense into you a little bit.
Yes.
And unfortunately, the reality. And I said, the world is not black and white. It's gray.
It's not.
It's actually gray on everything.
Yes.
And when you realize that, then you work on things. And I think of the United States, it's a very odd puritanical. Right?
Yes, that's
word you
exactly
use,
the
right?
word,
I love that word because it's funny. We'll have sex on TV, we'll have sex, we'll do this, but you can't talk about condoms. You can't advertise condoms. There are all these rules about what you can and can't do. And then we get very puritanical, very judgmental about things. And it's just sort of bizarre, actually.
It's the cognitive dissonance of it.
Right.
Yeah, for sure.
Something you were saying there reminded me of one of the graphics that Roberto Sussman showed in his of the kind of high THR knowledge, low cynical idealist, and I think that Jazz made very good points about avoiding dogma. Even those of us who are obviously on the right side of this, but I mean, how would you
on the right side of this? You caught that, right?
How would you characterize then, Nancy, opponents of tobacco harm reduction? Do you concede their sincerity in some cases in wishing to protect public health?
I get angry when people call the other side ants because I think that's derogatory. And what I try to tell people is, listen, we're fighting the same battle, it's just the perception and the perspective of it is different, okay? For example, I'm a consumer advocate for THR because, I lost my mom to smoking-related disease, okay? I don't want anybody else to go through that, okay? That doesn't mean that the person on the other side of the table hasn't experienced the exact same thing, and that is their motivation for doing what they do, okay? So I say to younger advocates or newer advocates, listen, get the aggro out of the way. Find the common ground, okay? And that involves even when you're going to talk to a government official or a public health person or your GP, find the common ground because your humanity is something that you share with people on the other side of the fence. Connect that way and then go forward. You can understand why somebody is doing something, but that doesn't mean that you condone what they're doing or the way they're doing it. But you need to understand why they're doing what they're doing because that humanizes it.
Yes.
So that's how I approach things, and that's how most of us in Asia Pacific, that's how we approach things when we're dealing with others and with ourselves.
Yes.
That level of respect. And I think that lack of respect puts people into these categories and into these boxes of good, bad, right, wrong. It's not about that. It's about where are we going and how are we going to get there and what's the best way to get there so that we're as inclusive as possible of all people.
Yes. And speaking of how to get there and touching on the sort of abstinence thing again, I wanted to ask you both how you feel about smoking bans as a means of attempting to transition people to safer alternatives. We can see lots of iteration. I mean, obviously in New Zealand, there's a kind of an incremental step-by-step move towards banning smoking sales. In the United States, the FDA is proposing to ban menthols, which obviously would particularly impact the African American community, which is very central to your work. And at Filter, we recently published an article about a big increase in uptake of vaping in UK prison system. However, that's come alongside a smoking ban, which has created illicit tobacco markets inside prisons with associated deaths, violence, and so on. So, you know, in the United States, we've seen organizations like the ACLU, Drug Policy Alliance, come out against the menthols ban because of the anticipation of increased criminalization of communities that are already bearing the brunt of drug-related and other criminalization. So maybe it's a bit of a controversial one for this time in the morning, but I'm just interested in your thoughts about smoking bans and in those different contexts and whether or not they can be justified.
No. Simply, no.
Yeah, yeah.
Okay, I think if you tell somebody, and maybe it's just me being a rebel, highly likely, if you tell me I can't do something, that's the one thing I'm going to want to do. Okay? It's not compassionate, it's not empathetic. You know, people have a right to make a choice. Their choice should not, but they should have the right to make a choice. I don't do with my body. And I'm going to hand that one over to the doc here because there's all those issues in the States more than anywhere.
Yeah, no, I mean, I agree with Nancy. I think, you know, humans are empowered to make choices as adults, right? As adults. My wife's a pediatrician, so I always have to remember the kids. But, you know, I think bans don't work. We know prohibition didn't work. So in terms of the United States, they're not really proposing a smoking ban. There's subsets, right? They're sort of banning menthol. They're not banning smoking. They're banning the menthol of smoking, so to speak, right? And so it's a tricky one for me because, as you know, I work on the topic of African Americans for the last 30 years and have done the most work in that space than anyone in the U.S. And they, you know, African Americans have greater morbidity and mortality from almost everything related to smoking. And the menthol was a marketing tactic of the tobacco industry. I mean, that I think they admit that. They have people sort of saying menthol cigarettes, and one company has 50% of the revenue from menthol products. So they will file in the morning, and it'll drag on for years. So I have mixed feelings. It would occur after it was banned is exaggerated. I mean, those murder an American who was selling Lucy's on the street, and you saw that.
Eric Garner.
Yeah, Eric Garner and things like that. You know, do those things happen? Yeah, I mean, that happened before there was a ban, so it happened. Will it happen more if there's a ban? You know, probably not. The industry is very innovative. You saw what Reynolds did is that when there was a ban in California, as you know there is for menthol, they developed a capsule thing or something that's in the cigarette that pops, and it gives you, it's not menthol, but it gives you a menthol type feeling. And then, you know, sort of certain, you know, nonprofits, you know who they are, criticize them saying, there goes big tobacco again, circumventing the law. They weren't, I mean, you know, I'm obviously not a pro-tobacco industry person for sure. People know that. But pro-choice within reason. Health, the government has a responsibility to protect the health of the public, which does limit freedom to some extent. But they didn't circumvent that law. They just got innovative. They got innovative, and they created something that tastes like menthol, but it's not menthol. And so, you know, they're accountable to shareholders. So unfortunately, there is or not, or whatever, a legal product, they're accountable to shareholders. So they're not going to take it lying down. At risk is billions of dollars of shareholder value, not just the CEO's salary, but shareholder value. So I think the bottom line with regards to things like menthol and things like that is, if you, like, for example, here's my idea if I was sort of whatever. I would do a phased-in ban of menthol cigarettes in the United States rapidly over 2 years, but immediately give PMTA, pre-market tobacco authorization, for menthol e-cigarettes. menthol nicotine pouches and things like that. This is not rocket science.
Well, that's what New Zealand's done.
Yeah,
you
yeah.
know?
So I mean, I think different countries have done different things. No country's done it right, so to speak. But some countries have had. It's hard for me to admit that the UK has handled this a little bit better than the United States.
But,
having been by the British and India. So it's a sensitive topic for me. But they do it. They do it well.
Yes. Nancy spoke of common ground, and it sort of struck me there that the question of the menthols ban and bans on cigarettes in general, it does somewhat divide the THR community.
Yeah.
I hear different perspectives on it, but certainly I think common ground we can all have is that in the event of such products being restricted, but even if they're not, the importance of approving safer nicotine versions of them is absolutely paramount.
Information. People need to be informed. They need to know what they're doing. I mean, when my mother and my father started smoking, they didn't know what it was, right? Okay. I mean, my mother's doctor told her to start smoking for her anxiety in the 50s. I mean, hello. Okay, she didn't know. Nowadays, obviously, we know better. Okay, but I think people should be given the information they need to have to make an informed choice. And the thing that's in the THR field is all the disinformation and misinformation in the media, like you said. Okay, all the effluent that is being put out there, and people believe what they're being told. How are they going to get the information? Well, sometimes they're not going to get that information because we're
I'm curious to see what you think why it is. I have a theory. So you alluded earlier about like certain people don't believe in harm reduction or whatever. People tell me like, oh, I don't believe in harm reduction. I say, but actually you practiced it 3 times today already.
Yeah.
Everyone actually, I don't know what to believe in. It's not like a religion. It's like you do it. And you know what they are? Condoms, seatbelts, helmets, less of a Cheesecake Factory cheesecake, which is about 1,000 calories. You'll eat only like a portion of it. I don't eat full dessert anymore. I share desserts. People share appetizers sometimes. They get appetizer each and share an entree. I know friends who do that, not to gain weight. I mean, we're practicing a harm reduction. I'm fascinated in Poland. No, everyone obeys the law. They like stand at a crosswalk, and there's no cars. And I'm looking at it, Type A New York personality. I'm like, I got to cross, but I try to follow the Polish people.
Yes.
So, that's the form of harm reduction. There's something about, and the people who vehemently, let's say, are opposed to tobacco harm reduction, they're the strongest supporters of opioid harm reduction. Good example, Bill Gates.
Yes, exactly.
So, I find it very interesting and sad in a way. And I have a theory as to why. I would be curious to see any comments either of you have that, because that's, I think, actually at the crux of the issue.
Yes.
So you got people accepting harm reduction, even sort of maybe right wing, whatever the expression is, so on and so forth, who might oppose like safe injection zones or medically supervised safe injection zones.
There is certainly an exceptionalism applied to tobacco.
Yes.
We could have a whole long discussion about that, but we are just now coming towards the end of our segment. But I did promise finally to ask you about thoughts for the next decade and sort of key questions and priorities. We only have about 1 minute left, but if you were to name just one thing from your own particular sphere that is going to be critical in the decade ahead, what would it be?
The truth will prevail. It will prevail. I believe so.
Yeah, I agree. I end all my talks with science will inform policy, whether it comes out showing that people who are, quote, pro-harm reduction, sort of make up stuff. It'll show you're wrong, or the people who are anti or whatever. I think you're right. Truth will prevail. Science will prevail. It's going to be a marathon, not a sprint. The answer to my question about harm reduction in this space is I think people and physicians, and especially Americans, hate the tobacco industry so much they forgot about the smoker.
Yep.
And that's the tragedy of it all.
That is.
Science will inform policy rather than policy informing science. That's the dream, isn't
That's
it?
it.
Thank you so much,
Thank
Jazz
you.
and Nancy. It's been a pleasure speaking with you. We're about to hand over, very relevantly now, to a session on the politics of scientific publishing. And I'm going to hand over to Harry Shapiro to introduce that in the main conference room.
Good morning, everybody. Thank you Thank you, Will. Editor of the absolute must-read Filter magazine. Wonderful publication. I hope you are all suitably recovered from last night at the Sphinx. My name's Harry Shapiro. I'm the director of DrugWise, which is a UK NGO delivering drug information online. And I'm also the lead author of the Global State of Tobacco Harm Reduction. I can see people are still drifting in, but I'm not going to stop. I'm going to carry on. I've got two guests with me who will be coming up to the lectern shortly. I've got Sarah Cooney, who's a consultant in science communication, and also Nick Crofts, who is editor-in-chief of the Harm Reduction Journal. And you'll hear from both of those in a minute. Sarah's giving the keynote, and Nick is the responder. By way of introduction, in 2017, British politician Michael Gove declared that the British public were sick and tired of experts. We'd had enough of experts, and he was making a specific reference to the fact that the Bank of England economists had failed to predict the financial crash of 2007-2008. And they'd also predicted that in the immediate aftermath of Brexit, the UK economy would go over a cliff. I'm making no comment about that second prediction, given the state that we're in at the moment, but Michael Gove was determined that we're not having anything more to do with experts. And then along came COVID. And when COVID hit, the BBC and media outlets all over the world couldn't get enough of experts. They were falling over themselves to find every ologist that they could get in front of a microphone. Virologists, epidemiologists, psychologists, pharmacologists. We wanted to hear from these people. We wanted to know what this epidemic was all about, how it was going to affect us, how many people were going to die, how do we cure it, when's there going to be a vaccine? All these questions. We had experts in front of the British media every day giving their charts and predictions as to what was going to happen. There was scientific dispute about how all of this started, and there was genuine concern about the inequalities about access to vaccines. But the scientists were all pretty much on the same page. The race was on to find the vaccines and to find them quickly. And in the end, there were loud plaudits for the pharmaceutical companies for stepping up to the plate. But those plaudits were reserved for one, there was one company that didn't get these plaudits, and that was the Canadian company whose vaccine was refused to be endorsed by the WHO. Why? Because one of their shareholders was a tobacco company. Which, for me personally, that kind of symbolised for me how politics and ideology could trump even the most urgent global public health requirements. Because, as many of you will know only too well, within the world of tobacco control publishing, much science has been subsumed and subverted to the interests of politics and ideology. From scientists shut out from publishing at all, to the most ludicrous examples of bogus science, which has somehow passed muster into the pages of otherwise respectable academic journals. And it seems like the piranhas of public health are only too keen to rip the flesh of academic credibility off the bones of anybody who disputes the anti-tobacco harm reduction narrative. So, is there any good news here? Is there any positives here for those who want to kind of swim in the troubled waters of scientific publishing within the tobacco control world? Well, Sarah thinks there is. some good news to be said, some hope and optimism. So I'm going to pass over to her now to explain. Thank you, Sarah.
Thanks very much, Harry, for that introduction. And I wanted to say it's a great honour to be speaking at GFN. So I wanted to also thank the organising committee, Jerry, Paddy, Jagosh, and Jess for having this topic and also for inviting me to speak. Oh, I forgot about sorry. So here is my conflict of interest statement. And what I'm going to do is talk you through why it's important to publish. And because I know people in the audience may not know that much about publishing, I'm going to try and do a bit of a really fast publishing 101. Also talk about the barriers to publishing. There are some emerging trends in science publishing that I think it's important for you to be aware of. And I will take you through some kind of case studies and personal experiences that I've had. So a bit about me. I trained as a geneticist and I did my graduate work at the University of Toronto. I discovered that although I loved science, my interests were much broader than what you can do at the bench. So I decided to try science publishing, which a lot of scientists end up doing. In order to stay close to science, you go and work for journals. So with my freshly printed Irish passport, I moved from Canada to the UK to work at Current Biology Limited, which was a small publishing company set up by an entrepreneur who was looking to disrupt things. I worked for them for a while and then we were bought by Elsevier. After I left, I went to Nature Publishing Group, so I was working on one of the world's most prestigious journals, which was very exciting, but it's also fascinating to see some of the politics that went on behind the scenes at a very high-level editorial environment. The sorts of papers that didn't get accepted and that were fantastic, and then papers that did get accepted and you thought, well, I don't understand why. And speaking to editors and learning sort of some of what was going on behind the scenes. Most importantly at Nature, I met my husband James. Some of you have met him as well. After Nature, I went to the Society of Chemical Industry, which is a small chemistry membership association. They have a small group of journals that they do in partnership with John Wiley and Sons. And after I left the SCI, I went to another startup. So an open access publisher, Biomed Central, started by the same innovator who set up Current Biology Limited. I was brought in to add to the senior team as that business was prepared for sale. It was then bought by Springer, and eventually Springer merged with Nature. So I worked in scholarly journals for over 10 years in a wide variety of editorial, product development roles where we were looking at launching new journals, and also publishing roles. And when I left BMC, I was looking to do something different. I wanted to do something different with my skills. And then a bit unexpectedly, I found myself in the tobacco industry, initially joining to help improve the impact of the material that was being published on reduced risk products. But then I got involved in other science communication activities. I oversaw the industry's first dedicated science website and also brought in other industry first initiatives, a biannual scientific report, and also the first visitor engagement program for the industry. After I left the industry, I set up a consultancy focused on science communication and engagement, including publication strategy. I'm working with a variety of other tobacco harm reduction experts. It's a bit of a family affair, so my husband did help with the slides, and my little dog, Fergus, is usually found at my feet during the day. Everybody in this room knows that the tobacco industry has been going through a massive transformation in the last 10 to 12 years, away from combustible cigarettes to reduced risk tobacco and nicotine products. There's now a wide range of different types of product categories and an abundance of science that supports their reduced risk nature. So I would argue that a bigger challenge is actually communicating that science and communicating it effectively. So on to publishing. Why should you publish and why are scientific articles important? So the research that you carry out is your scientific foundation, but you have to get it out there into the big bad world. I like to say that manuscripts in peer-reviewed journals are like the currency of scientific credibility. Peer review is a process by which other experts in the field review your material, critique it, improve it, so you know that there's an additional kind of quality and credibility stamp associated with a paper in a peer-reviewed journal. These papers can then be used to leverage other types of communication activities, which you can use to manage your reputation, and also can help in engaging with regulators. I think you all know that publishing in the literature creates transparency and openness and helps you build trust with stakeholders, a wide range of stakeholders. With regulatory dossiers, a lot of that material is kind of hidden in confidential submissions, and I would argue that, and I've heard from other people in the field, that they've been criticized by public health for not getting that material out into the public domain. And again, manuscripts in peer-reviewed journals are a great way of doing that. It also allows you to highlight the incredibly high-quality research that's being done by tobacco and nicotine companies on reduced-risk products. So what are peer-reviewed journals? Well, the sharing of science by manuscript format has been going on for thousands of years. It started in ancient Greece. The first modern peer-reviewed journal was launched in 1665 by the Royal Society in England. And if you fast forward to 2019, the STM publishing industry, that's scientific, technical, and medical journals, had grown to a value of $28 billion annually. At the time, there were 35,000 active English language journals, and around 12,000 of those were indexed to get an impact factor. An impact factor is a way of ranking journals with respect to each other, and it is a metric based on citations to the content in that journal. Impact factors vary wildly in publishing. So top-tier journals like Nature and Cell have impact factors of 40, 50, 60, and sort of journals in the polymers section of chemistry, a good journal might have an impact factor of 3 or 4. So it's a metric that is not brilliant, but it's the only metric that people have, and it's been hijacked by university departments and other stakeholders to sort of push people towards saying impact factor is the most important thing. It's not necessarily. Another sort of fun fact about the STM journals industry is that it was one of only 2 industries that successfully migrated from a print-dominated business to an electronic-dominated business while preserving the same high profit margins. And the other industry was the adult entertainment industry. So STM publishing is a very wealthy sector. It is composed of large commercial publishers, university presses, and learned societies that have some journals. So how do journals work? How does peer review work? Basically, an author will make a submission. All journals today have electronic manuscript handling systems. So you upload your files. The system then will run a series of pre-checks to make sure that you're not a crank, you haven't discovered, fusion in your basement. They make sure it's a real paper, that all the files are correct. Once those checks have been done, it will be assigned to an editor. The editor will then use keywords to identify scholars in the field who can look at your paper. He or she invites referees. The referees, it can often be hard to get referees to agree to look at papers. Good journals look to have at least 2 referee reports. We're starting to see emergence of lower quality journals that are relying on 1 referee report. But anyway, once your editor gets the 2 referee reports back, they read them and they evaluate them, and then they make a recommendation and they invite the authors to revise, or they reject, or they accept. It's very rare for a paper to be accepted on the first round with the journal, and most scientists agree that peer review tends to improve the quality of the manuscript. It's by no means perfect, but it's the best system that we have. Scientists and publishers have been talking about, is there a better way to peer review? And there isn't so far, but it can be a painful process, and it can take 6 to 12 months to get your paper published. This can be exacerbated by the difficulty of getting 2 people to agree to review the paper, getting them to return their referee reports on time. That is extremely painful. You can sometimes have wildly differing referee reports that can reflect bias, and then you often have to get a 3rd referee to sort of adjudicate. And you can go through multiple rounds of revision before you have acceptance. I would make one observation that most journals have very little expertise in tobacco and nicotine. And of course, with the problems with peer review, your manuscripts can get stuck all the time. But it's worth knowing that as authors, you can intervene, you can get in touch with the journal, and you can get your manuscript unstuck. But it can be difficult to work out who you should contact and what exactly you should say to them. It's also worth remembering that journals are typically dealing with hundreds or even thousands of manuscripts at one time. So if you feel your paper has kind of got lost in the shuffle, it probably has. In the paper-based days, I remember a manuscript fell down behind a filing cabinet and was lost for a couple of months. And when I was at Biomed Central, I used to have to deal with author complaints for manuscripts that had electronically fallen between the cracks. And I would discover that they'd attempted to invite 20 peer reviewers before they got 2, and they still didn't have 2 referee reports. And so things do get stuck. And I helped a client recently with a paper that was sort of languishing, reviewed the correspondence, identified what was going on, and we were able to get in touch with the journal, get it unstuck, and then get it published. So there are lots of problems with peer review. And another observation I'd make is that the science publishing industry is this massive industry built on the back of unpaid work by volunteers, the peer reviewers. And the peer review community is increasingly under more and more and more pressure. Journals are receiving more and more submissions all the time. So what journals are starting to do to try and cope with this and try and reduce the burden on their communities is to reject without review. And also you're starting to see transfer relationships between journals. And the best example of this is Nature, where Nature has a reject rate of 99%, but actually there's quite good stuff that's rejected by Nature. So it's cascaded with the referee reports down to the next tier, Nature Medicine, Nature Immunology, Nature Chemistry. And then if those don't quite make the bar there, they're cascaded to a journal called Nature Communications. And then at the bottom of the pyramid is scientific reports. But the key thing is that the referee reports travel with the manuscript, so they aren't lost. Otherwise, if a manuscript is rejected, all the work that those peer reviewers did is wasted. You also see journals experimenting with new types of peer review systems. Open peer review is more common because their medical journals have published the referee report and also the name of the referee. That can actually make it a lot harder to get people to agree to look at manuscripts. There's not as polite as you would be. And you're also starting to see other types of journals. Post-publication peer review journals are also emerging. This is where you publish almost instantly, and then they see reviewers. And what can tobacco and nicotine companies do? I would urge all of you to encourage your scientists to volunteer as peer reviewers. Industry is often underrepresented in peer review communities because industry scientists don't tend to publish as much as academics. Journals can be operated in different ways, and I think this is important because it can help in your detective work to figure out who you should be trying to contact to get your manuscript unstuck. They can be owned and managed completely by a commercial publisher with professional editorial staff. This is how Nature operates. The owner has total control and manages everything. You also get journals owned by commercial publishers with academic editors. So these are full-time professors appointed as part-time editors-in-chief, and they receive a small honorarium from the publisher. And then you get partnerships between learned societies and commercial publishers. So Oxford University Press is the commercial publishing partner for the Society for Research in Nicotine and Tobacco, and OUP publishes nicotine and tobacco research on behalf of the society. The society maintains editorial decision-making and also editorial policy, and the publisher does everything else. So there are lots of barriers to authors getting published. We've kind of been talking about them. It's a big effort to get something written, get it through an approval process, deal with lawyers, find the right journal, submit, deal with referee comments. If rejected, revise, reformat, and start all over again. We see censorship. I'm going to talk more about that in a moment. But the industry can and does publish, even though it's not easy. The 2 largest tobacco companies have published over 350 peer-reviewed manuscripts on RRP science. This is in a wide range of journals, between 70 and 80 different journals owned by quite a big range of publishing houses. But it does feel like it's on considering funded work. Special issues have come under criticism, and a change in journal ownership can be really disastrous. So I'm thinking of Tobacco Regulatory Science, where the original publisher decided to sell, and he unfortunately sold to a predatory publisher, which I'm also going to talk about in a moment. But that meant that the journal basically is no longer fit for purpose. I wanted to take a closer look at censorship. So before I joined the industry, I did a project to examine censorship in journals against the tobacco industry. And my conclusion was that explicit censorship bans are found in journals owned by medical and public health charities that have a small publishing program, so 2, 3, 5, or 6 journals. These journals would be operated on a profit purpose, but the profit is donated back to the society. And what you see is that the editorial policy of those journals has become aligned with the parent learned society's views about the tobacco industry. My belief is that large commercial blanket bans, they're all on record as saying that science should be evaluated objectively on its merits through the peer review process. You do see some examples of journals owned by commercial publishers that have a censorship ban, and often this has arisen with the change in editor-in-chief. So regulatory science and regulatory toxicology and pharmacology used to be quite friendly to the tobacco industry, but when the previous editor-in-chief retired and they put 3 new co-editors-in-chief, they decided that the journal had published too much tobacco work and they would no longer do it. I also wanted to mention medical communications agencies. They also are unable to work with tobacco companies. They typically assist pharmaceutical and biotech companies with publication and other sorts of activities. But if they have respiratory drugs or if they have pharmaceutical clients, often it's written into their contracts that those agencies then can't work with the tobacco sector. Another thing is that, that actually, it sounds like an easy fix, but it wouldn't be, because they lack the specialist expertise that you need in order to sort of navigate things from a tobacco and nicotine perspective. The overall landscape of publishing is changing. So I talked about the size. It's a massive $28 billion a year industry. Traditional journals they're based on subscriptions to libraries. These journals have limited page budgets, so they can publish 120 articles a year. And success criteria is around impact factor. So this is about novelty and attracting citations to that content. And when submissions rise, like they are doing every year, year on year, the only thing these traditional journals can do is reject more as a way to cope. So open access emerged as a disruptive business model around 20 years ago due to the opportunities created by the internet. It was also influenced by a group of very high-profile academics who felt that it was wrong that work funded by governments was hidden behind subscription barriers and that publishers were charging to access this. The business model shifts revenues from library pays to author pays to lift subscription barrier. It was controversial at the time because this model accepts a lower profit margin than traditional publishing. I can tell you a funny story about that another time. I had a friend I used to sing with who was involved in
有一个朋友，他之前就参与到了其中。他说，我读过了所有的背景知识，那确实非常的令人震惊，而且未来可能会发生改变，所以我们能够公开的去阅读这一些公开期刊是非常具有影响性的。当然，有一些它是需要收费的，他们很明显可以在网上看到，在一些网上期刊上，如果这一些期刊，它可能这一个期刊呢叫做科学数据，当然它是关于数据性的期刊。同时呢，我们还 关注到了一些科学而不是新颖的东西。这是因为我们的监管研究要更倾向于一些本质，而并不是一些新颖的东西。所以我们可以看到，第一篇文章呢，它是关于电子烟的气溶胶的，这也是在一个非常具有影响力的期刊上进行了发表。当然还有很多这样的文章，它们并没有具有相应的新颖，但是你会发现它主要是把重点放在了最基本、最本质的科学上面，而且它能够让大家进行阅读。他们希望能够发表更多这样的文章，这就是我们能够从当中学习的。他们很少从道德上面去进行分析。所以如果你想要提前进行准备的话，提高你文章的那个品质，所以最重要的就是你需要去了解这一些能够公开阅读的文章。当然，这一种公开阅读的，它也成为了我们现在发表文章的一个非常大的障碍。如果你有电脑的话，你就可以发表任何文章，这是现在大家所做的。但是呢，如果想要发表一些高质量的文章呢，他们可能会需要来自同伴的一些评论。有一些文章的标题看起来非常的相似，这可能会给大家带来误导。当然有一些组织能够帮助我们去监测到一些有用的文章。我们接下来再简单的看一下对于研究的可操作性，也就是它的实施。有很多的发表文章的人，他们都有相应的研究，他们有一个团队来帮助记录一些学术性的证据，他们也防止其他人进行盗窃或者说抄袭。这对于我们这个电子烟烟草领域来说是非常重要的，因为在这一个领域的政治性是非常重要的，这使得我们整个领域都能够增加自信和相互的信任。当时在第一届这一个相关的研究会议上面就有人提出4个原则，那就是关于诚实、专业，还有奖励制度和可行性。所以我们应该记住你到底应该有怎么样的策略，发表策略，这是非常重要的。我们需要更加公开，更加透明。当然，我还想讲一下关于我自己的个人一些经验。我提到我之前加入了这个烟草领域，我不知道这个烟草行业做了一些，在那之前他做了很多的研究，我也在那之前并不知道烟草减害这一个东西。当我在加拿大，我发现人们对于烟草控制非常的严格。
I overhauled it. I introduced people to the idea of open access, and
我向大家介绍了关于公开阅读的这个理念，我也向大家介绍了对于员工还有期刊之间的交流，这样的话能够接受大家的接受度，提高大家的接受度。我之前也看见很多关于低风险产品的很多的介绍和策略，这也是我非常自豪的一部分。你可以不断的提高，你不断的完善 文章的质量，比如说可以通过一些文章的润色来提高。同样呢，你可能会遭到拒绝，但是呢，你需要记住不断的去准备，与一些期刊不断的保持联系，甚至是可以跟他们建立很好的关系。在这个出版界，有很多人对于烟草有着不同的观点，所以你会发现每一个人都愿意去进行交谈，而且他们都非常的开放。所以，在一个单一的产品上面，如果你能够收集到各种不同的信息的话，这是非常好的。同样，对于一些特殊的话题，可能会有一些批评或者说不同的见解。所以有些时候呢，可能会不太如意。当然，还有一些公司它所需要一些费用来进行阅读。之前我和一位编辑讨论过，在一篇文章当中，作者可能会需要回答100多页的评论，所以我认为，如果能够收集到各种不同的文章，这是非常重要的。而且现在，在这一些领域，在一个特定的话题当中，这一些编辑的工作是非常重要的。他们需要去考虑、去接受一些具有争议的话题。这就是为什么他们有的时候会对于一个特定的领域，比如说电子烟非常感兴趣。总共有22篇文章，你会发现有些来自学术，有些来自研究机构，来自一些工作。
Who was deeply concerned about one of the articles and didn't believe it had gone through peer review. And the Wiley staff were wonderful because they emailed myself and the other guest editor saying, "What's this? What's going on? What's wrong with this guy?"
他们非常好奇到底发生了什么事情，所以我们就分类了很多，摘选了很多的内容。他当时就回来说非常感谢你们的担心，你们的关心，所以你可能会需要写一篇正式的信给到我们的编辑。每一篇文章都在打印之前或者说出版之前，可能会先在网上进行出版，但是打印的视频是在今年夏天。那目前我想强调的是，这目前的最大的挑战是要研究更多的关于烟草减害的这个科学。其次呢，我们要将它拓展到更加广阔的领域，而且发表这样的文章也是非常有必要的。我想你们的投入一定要保障自己的质量，因为这一个科学期刊和整个大的方位它正在发生改变，所以你需要有一些特别的建议。但是呢，这一些机会也创造了很多的机会，也创造了很多，也带来了很多的风险。所以毫无疑问的是，我们需要更加的开放，而且我们需要不断的去测试。那我们现在来到最后的问答环节。非常感谢 Sarah。我学到了很多，这让我受益匪浅，非常感谢。 我还想提几件事情。我想借用一句话，我们不再需要任何的专家。这是来自美国 NASA 的一个非常有名的专家。我是澳大利亚人，在这个房间的人应该有大多数人不认识我，但是我之前有了解过这个减少危害的事情这个主题。在过去的35年，我一直在研究减少危害，包括和一些非法药品的使用的危害。好，我们来看一下这个我的幻灯片。说到这个烟草方面，我已经吸烟有39年，我每年呢，在这39年内，我每年都会，从我的朋友还有我的同事那里去问到一个问题：为什么最终我真正的禁烟了？我之前参加过了一个活动，它是关于促进人们健康的，我非常愿意去谈论这一个活动，但是它并不是我今天来到这里的理由。我对于烟草减害的最大的这一个贡献呢，就是我是危害减少的一个期刊的编辑。我写了很多文章，是关于我所看见的，在不同情况当中的相关政治的问题包括在一些首都，他们可能在不同政党之间有一些斗争，还有一些是关于医药方面的争论。但是当时我刚接触这一个烟草减害，所以我还没有做好完全的准备。我想引用一个人他所说到的，就是公共健康这个问题。我想现在这个烟草减害已经融入到了其他领域的危害减少当中，所以我想要简单的谈论一下，以及我们可以做什么。我昨天晚上也和Maria 还有 Alex 他们进行了相关的对话，谈论这个烟草减害的事情，它现在已经成为了危害减少当中的一个主流。而且之前在墨尔本也举办了相关的会议，我们开始意识到这一个危害减少是人们对于不同话题，对于一些困难，我们所做出的这一个反应。有很多人他在晚上的时候
supplements in alcohol, people dependent on alcohol, is worth remembering because there was
人们
actually
非常依赖于酒精，这是我们需要注意的，因为它可能会对公众健康产生很大的影响。它和这一个烟草减害有的情况也稍微有一些不同。
So let's not forget that history.
我们需要记住我们过去所发生的相关的事情，那我们还需要找到朋友，找到同盟。这个国际的烟草减害的组织，他们所举办的会议在持续着关注对于非法药物所相关的一些危害。当然我也看到有一些期刊，它就针对于这个危害减少提出了他们相关的理论，包括人们的行为可能会产生不同的影响。我们是如何定义烟草这个危害减少相关的政策的？比如说一些政策和项目，我们尝试着减少这个对于危害对于公众所带来的影响，以及这一系列行为可能会带来的一些经济影响。我们现在正在建立一个期刊的，我们已经建立了一个期刊的这一个编辑同盟。你会发现在这里有很多，我们涉及到了不同的领域，比如说包括一些赌博方面的危害，药物的危害。我研究了很多，而且我也涉及到了不同的领域。
Section that we started, and you can see one of our section editors there is somebody I think known well to this conference, Florian Chabine. We're also looking to broaden our reach to the community and support from the community. And Dr. Annie Madden, who was the Executive Director of the Australian Intravenous League, Australian Drug Users Group for 15 years, has taken on the role as Associate Editor to build our relationship with that community. And I'm looking for further ways to build relationships with other affected communities to bring them into the publishing process, to bring Annie, for instance, is guiding a process to develop peer ethical guidance for peer review for research that's based around peer researchers. My own prejudice is that in a simplistic way, often
个人的想法呢是，我们在那个危害减少方面的政策不是很合理，我们应该关于危害减少方面的原则，以及它可能会最后带来的一些影响及意义。一个大概的估测就是85%的用户他们并没有意识到，包括一些犯法或者是公共健康方面的问题，他们并没有健康方面的问题，但是呢，我们需要在各个领域去去使用去完成这一个公共健康方面的政策。这好像在一定程度上是有作用的。当然 ，Sarah 她之前也谈到了一些非常重要的影响因素。在过去的6年，你可以看到。如这个图表所示，它的这一个数量在不断的增加。当然，这就意味着这个危害减少的相关的理念应该运用到不同的领域当中，这是非常必要的。当然，我也我对于 Sarah 之前讲的一些关于挑战方面的观点是非常赞同的。承办的一些 同伴的评论对于我们发表文章来说是非常重要的。我们会发现有一些人他是有资质的，但是有一些想成为有资质的人去进行评论，但这并不是每一个人都可以做的。所以它是一门技能，需要你去掌握，需要你去学习。有很多的这个学术型的公共研究是，现在有一些人去研究的方向。我们也发现有一些年轻的研究者，他们来帮助他们进行写作，或者说评论，帮助他们。所以现在我们需要找到更多这样的人。当然，之前 Sarah 她也提到了这个关于公开阅读的，我还引用了我的同事他的一句话，我现在正处于我现在正在墨尔本大学的这一个公共领域进行学习和研究。而且 Sarah 她之前也提到了这一个志愿制度，也是我提到的这个老板他所正在创建的一个体系。所以特别是当你有机会能够去阅读一些期刊的时候，
that the value that was given once upon a time to
这一
editing
个领域它是有非常有价值的，能够帮助我们去编辑、去阅读相应的文章，而且能够帮助我们去建立一个很好的学术环境。你能够获得你想要阅读的期刊，当然那一些发表文章的人也能够获得相应的利润。我现在正在尝试着去扩大这些文章的权限。有很多人，他们可能没有从事这一领域，当然也有很多人，英语是第二语言，所以会存在很多的困难。当然也没有太多的资源能够帮助人们，特别是那些来自低到中等收入国家的人。当然我有第一手资源，我花费了很多的时间去了解那一些有着很多能源，很多资源以及非常有意志力的一些国家，他们在这一个烟草减害方面非常的感兴趣，但是呢，他们并没有足够的能力或者说支持去发表相应的文章。当然现在在这一领域呢，有不同的研究，有很多人都意识到，这一些文章是非常有价值的，所以我也非常同意 Sarah 他之前提到的，这也是第一次我和那一些发表文章的人谈论，他们会发现有一些政策进行了发布，但是并不接受这一些发表，而且这不能够用钱去解决。我还和 Mara 进行了一系列讨论，我们讨论了现在的主流，也提到了对于编辑有相关的政策。我们可以看到，这是一个例子，你会发现，它显示了其他国家的一些发表情况。你会发现，这上面的国家包括加拿大、澳大利亚，还有 美国一直到非洲，还有亚洲，你会发现这一条绿色的线它在不断的下降，这是因为人们在发表文章所面临着非常大的困难，特别是在这些低中等收入国家，这也就是我们所需要去解决的。这就是我所有想发表的内容，谢谢。我不知道从哪儿开始，你们所说的内容都非常的有用，而且非常的让人受益匪浅这告诉了我很多的信息是我之前不知道的信息。在我让其他观众进行提问之前呢，我也想问一些问题你们目前都是尝试着让那一些烟草公司的人们去进行相应的发表，但是我也认为这是非常困难的。
Getting these and also the conflict of interest is quite interesting.
当然，人们利益之间的冲突也是值得人们去关注的，非常有趣的。所以，当你的文章发表的时候，它有一些呢是反对这个减少烟草的。我想这是利益上的冲突。当然，之前也没有人这样说过你不能够永远的去，你不能够去很好的解决这个问题。所以你要知道，当你的文章被某一个公司进行资助的时候，可能会存在一些疑问。有一些人他不能够很好的获得他们想要的资源。当然，审查的这一个机制呢，不允许很多的文章或者说期刊进行发布。当然，他们也有其他的选择。我想我们需要去做一些工作，来保障我们研究的政治性，尝试着去解决这个烟草减害方面的利益冲突。
Thank you, which kind of leads me to my kind of next question before I throw it open.
在让观众回答问问题之前，我还有一个问题想要问，那就是。
Some of the stuff he reveals in terms of methodologies, and this is almost on a weekly basis that all this nonsense is getting into journals. What's the best, as well as getting your material in there, are there strategies for actually challenging bad science?
You can use letters to the editor to challenge bad science, and there have been a couple of examples. Some of Brad Rodu was really successful in getting one of the Stanton Glantz articles retracted, which was deeply flawed. It's a huge amount of work to try and get someone to do a retraction like that. But, again, it's another thing that we should be collectively doing, is challenging the bad science. And that recent paper that Clive critiqued, I was really shocked that Tobacco Control didn't retract it, that they allowed the authors away with it. And again, it would be interesting to see what someone like Committee on Publication Ethics what sort of view they would take of that particular case. I don't know if anybody ever took it to COPE. And I know COPE isn't perfect, and
It isn't that strong, but it is something that focuses on publication ethics.
Did you have any? Okay, so I'm going to throw this open to people who are online and also out here. I think Clive mentioned that there is a bit of a dead zone in the corner here because of the searchlights in the eye. So if you've got questions, best to try a bit, because otherwise I ain't gonna see you. And Mara, oh, can you wait for the microphone thing as well?
Thank you. Is it working? Thank
Yeah.
you. Marewa Glover, thank you for mentioning me, Nick. I just want to acknowledge or add to what you said, especially because Harm Reduction Journal and the tobacco section is so relevant to many of you here, and you could choose to submit at some point because of our focus. So how I got into that position, Jerry and Paddy approached me. They had approached 50 people to consider becoming the tobacco section editor, 50 people. So this sort of censorship and fear of backlash and what's going to happen to you is very widespread. And I had just set up the my centre. I shouldn't say stupidly. It's been a learning experience, but I took it on. So I think it's almost 5 years or something. I have now shepherded 100 papers that have been submitted to the tobacco section. And it's all voluntary work. It's a lot of work. And I just want to take the opportunity to apologise if I'm slow. I have a huge program of research myself, and I have to fit this in. And I also want to take this opportunity, if I can, Harry, to ask if there is anyone else here who would be interested in being an associate editor, you know, maybe a younger upcoming scientist who would like to learn, you know, what's involved and be mentored. You know, I've been looking for somebody to join me because we are getting more and more and more submissions, and I'm having to use this reject before review because I'm getting stricter and stricter and narrowing it down and the criteria for even getting through to go to review. Okay, thank you.
Thank you. Well, it's actually quite encouraging. You're getting so many submissions, of course, which is good news. Gentleman in the front row here.
Hello, Richard Prone from Safer Nicotine Wiki. It's very, very good that I've actually heard what you've said, because we actually share your pain in some of the challenges you face. I was just wondering, we're sort of a layer on top of your journals and published work, actually presenting that to the public and making it available and accessible for advocates and people to use and to be able to quickly reference what they need to find. One of my questions was, how can we work together better to actually get the information out there quickly so that people can use it? And also, I mean, it was just to say, you know, we should talk and we should actually tee up cooperating as far as we can to actually help to get the right information to the right people. Thank you very much.
Can I? Yeah, I'm going to pause. I just wanted to, for my absolute discredit, I haven't looked at Safer Nicotine Wiki and I damn well ought to. But so do you make direct links to the sort of published material that we've been talking about?
Yes, indeed.
Right. So is it?
Most of our pages contain short summaries, bullet points,
Right.
ways to make the research more accessible to the general public.
Right.
And then we would link directly to the full article for those who want to read it.
Okay.
We've got a process with an arrangement with Filter Magazine, where we're doing that, and I'd be delighted to talk to you about
Yeah, absolutely.
making an arrangement with you. Definitely.
Thank you.
Likewise, there are probably other things that should be connected in with Safer Wiki.
Yes.
If it exists.
The other thing I was also going to suggest is there are a number of people who work in the background for us, just sort of reading through and checking through things. I'm wondering whether they may possibly volunteer to do some
Being a peer reviewer?
review
Fantastic.
or to look at technical aspects or
Yeah.
things like that.
I mean, so, you know, journals are so desperate for peer reviewers, and I mean, everybody should be added to Marawa's list of potential peer reviewers. But journals are so desperate that they will, they'll try somebody out even if they're a bit skeptical at first. And every time you get a peer review report back in, the system I've been using, it asks me to rate the quality of the peer review. Did it come in on time? Was it detailed? You know, what was the quality of the peer review? So you know whether you should use them in future. So if people from industry do high quality peer review reports, or
Yeah.
they don't necessarily have to
And
be.
the other one was purely, just as a request to say, we do actually need more people to volunteer for the wiki, even if it isn't to actually write the public facing pages, to just go through, read, because scientific papers take some time to read and actually pull bullet points out of. If people would be willing to volunteer to just do that, or if you as a publisher could forward us on something that we can use as a starting point, it would streamline. We obviously have the same problem as you, time constraints and being very busy.
Okay, that's really helpful.
Great, thank you.
And I'm absolutely going to go and have a look at it now. I promise. Okay, we've got one online question here, and it's all about the future of the peer review process. It says, given the instances during the pandemic where actions claimed to be science-based were later revealed to be influenced by moral positions and the prevalence of false findings in peer-reviewed studies, I'm curious about the future of the peer review process. In your expert opinion, I think this applies to both of you really, where do you see the peer review process heading in the next 10 years? Do you think there will be a renewed emphasis on building trust in scientific research, or do you believe there is a risk of the system succumbing to regulatory capture, prioritizing population perception control over the pursuit of truth? I can't give you a whole day to answer that one, but any thoughts?
I mean, I think I went to a talk a long time ago that said peer review is the worst system ever invented, but there's nothing else. There is no alternative. So peer review will persist. I think that the importance of research integrity and the efforts that publishers are putting into research integrity departments, I think that will hopefully help to improve things with peer review. Publishers are also starting to offer sort of training courses for scientists to learn how to be a good peer reviewer and what you need to do. And I think a lot of that's happening because as the shift to open access continues, the author is the customer, and so serving the authors better is what publishers need to do. Whereas in olden days, the librarians were the customers because that's where the revenue came from. So I think it will persist, and hopefully it will get better.
I couldn't agree more that it's the worst of all systems except for all the others. Yeah, absolutely. And I think, but it works when it's taken seriously. And that was my observation, that I'm afraid that I watch my colleagues in public health, academic public health, failing to take the process as seriously as I think it should be taken. The other thing that comes in that hasn't been mentioned is artificial intelligence. And where's that going? And I know nothing about it. I'm too old to learn about it. Bugger it, but I had a conversation with somebody else, and I said, given the difficulty of finding peer reviewers now, could we make use of the ChatGPT or something like that? And he said, no, we tried that. And he said, the problem at the moment is that it doesn't just create reviews, it creates references. And I didn't realise that. It actually, you can do it, but it comes back with 5 fake references that it's created. But I don't think that's only temporary. We're only at the start of that whole AI thing. So I think there's going to be something with AI in the future.
I think Alex had his hand up. Down in the second row, thanks.
Thank you. Alex Wordak, Australia. My question is to you, Dr. Cooney. I was surprised you didn't make a reference to the International Committee of Medical Journal Editors. And I wonder whether you think there would be scope for individuals or organizations, particularly this conference, to assemble the kind of comments you've made and pitch this to that very important committee.
I don't see why not. And you're right. I should have mentioned ICMG. There was just so much to cover. But I think that the societies that support the publishing industry, that we need to look at leveraging them more or raising these issues to them more to see if something can be done to improve, to improve the politics and to improve on, or at least get, well, the short answer is yes, we should. And I'm happy to talk to you about it after and plan something practical.
Thank you. Colin Mendelsohn from Australia. One thought I had was the possibility of linking acceptance of an article for publication to subsequent peer review for that journal. Have you ever thought of saying to the authors, well, we'll accept your, but we have a condition in which authors are required to peer review two articles? That was just one thought. But what I wanted to particularly ask Sarah about was, you mentioned the obligation of society journals who are aligned, they have an editorial policy aligned with their organisation. Now, I have a problem with that because I don't regard that as a scientific approach. So that they publish articles that have a particular bias, which go into the media, which are presented as scientific evidence. Then they refuse to publish articles with opposing views, which is what science is all about. And this has happened to me, and I've discussed with Nick with an article that I wrote in response to an article in the journal about tobacco treatment, which totally neglected vaping. I wrote an article which they rejected point blank. They only accepted it when a whole lot of other people signed a letter to them saying, you can't ignore this, and they published it. Then, to cut a long story short, they 3 months later threatened to retract it based on a spurious conflict of interest. And I've spent $10,000 on a lawyer having that overturned, although it hasn't been fully overturned. But my point was that I felt this was very unscientific, that they were putting out information, presenting as scientific, balanced information, which wasn't.
Well, it is wrong. It's completely wrong. But the project that I did was to try and understand where the censorship bans were coming from and to try and predict whether whether every journal was going to end up with a censorship ban. So I disagree with it, just like you do. And I remember when the BMJ instituted its censorship ban, and I remember I helped write the letter that the chief science officer sent in to the BMJ explaining why this was the wrong road to take. The editor just said, don't care, not going to change it. But the letters editor identified it as an interesting piece of content and upgraded it from the online rapid responses and included it in the print issue. I mean, maybe there's a way to get these organizations, as tobacco harm reduction makes more progress and as there are more products and the smoking rates continue to come down, maybe there will be an opportunity to persuade these organizations to revisit their policies. I agree it's completely wrong, but is more of an observation and an explanation for why those organizations have decided to censor wholesale a complete industry.
We've got 5 minutes left and hands up going all over the place. Right, lady in blue there, then Norbert, then Ben, then Jenny, in that order. Thank you.
Hi, I'm Ariel Celia. I work for Pinney Associates and we consult for Jewel, and I also help Clive out with his weekly PubMed review. Both of you mentioned the difficulty in getting peer reviewers and the high profit margins of publishers and the unpaid labor. So are there conversations being had at the higher levels to compensate peer reviewers? So like, for example, I've seen some offers like if you review for a journal, they give you a discount on the next publishing fee, but academics don't actually pay that out of their own pocket. So is there conversations had about flipping that and offering an incentive? Thank you.
I can only speak for my journal, and it's been an ongoing discussion that I've had with my publisher ever since I was editor, and we're making incremental progress. But if anyone's got any good ideas, I agree with you about the discount. They will go to the extent of considering a discount, but for academic publishers, authors, that doesn't mean anything.
And I would need to check back in with some old publishing colleagues to see what to take the temperature on that, but it's only going to get worse. And I've seen some journals start to experiment with paying for peer reviewers. And I know that was, I'm aware that's happened in some journals. Some editors will offer authors a fast track process for several $1,000s. I don't think it ever really gets publicly disclosed. So there are things going on, and they should develop some best practice around this, because it is a very wealthy industry and there should be a way of compensating referees.
Okay, nice and sharp, Norbert.
Hello, Norbert Ziller-Schmidt, German Consumers Organization, IGED. Considering all the junk science that passed peer review in several journals, I think, is there any possibility for serious journals to facilitate replication studies? These are seriously lacking. We need more replication studies that evaluate the original junk and validate and show the flaws in a real study. Is there any way for real journals to incentivize the scientists to do replication studies, to publish them?
Okay, I'm going to take the next two questions and then we can sort of bundle them together. Ben, this gentleman here. What happened? Okay,
thank you. I'm
quickly.
Wiberg, the snus guy from Sweden. I find something very, very disturbing. Scientific publications of very high importance. I Googled while you were talking here, I Googled smoking cessation, Dr. Ramström, one of the Michael Russell Award winners. What can be accomplished by reducing smoking prevalence? The Swedish example. It has 20 views on academia.
Okay.
And as we go on and on, I would like to support Richard Pruin of the Safer Wiki, trying to make these scientific publications, which are written in a scientific way, but are for normal people perhaps a bit boring. You don't get it.
Okay, thank you, Ben. Thank you. Can you get Jeannie in and then we'll have to wrap it up?
Okay, first of all, I just wanted to say to Nick, thanks for reminding about Bugger Up. My mum was a member and I used to get dragged around to all their meetings. Anyway.
Now I feel old.
Sorry about that bit then. But my question is more serious one, and it relates to this industry as compared to the pharmaceutical industry. clearly when you read publications, you see heaps of things from the pharma industry, which seems to not apply the same rules. So just from your perspective, how do you see the pharmaceutical industry and its ability to publish on new things and our industry not?
Well, I think the pharmaceutical industry has vast volumes of manuscripts because there are huge numbers of drugs that they're working on. They've got, every big pharmaceutical company has teams of publication planners developing material for journals. I think that the tobacco industry can publish. I think it's just a bit tricky, and you've got to, but I think it can publish, and I think well, I think the evidence is there that we can publish. It feels hard, but it is still, there are still doors that are open, good journals that are willing to take the research, and it's a matter of finding those and getting to them first, rather than going to a few journals that reject you and then adding more and more and more time. But I don't think it's impossible, and I you know, I am optimistic still.
Okay, thank you. Right, very quickly, Ben's point about the value of Safer Nicotine Wiki, I think, is established and is a good enterprise. As far as Norbert's question about replication studies, I don't think the publishing industry is going to do anything about that. I mean, that's just down to university research departments, I assume. But I'm going to wrap it up now. I'm going to say thank you very much to Sarah and Nick, and big round of applause, please.
I'm Carrie Wade. I'm the Senior Manager of Global Scientific Engagement at PMI, but I cannot stress enough right now that due to the last minute change in hosting a panel, which is my first panel I've ever chaired, my views today do not necessarily represent those of PMI. So please keep that in mind. Today we're focusing on 10 years of science and what we've learned, and I will change it a little bit with my questions of what do we need to learn in the next 10 years. On our panel today is Summer Hanna from BAT, who is the head of scientific regulatory engagement, focusing on product categories, and today she'll be talking about oral and heated. And then we'll move to Jaz Alawalia. To me, he's the most well-known for investigating how tobacco harm reduction affects minority populations in the US, and he's published over 375 papers, many that are focused on tobacco-related health disparities, and he was the chair of the study section on health disparities in equity promotion. And then Dr. Amalia from Indonesia, and she studies oral health and is the principal researcher for the SMILE study, which investigates the oral health implications from switching to from cigarettes to non-combustible products. About a week and a half ago, I was in Hong Kong at the Asia Pacific Dental Conference, where one of my colleague, Yvonne, presented on some oral studies. And so I learned a lot. So I think this is very interesting to learn about. And then we'll move to Bern Mayer, who does a lot of work on nicotine toxicity, and he's spent a lot of time evaluating the actual estimate of nicotine toxicity. His background is in pharmacology and toxicity, focusing on cardiovascular pharmacology. So thank you, and I will move to you.
Thanks, Carrie, and really appreciate you stepping in at the last minute like this. And thank you all for joining us this morning. So when I was asked to give a summary of the science on heated tobacco products and oral nicotine pouches in 7 minutes or less, I felt a bit intimidated because it feels a bit insurmountable and like boiling the ocean to consolidate all of that information in such a short period of time. But one of the things that really struck me about both of those product categories was, while the scope of today is the last 10 years, really the origins of the story here go back 40 and 50 years for both of them. And starting with heated tobacco products, having grown up in the Reynolds world, I can't help but start with Premier and Eclipse. And if you've ever seen the volume of science that really began the foundations of learning for the heated tobacco product category, and the Premier monograph that, if you've not seen, makes a great doorstop because it's about this big, and thinking that 40 years ago, we were already considering what the last 10 years today would look like for the heated tobacco products. And then in 2014, with the introduction of IQOS, and fun fact, in 2015, there was a small resurrection of Eclipse known as Revo, which if you were ever in the great state of Wisconsin, you'd be familiar with. But then in 2016, the introduction of Glow, and that really just changing the landscape of what heated tobacco products would look like, and understanding and creating so much scientific evidence that really substantiates that 95% reduction in toxicants through our chemistry studies, the breadth of preclinical evidence that's out there. Most recently looking at studies around the 360-day study for tobacco heated products, where you're looking at over 500 subjects and you're seeing, almost 80% product compliance when you get people to switch to a tobacco heated product, and that translating into a 94% reduction in toxic exposure. And that's amazing. And then you can combine that even further with the great work that's happened in Japan, where you can track the introduction of heated tobacco products. Then you can look at hospitalization rates, and you can see that correlation, that reduction in hospitalization associated with the introduction of the heated tobacco products in Japan, and just the contribution, the positive impact to public health that that has. And it's really hard to argue such a compelling story that's really just over that last decade been built into something that's come to life for so many people in so many different ways. Switching over to oral nicotine pouches, and forgive me if I slip into some very industry specific terminology, and I'll try to keep to avoid that. But thinking about the Swedish experience, and yesterday, if you were at Isentech, the great work that was shared by colleagues at PMI, Swedish Match, and Altria, I certainly won't do the hours that they had justice in the next 2 to 3 minutes to talk about it, but they shared so much insightful data and thinking about how oral nicotine pouches build on that great foundation that you see in Sweden with the introduction of snus. And then even this week, taking that a step further in the release of the Smoke Free Sweden report that says, when you think about the Swedish experience, that story, the introduction of all of, not just snus, but oral nicotine pouches, a wide variety of other reduced risk products, and that in Europe, you would have had the 3 million fewer deaths and 103 million additional life years if you had seen that same kind of adoption of reduced risk policies. Thinking, again, recently with oral nicotine, and I think, Carrie, you touched on this, it's not just where we've been in the last decade, but where we're really going. And I think you see for oral nicotine, a good example of where we're going next is the science really working. I think we have set the foundation for the story associated with reduced risk products and what they can deliver. But now it's about thinking about what the questions that we receive associated with those are from regulators, from people who are skeptical of novel product categories, and how we respond to those. And so I think about the BFR report that was released in Germany and thinking about nicotine ceilings, that 16 milligrams pouch limit, and how we start to think about those kinds of scientific questions and preparing for that journey. And for me, that becomes really important, not just with the insights that we've already generated, but really where we go next. So I think I'll pass it to you, Jazz.
Great, thanks. So I was asked to cover e-cigarettes and that technology with regards to the past 10 years. But I think, as Carrie said, the next 10 years are probably more important. I look to the future rather than the past. And I think about other industries, and I think that innovation is going to become key, right? When you think about, I remember when I bought my first 30-inch LCD TV many years ago, I paid $3,000 for it. Now you can buy a 30-inch TV for $129, I think. And if you think about hybrid cars or electric cars, the same thing. The first cars, I don't know who they were, Toyota something, it went from 0 to 60 in like 10 hours. You're pressing the gas pedal, and I'm sort of a heavy leaded fast driver, and now you have Teslas that can go 0 to 60 faster than a Porsche. And then you have autonomous driving and so on and so forth, and it wasn't safe. There were some accidents, there were battery fires, but this is the wave of the future in the automotive industry. And the very companies that sort of put out tons of carbon emissions, Ford, and so on and so forth, they are all on the bandwagon. And likewise, I think we see the industry, the tobacco industry, switching, whether it's PMI or Altria with their tagline, smoke-free future, or X number of revenue dollars from smokeless, non-combustible products. As a physician, to me, these are all very, very good things. And I think that we're going to see more. I personally think, obviously, that a fourth generation e-cigarette is both safer and better way to deliver nicotine than the first generation e-cigarettes, the Cigalikes, or whatever the case may be. And I think we're going to see more innovation. For example, I know that Juul 2 is available, I think, in the UK, not in the US. And there's some technology, which I'm not an engineer, which makes the delivery of the nicotine better, whatever that case might be, so that you have less inhalation, but more nicotine, which is, of course, from a physiological standpoint, the goal. My conflict of interest, we all have them, is that while I'm an academic and I do research funded by the government, I'm also a equity owner and chair of the scientific advisory board of a startup company called Cunovia. So Cunovia is working on a delivery device. Some of you saw it on Tuesday when Brian Quigley was there. Brian used to be at Altria. And we are working to develop a device to deliver nicotine through a medication route. So through the FDA, it will be a prescription product. So it won't go through the Center of Tobacco Products. It won't be a vape. And it doesn't use a battery. So there's theoretically no thermal degradation products. It uses what's called a vibrating mesh nebulizer. No idea how it works, but I think it's breath actuated, but it vibrates at such a rapid speed that it then aerosolizes the liquid with nicotine into these 5-micron drops, which is invisible to the eye, just like an e-cigarette, and then it goes down to the alveoli and works. I mean, the lung and the nose are the two best vehicles to take in nicotine if you want to emulate the pharmacokinetics of a cigarette. So I think there's going to be innovation in the medicinal route. And by the way, just the fact that there is a medicinal route doesn't mean or speaking for myself, don't feel that there is a space for recreational e-cigarettes, if that's what we want to call them, that go through the Center for Tobacco Products in the United States and that are available to consumers at shops, wherever they may be, so that there's much choice. I'm a big fan of choice. I like different coffees. I like different flavored candies. I like different kinds of cereals. And I think, so therefore, I'm a fan of flavors of e-cigarettes. I don't know that we need 75,000 flavors, but I think some flavors are very reasonable. So I think there's going to be a lot more innovation, and the products will only get safer. We'll better understand the science of PG and VG. We'll better understand the science of battery, the metal coils, and the leaching of metals, and so on and so forth. And I think the products will just get safer. They will always have nicotine in it. So I think, as Neil Benowitz says, one has to decide, is there a role for recreational nicotine in society? I know that the audience here probably feels the answer is a strong yes. And I think in my case, I think it's also yes. I mean, some people like to compare nicotine to caffeine. I don't know if that's the best comparison, but I think, it's a legal product. It's a product that people enjoy. It's relatively not dangerous, if that's the way to say it. Surely doesn't cause cancer, even though 80% of American physicians think it causes heart disease, COPD, and cancer, which it doesn't do any of the above. I think that with regards to, often you'll hear from people, we have no long-term data, we have no long-term data. And I think, as each year goes by, we have more data. And I think the snus example in Sweden is an amazing sort of real world example of what has happened over 30 years. Hannah, say your first name or Summer. Yeah, I got it right. I always do that, sorry. And we've met a number of times. Summer, sorry. Summer talked about the Japanese data with heat not burn and the hospitalizations, and that's hospitalizations, and then we'll know more about incidence, that takes longer, and prevalence, and so on and so forth, of COPD. I think we're going to see the same thing with e-cigarettes. We don't have that kind of epi data, but I think we're going to get it from New Zealand, and we're going to get it from the United Kingdom, where there's a high acceptance usage of these products, and we need that kind of data. The Cochrane review, which in the world of science comes out of Oxford University in the UK, is sort of an unbiased, non-industry funded, clean scientific organization that does meta-analyses and reviews. And they have said there is very strong evidence that e-cigarettes help people quit smoking, if that's what someone wants to use it for. The United States can't decide what it wants to say, the federal government, but the National Academy of Sciences issued a report in 2018, about 5 years ago, I think 2018, saying that there appears to be evidence for it. It's a cautionary statement, but that's old data. And now if it's updated, there are a number of clinical trials that are done. We published the first one using a 4th generation pod. It happened to be Juul about 2.5 years ago, which showed strong evidence that it helped people quit. There was significant reduction in biomarkers of exposure and harm. And interestingly enough, that with dual users, people who smoked and used e-cigarettes, this is always a big concern. People go, oh my God, they're going to be using e-cigarettes and smoking cigarettes. It's more dangerous than smoking cigarettes. But turns out that's not true early on. So early on, what happens is that when people are dual users, let's say they're using vapes to get off cigarettes to substitute, and they're using both, early on, they tend to be high e-cig users and low cig users. So in our study, at the end of our measurement time period, which is short term, 6 weeks, people were only smoking 2 cigarettes a day, down from about 15. Now, if you follow them over another year or two, what naturally happens is either they completely quit they're combustible cigarettes, which is not very common spontaneously, or they actually end up, unfortunately, going back to more combustibles and rarely using the e-cigarette. And there's been some papers, Mohammed in the audience published a nice paper from the PATH data set looking at dual users. Ricardo might be here in the audience. Ricardo Blows, Chris Russell, myself, and some others have 2 papers. One has been accepted, one I think is in review, which use varenicline versus placebo for dual users. So people dual use and you give them varenicline versus placebo to get off the combustibles, but encourage them to stay on the e-cigarette. And it worked very well. So that's one important thing to remember about dual users. So people think dual users is like, the never bad land and so on and so forth. I view it as for someone who wants to get off combustibles, it's not a great place, but not a bad place. And then you can do something about it. And then for people who want to quit vaping, there are people who want to quit vaping. This study showed that in fact, varenicline helps people quit vaping as well. So I think there's going to be more innovation in the field. There'll be more choice. Pouches are an incredibly safe product. They're basically nicotine gum. I would love to see the industries take the pouch through cedar as a medicinal route. They're not going to do it, of course, but I think they should, and it doesn't prevent them from marketing it both as a product for consumers and as a medicinal product, but I'll leave that for the corporate people to figure out. So I look forward to the Q&A.
Is it me now or? Okay. Ladies and gentlemen, it's a pleasure to be here. First of all, I apologize. I cannot impress you with a fancy car. I'm driving a VW Tiguan with a diesel engine, so I really appreciate your car. And I cannot. And
I don't have a Tesla, just for the record. I get combustible Subaru.
Okay.
Which is less fancy than a Volkswagen Tiguan.
Okay, and the second thing is I cannot impress you with any clinical studies. I'm not doing this. I'm not from the tobacco field. I'm an outsider. As has been mentioned, I'm in cardiovascular pharmacology. I'm a pure scientist and just stumbled into the field of tobacco control. So why I'm invited here, the basis is one paper that I published a couple of years ago where I corrected a little dose of nicotine. I corrected it by a factor 10 or 20 upwards after 150 years of misinformation. And I think this is the basis why I get invited to this kind of conferences. It's a good, fine paper. I won't talk about this. I provided a PDF file if you're interested, and you can download this. And I explained the history also of the discovery of this little dose, how everything started. I don't talk about this. So what should I talk about? I don't know. I accepted this invitation under the conditions that I don't have to give a talk. Yeah?
But to be clear, you do have to talk.
I have to talk, but not to give a talk. Yeah. But then suddenly I saw in the program burned 7 minutes nicotine, and I complained. Jessica noted. Yeah, I complained. I said, come on. Yeah? But this is the tricks of the girls. The trick of the organizing girls. Anyway, what could I talk about? I thought I'm really not prepared. But I think we all agree that the war on tobacco has shifted to a war on nicotine. Yeah, that's where we all agree about. Yeah, that's the wording is different, as we yesterday heard. First, now it's nicotine use. Yeah, everything goes against nicotine, but we probably not agree about the time frame. Most of you may have the impression that it just started in the last 5-10 years. And I can tell you my experience. When I was presented the first e-cigarette, this was in the spring 2006. I think most of you didn't know about e-cigarettes at that time. Yeah, I got this Chinese stuff in my hands. Yeah, I was impressed. I was a heavy smoker. I tried it, and I predicted that within 15 years, nobody's gonna smoke anymore, because you don't need tobacco cigarettes when you have, even though this was a poor performance, this Ruan stuff. Yeah, okay. So what I did immediately, because I was so enthusiastic, I wrote to different non-smoking organizations, anti-tobacco and so on. Yeah? And I was enthusiastic, as now we have the problem solved. You are fighting for 30 years against smoking. Now you have it. You just have to promote this, and we're getting rid of smoking. Tja, the reply, I was not in the tobacco control field, and the replies that I got, this was, I mean, it was amazing. It was insulting emails. This was apparently a network of anti-tobacco people. Yeah? It was insulting emails, probably hundreds of emails that I got from different areas where they said, oh, you are crazy. And they still, and this is the same arguments that we hear today. This was 2006, I heard exactly the same. They continue with the ritual, with the behavior, and you're gonna normalize smoking by this and so on. It's all these arguments. And then the other mistake I made was, as an outsider again, because I didn't know what smoking cessation means, I wrote a report on this and recommended these e-cigarettes for smoking cessation. And of course, this was the keyword for the government, and for all the authorities. Smoking cessation is a medicinal thing, and it has to go to a pharmacy, and they started to ban all these products in Austria, not officially, but practically. Nobody dared to sell it anymore. Yeah? So this is the story. And what they also did already at that time, and we see it again now, is that they blamed nicotine for whatever they had in mind what it could do. And in the same paragraph, they wrote me, the only thing we recommend is medicinal nicotine replacement therapy. It's the gums, it's the inhalers, it's the patches. So suddenly, and that's why I always say, nicotine is converted somehow. This is a mysterious conversion. It's converted from a helpful remedy sold in pharmacies to a possibly toxic, highly addictive neurotoxin as soon as it leaves the pharmacy and enters the liquid of an e-cigarette. Yeah? And they are not ashamed about that. They do it regularly. And then I just recently read an article in Nature Outlook. Nature is a very famous journal. And this was a series of articles on tobacco control. And they had a nicotine article there, and with all this bullshit, even in Nature. And they started to argue in this article that the medicinal products are safe because they are FDA approved. So the stamp from the FDA converts nicotine from a potent neurotoxin and highly addictive as heroin, from this kind of compound to a very helpful and recommended drug. And the final point that I want to make, in Austria, I don't know if the regulations are different in different countries. In Austria, these medicinal nicotine products are approved for children above 12 if they are smoking. So this is tobacco harm reduction for teenagers and for kids. And this makes sense, of course. If they are smoking, they should take a nicotine replacement product. But they are flavored and they're sold to kids, legally sold to kids. If I promote an e-cigarette, even nicotine-free e-cigarette for kids, they say I'm a child abuser, I'm a monster. Yeah? Nobody would tell this, and this is a really crazy thing. Well, maybe you can do your best. The best you can is to really expose this hypocrisy, this discrepancy between public views and public perception of nicotine. That would be really helpful, because you don't need a PhD and you don't need to be a professor to understand this extreme discrepancy between the good and the bad nicotine, the two nicotines. There's a pink and the black. Okay, I think I'm ready. Huh?
Thank you. As mentioned, Gary, that I'm Amalia from Indonesia. Maybe a few of you know Indonesia, where is located. Indonesia has one of the largest or greatest smoking rates in the world. So after China and India, we have very, very greatest rates of or prevalence of smokers. And it's about 65 million of smokers in Indonesia. So it's really, really big. And as a researcher, and I'm a dentist, I'm deeply concerned that this is happening to our country without any measure or preventive program that successfully decline the rates or the prevalence of smokers. And as a dentist, I frequently see how the smoking deteriorates the condition in the oral health. So from the very mild condition, from tooth staining, gum staining, tooth decay, bad odor or halitosis, or maybe when you talk and somebody can smell bad odor from your mouth, and then to the life-threatening disease like oral cancer. And then as a dentist, I also see that smokers have a sign of really mild inflammation despite the oral health condition that is severely deteriorated. So it's like smoking has a masking effect on the gum or other tissue in oral health. So when you have plaque or bacteria attached to your tooth surface, the gum has to be respond to the plaque or to the bacteria. It will be reddish or inflamed or maybe painful or bleeds. But in the condition of smokers, I cannot see any clinical sign of inflammation nor bleeding. So it is well known that smoking has, as I said, masking effect, or we call it hiding the factual or the true condition of a smoker's condition. And so let me tell interesting finding of my recent studies that we invite 3 groups in our dental faculty, and it is non-smokers, smokers, and smokers who switch to vape, and we instruct them not to brush for 21 days. So, only in the lower jaw. Only in the lower jaw, because if we instruct them to not to brushing in the upper jaw, they will be rejected because they have to see colleagues, maybe a relation and relates on something like that. So I only instruct them not to brush for the lower jaw for 21 days to see how the gum will respond to the bacteria. Because they say that in smokers, the inflammation or the response of the gum is masking by nicotine. Nicotine will constrict or narrowing the blood vessel of the gum. So when bacteria came, nothing will happen because the vascular or the blood vessel is narrowing. Blood vessel or the wall of the blood vessel. It could be narrowing or widening, depends on the response that we need. So it's flexible. But in smokers, I could see that nothing. Even if we have a plaque accumulation. So I would like to see in this experimental gingivitis or artificial gingivitis, what is the response of smoker versus vapers versus non-smokers, taking into consideration that vapers also use a liquid containing nicotine. Yeah, so nicotine is something to be blamed. Then I see this interesting finding that after 21 days of abstaining from toothbrushing or other I can see that smoker fail to respond to the bacterial invasion or plaque accumulation in their tooth surface. No bleeding, no inflammation, no reddish coloring, just fine. But it is alarming because they respond to the invasion of the bacteria for 21 days. you can imagine. And I can see that it is not expected at first that vapors respond similar as smokers did. They bleed, they have inflammation, they have body response to this plaque accumulation. So instead of the abundant and similar plaque accumulation, smokers fail to appear or to show or to demonstrate the normal body response, while vapors with nicotine containing liquid they use, they still respond well to the accumulation or bacterial invasion. And non-smoker had the same or similar response as vapors. So I think that we conclude from this experimental gingivitis that instead of nicotine, there is something else to be blamed. Because we already confirmed from the saliva that smokers have higher nicotine levels in the saliva. It's confirming that they take nicotine. Vapors as well, they also show elevated nicotine level in the saliva. So it is also confirming that they use e-liquid containing nicotine. And non-smoker had no nicotine level or only a small amount of nicotine levels in the saliva, confirming that they don't take any nicotine. And we conclude that maybe there is something else to be blamed, not nicotine, or narrowing the blood vessel and masking or hiding the clinical sign of inflammation which is normal. So it is not nicotine itself, but instead of maybe tar or maybe something else. Yeah.
Thank you all, very interesting. Something that I want to think about and what I'd like to bring more conversation to, not just here, but in general, is what do we need to know in the next 10 years? And what more do we need to be focusing on risk perceptions? Do we need to continue focusing on toxicity and individual risk reduction? Or is it case closed on that one? I don't know. Should we invest more? Should society invest more in exploring the benefits of nicotine? These are some of the questions I have. I will ask each of you if you can just keep it to a minute, because I do want to be able to give the audience lots of time to ask their questions. But for instance, Jazz, we know a lot of what you do. I know a lot of what you do in other populations and focusing on African-American populations. What do we know about other populations? What should we know about other populations? What's important to them with regard to switching? And what should the next 10 years look like?
It's a lot, but I'll
yes, it is.
I think we do know about other populations, like, for example, just in the United States, those who are Hispanic or Latina, they smoke fewer number of cigarettes per day. They're more likely to be non-daily users of combustible cigarettes. In fact, the vast majority, almost 60, 70% in the United States. We know very little bit about, little invisible. People seem to forget about it. An unknown group. I think that we also know that, for example, that different groups of populations, it gets a little touchy because we're talking about genetics, metabolize nicotine differently. Like Asians, Japanese metabolize differently than whites, which metabolize differently than African Americans, and that has ramifications for the consumption of the number of combustible cigarettes or the ability to quit smoking or whatever the case might be. I think for the next 10 years was the other part of your question. I would say that, we need to continue to innovate these products, need to keep making them, I'm all about safety, make them safer. I think societies have to decide, is there a role for nicotine in society? I mean, that's the bottom line. I mean, the 80s, 90s, 2000s, it was all about the end game, as you know, or most people know. The end game was combustible cigarettes, or tobacco, if you will, if you want. But it was always that. Then all of a sudden, we were making progress in that. Then certain groups, I won't name them, sort of dominate the noise level of the media, and it's converted to the end game is now nicotine. And that's like, whoa, how did that happen? And by the way, that leads to the confusion amongst people and even our intelligent doctors who apparently don't know the role of nicotine in disease.
Summer, question for you. What regulatory targets concern you from a scientific point of view, and what should we be focusing on in industry?
Thanks. I think one of the things that I've spent a lot of time thinking about most recently would be nicotine ceilings. So thinking about nicotine pouches, for example, how we navigate that. Work was obviously incredibly helpful in giving some kind of guidance in terms of a level to be seen in nicotine pouches. But when we think about the use of those products, the regulatory concerns that are becoming more present, this week in Finland, for example, they discuss, the idea that small children might go and eat nicotine pouches, and then they have, they die of toxicity exposure, and and on and on and on and on. And so you think about, eventually it becomes a very easy place to contemplate nicotine pouches that are available but no longer useful for the audience that they're intended to be used by. So how you navigate those kinds of questions, for me, I think is definitely a space that requires more scientific attention. I'm thinking about also the insights that are developed from a scientific standpoint to substantiate these kinds of positions, and what you can do in terms of really just like very purist scientific experimental design. A lot of research that's generated that presents negative views around nicotine and products. Once you start digging in, you find a lot of really just fundamental design flaws, and how you can think about things like physiological relevance and actual use, and building that into the scientific process really across the board to help respond to that as well.
Thank you. Ask you this question, so I hope you've had time to prepare an answer. So what about regulating nicotine, and what do we need to know more about regulating nicotine? Summer just spoke on it a little bit, but your work on nicotine toxicity calls into question some of the current thoughts about nicotine toxicity and what the lethal dose is and that sort of thing. How do we extend that to abuse liability, and does abuse liability need to be regulated? And should we question the idea that nicotine PK and should not be exceeding that of cigarettes?
With PK, you mean the
pharmacokinetic profile?
The pharmacokinetic profile. Well, I mean, let me start maybe with the 20 milligram per ml limit that we have in the EU. Yeah? So in the public perception, people think that this is fact-based somehow, that this is a scientific result. And when you have a liquid with 25 milligrams per ml, you're gonna fall down, you will be killed immediately. Yeah? That's simply not true. This is a purely political limit, this 20 milligrams per ml. It could be as well 5 or it could be 50. There's no reason to limit this to 20 milligrams. This was a compromise in the discussion before they implemented the DBD2. Yeah? So this is the first thing. So you can, and I mean, when you say lethality, we don't want to have lethal doses of nicotine. I mean, it would be sufficient if you're pretty sick and you're in intensive care. Yeah? You don't have necessarily to die, and it's still bad. Yeah? But the positive thing about nicotine consumption is, and this was shown for smokers, and it was also shown for vapers, is the so-called self-titration with nicotine. Every smoker knows this. When you have the feeling it's too much, you get some headache, you become dizzy, then you automatically, unconsciously, you stop consumption. That's what the late Böttcher-Langer said, that vapers will draw on the e-cigarette as long until they fall down unconsciously. This is a fairy tale. That won't happen. Everybody stops the consumption of nicotine if it's too much. So I'm really principally against regulation. Of course, there should be some kind of upper limits, just this clear. And because you mentioned the pouches, yeah? The pouches are different because the pharmacokinetics is so fast. So the e-cigarettes are a bit slower, probably cigarettes, or at least comparable. but about the pharmacokinetics, the appearance of the nicotine in the plasma from pouches are very fast. This was shown by the BFR. I agree, this report is excellent, and they come up with a limit of 16 point something milligrams per gram pouch, and I think this is a reasonable limit. If you go higher and on the market are pouches with 40 milligrams or something, then you can imagine it takes about 30 minutes until this nicotine is in the plasma. So you have in 30 minutes, you have the amount of nicotine corresponding to 2 packs of cigarettes. You won't smoke this in 30 minutes. Yeah? So I think then it makes really sense to limit this. Yeah? And as we heard, there's someone in the audience who needs a higher concentration. Okay, then it takes 2 or 3 or whatever. Yeah, if you really need them, you can put this up. You have a lot of space in your mouth to put these pouches in. Yeah. So principally, I think we shouldn't regulate. Yeah, we should, and we should. The society. This is an important point. I think society should accept that there's a certain amount of people, yeah, who wish to consume nicotine, who find some pleasure with nicotine consumption, who want to do that. Yeah? And it applies to teenagers as well as to adults. We will always have a certain fraction of the population who want to consume nicotine for whatever reason. Yeah? And that it won't help. You can ban it as much as you want. It's like smoking. We have smoking bans all over the world, and still we have 10, 15, 20% teenagers smoking. Where does it come from? Because they want it. And this has nothing to do with advertisement, because advertisement was banned. And like the late George Carlin, which I really like, yeah, what he said in one of his appearances, he said, children don't smoke because a camel with sunglasses tells them to do so. They smoke for the same reason as adults do, because it decreases depression, it relieves anxiety and stuff like that. There are positive effects of nicotine, and it would be worth to emphasize this. This is always under the carpet. From public health doesn't talk about the positive cognitive effects and anti-inflammatory effects and so on of nicotine, and I think we should push this in the next 10 years.
Thank you. And then finally, for you, Amalia, I have one question, and it's also a very similar question to a question from Ignacio Livia, who's watching online. My question is from the industry perspective, but he was asking more general. How do we reduce the skepticism of doctors and health officials about the lower risk nicotine delivery products? My question, which is very similar, is how do we as industry convince people that our science is reliable?
So maybe we have to conduct more research, especially clinical trials and also systematic review. Because with the clinical trials, you can also extrapolate what you have found in the lab and in the preclinical trial, and as well as write a systematic review and meta-analysis, which is already written by me and my colleagues in Indonesia, that this kind of alternative tobacco product has effectiveness in smoking reduction and smoking cessation, as well as safe. So you can see it in a journal from Dove publisher that we already conducted systematic and meta-analysis. So we can adopt this in our daily practice from this systematic and meta-analysis, that this product is effective in reducing and stopping as a stopping aid for smoking cessation, and also it is safe. So I think it's we have a long journey to keep on doing what we believe and keep on researching. That's why it's not search but research. Yes, you already search, you find something, and you search, so it will be a research.
I absolutely love that, and I'm totally stealing it. So thank you. Does anybody have any questions from the audience? Happy to moderate that. Somebody has a question. Well, then I'll just continue to ask mine. So, should we? What is? I'm going to follow up on this. How do we convince people that our science is reliable? I mean, I come from industry, and we do so much science. And when I was at the think tank in Washington, D.C., we focused our policy positions on the scientific basis, and a lot of what we used was industry-based science. I mean, now I work for industry, so I'm obviously pretty accepting of that, but I don't know how we can convince, how we in industry can actually convince people that what we're doing is in the right direction and is robust. And I would like to know anybody's thoughts, or each of your thoughts, on how we should be tasked with using science, using what we do, using what we produce to reach healthcare providers, to reach regulators, to reach consumers.
There's an opinion in the back.
I guess he has a question. I can attempt to answer that, and then we can take the question, I guess. But I think it's hard. I think, some of my colleagues in the audience have told me, and I heard from before, and then new people I met told me that if they're from an industry, a big tobacco industry, that they have trouble getting their papers published. I feel sad by that a little bit, I mean, either you accept it at face value or you don't. I mean, and some journals, of course, have an absolute ban on publishing tobacco industry funded or from the industry itself papers. So that's black and white, so there's that. But then for those that don't have a ban, apparently they're treating you worse than they'll treat me, right? I mean, that's the bottom line, what you're getting at. And I think that's unfortunate. Today's world is very different than the 1980s. In the 1980s, you may not have been born, I don't know, but you people were lying. You were publishing misinformation, you were lying, you were hiding data, you were perjuring in front of Congress. It was an unbelievable field day for you guys, and you were making money hand over fist. In today's world, you still make money, but you are watched like a hawk. The FDA, I believe, I'm not an expert on this type of stuff, but can subpoena, if that's the right word, any of your paperwork, any of your research, and look at it. So you're being watched carefully, they're breathing down your neck. Your science is monitored much more tightly than my science. I can actually get away with fake science better than you can. I don't do that, by the way, but I probably could. And I think, I tend to generally trust the science from the industry. I mean, I'll have a little bit more of a cautionary eye. But by the way, just as much as that, you have to remember that everyone has an agenda. I mean, you have an agenda. You want your science to look good, but you will be ethical, I'm sure, Carrie. I hope I'm ethical, but I maybe have an agenda, and I know some other colleagues without naming names who have had to retract papers, sometimes have had agendas on the other side too as well. So agenda-driven science, in my opinion, we're all driven by that to some extent, is a little bit dangerous for all of us, whether it's me or for you. I think science should be science and should be of the highest quality. Yeah, there's some questions if you want to take it.
Great, thank you.
Yeah, my Khosi Letlape from South Africa. My question is about the TPD and setting the limit for nicotine liquids. Are you suggesting that that should be open-ended?
Not open-ended.
And the follow-up is, in the 10 years, has there any science been done as to what the reasonable maximum should be, what the basis of that should be, just like you have in pouches?
I mean, the point is that the industry started to handle this 20 milligram per ml limit by developing devices that are with a sufficient performance. But still, for the small devices, the 20 milligrams are probably not enough. And we see this from the Juul in the United States, where this is I think, sold at 55 milligrams or 60 milligrams per ml, and this is successful, and with the 20 milligrams limit, it's not successful. I'm not suggesting that it's open-ended, but the initial suggestion from the Parliament in this discussion in the EU was 32 milligrams per ml. And this would probably be acceptable for most vapors. And then the Commission suggested 4 milligrams per ml. And this, at that time, this was homeopathic. Today, there are some vapors who have this direct-to-lung vaping. They have enough with 4 or 2 milligrams per ml. But at that time, in 2013, this would have been a ban of nicotine, in fact, because the devices were not good enough. Yeah? And then there was this trilogue discussion, where they then found this compromise of 20 milligrams per ml. So what I'm just saying is that this number is just, this is an thing to do with science. And now even in the United States, they take Europe as an ideal country with this 20 milligram per ml limit. And they say we should implement the same because they know what they are doing. No, they didn't know what they are doing. They were just dealing. This was a deal, nothing else. No scientific basis. I think it should just be sufficient for everybody, even if a smoker switches to a low performance, a poor performance device should be able to get enough nicotine. That's the point. Satisfied? Is it sufficient, or should I can continue for hours.
Just one very quick comment on that, is that I would just say that a number of scientists, I think there's some truth to that, but I think there is some science. You can look at PK curves. Be just right below it, so that theoretically its dependence or abuse liability would be less in a cigarette, or something like that. I will say that let's say a Juul 2% versus 5%. I vote for the 5% any day, because for a variety of reasons. One is, if you believe that vaping is not safe, which I think at least industry people, we all agree it's not safe. It's dramatically safer than combustibles, but it's probably not completely safe. So if that's the case, then the goal is, if the goal is to get the nicotine, get the pleasure, then why not get pleasure with using as little of this not so safe stuff possible? So then you get the 5%, you will use it less than if you use the 2%. It's not particularly rocket science. And if you want to switch off combustibles, then you want it to work, which is why something is like, excuse the American expression, pissing in the wind.
Let me get to this, because the pharmacokinetics. I mean, the pharmacokinetics of nicotine delivery from e-cigarettes is pretty complex, and I don't think that anybody has ever looked for the pharmacokinetics or compared mouth to lung versus direct to lung. So my hypothesis is that when you vape direct to lung, it's much faster, because you get this in the lungs where the uptake is faster. While the has your epithelial cells, and it goes much slower when you resorb it through the saliva. Yeah? So I think that there are differences. There are documented differences, pretty high differences in the kinetics of nicotine uptake that are published. So some are very slow, some are steep, and then it depends on how you vape. Yeah, that's the other thing. This is a matter of many, many factors, and I don't think that you can generalize this over all devices and all vapors.
Yeah. All I'm just raising is that if we're negotiating with policymakers and regulators, there needs to be a number that gets put out there. Yeah. So let's do the work of making it based on science.
Yeah,
and compromise will always occur when you negotiate. It's like speed limits. I mean, you go to some countries, it's 60 kilometers, and people will tell you, I drive a Lamborghini, it's more efficient with brakes. My limit should be 160. On the Escort, you can put a limit of 60. And we get into variable discussions. But with regulators, you're going to need a number, and all I'm just pleading for is that there was an arbitrary number of 20 or a compromise of 20. Has the science been done to say, actually, it should be 18 or 25 or 30. Here's the evidence. When you review the TPD, take that into account so that you can adjust that upper limit appropriately.
Thank you. I see a couple of questions here and then one there. So since you're standing there, why don't you, and then we'll get to you. Thank you.
Thank you. Joe Thompson, Imperial Brands. I just wanted to share a little bit of some of, thank you, some of the science that we studies and looking at low, medium and high levels of nicotine. And we found two things, one we expected and one we didn't. What we expected was that effective delivery of nicotine satisfied craving. We expected that. What we didn't expect was that there was a lack of correlation between dose and satisfaction. And what it showed us was that the consumer is important, the adult smoker is important, and the level of nicotine, what they require from the product to be satisfied is different depending on the consumer. And I think that's important when we're thinking about levels. It's not necessarily higher is best. It's not necessarily about a limit. It's recognizing that consumer needs are different.
No, I think that's very important. And I would also add that I think we have to do a better job in industry when we talk about what we're learning from, or not just industry, everybody, what we're learning from animal models, what we're learning from talks, and that how it may or may not apply to actual human human parameters. And I think we have to do a better job at explaining that, but yes.
Zillatron Schmidt, Consumers Organization, Germany. Your question, how could tobacco industry science better reach regular science? And I want to pass on a suggestion by science fiction author David Brin. He suggested you make a bet. You bet scientists that they can't do a replication of your study and come to different results, significantly different results. So if you're confident in your results, in your study, offer money to contradict you, if they can. This way, scientists from from the opposing, the anti-tobacco scientists will try to get this money from you. And maybe...
I think that's a very good idea. Yeah.
This would be replication studies that could be published.
Yes, thank you. Actually, I do know that there's a few studies or a few projects out there that actually investigate the repeatability of industry science, and so I'd like to see more of that for sure. Does anybody else have a comment on that?
Actually, in Indonesia, it started on 2021. We have a replica project, and it funding from University of Catania or Quehar with the spin-off. So my colleague in the medical faculty will reproduce or have a replication of studies conducted in epithelial cell of lungs and also in animal. So that will confirm the results that already conducted by tobacco company. But we are from academician from university, prominent university in Indonesia. So I think that this replication or confirmation study will address your question. Thank you.
May I just add one point? I want to make this clear. The best studies I've seen on toxicity, cell biology, and even clinical studies of vaping, it includes e-cigarettes and the tobacco heating systems. The best studies were published by the tobacco industry. This was Philip Morris, and this was British American Tobacco in particular. They did excellent. Why have the money? They recruit good scientists. I wouldn't get a job there because then they need better scientists. They have the excellent Yeah, of course. They have the excellent people and they have the equipment that my tongue goes down to the stomach when I see all these equipments. I've seen such a lab. They had 10 machines where I was fighting for 3 years with our dean to get one. Yeah, I mean, this is a huge difference. They did excellent studies, but the problem is that just nobody talks to them. When I argue with a study from the tobacco industry, then public health just pushes it away. Says it's the tobacco industry. They don't even look at it. That's the problem. So if I were the editor of a medical journal, I would ban Bloomberg-funded studies. Yeah.
And maybe one thing to also touch on in terms of acceptability of the industry science, the points that Bern just made, one of the things that I think is already done, and part of your question, of how we create that dialogue, how we generate more buy-in on scientific concepts, how we increase our credibility as industry scientists, you and I, is also just the participation in many of the things that we're already doing, but we don't do a good job of talking about. So think about like the 21st century toxicity. So that was a collaborative piece of work with members of the tobacco industry, government officials, independent scientists, all coming together to really look at, say, how do we reduce the use of animals in scientific testing for tobacco products? That was a giant piece of work. It was wildly impactful. It was innovative. It drives the points of things that we're trying to achieve broadly as scientists globally, not just as tobacco scientists. And it's a really well-respected piece of work. What we don't do a good job of is telling anybody about it. Those people who are involved in preclinical testing, maybe they have some experience with advocacy of moving away from animal models, they know about it, but how many people in this room outside of those communities have ever heard about anything like that? Those are the kinds of venues that I think when we talk about gaining more acceptance of science, we need to do a better job at not only participating in very intentionally, which I think is a PMI and a BAT employee, we'd argue we try to do a lot, but also talk about it in places, going to meetings where people have not encountered us before and saying, we've had a hand in this work, we've done this, these are the insights, this is how we behave, this is how we operate. And I think that that's really important because the feedback I got this week, which was always a helpful reminder, is you have a good message, you're a terrible messenger. So thinking about how to do that a little bit differently, I think, is also pretty critical.
Thank you.
Thank you, Alex Wodak, Australia. My question is really to any member of the panel, but especially to the two members of the panel from the tobacco industry. This is a difficult situation we're in. We're losing every year around the world the equivalent of the population of Switzerland from smoking-related deaths. We're dealing also with the legacy of decades of behavior by the tobacco industry that was beyond reprehensible. And I think it's good that that's now come out and accepted and acknowledged by people across this issue. But I'd suggest to you that in the next decade, there is one area of science that could make a huge difference, that is real data that exists already, that isn't released, and that would make a big difference. And that is data that the tobacco industry holds on cigarette sales and also of reduced risk product sales. We know that data exists, it's referred to frequently, and if that data was made available, and currently it almost isn't at all, and if it is released, it's very, very sparing, but if more data was released, we know it's high quality data, it would do two things. It would help drive the policy debate, and it would help improve the reputation of the tobacco companies. How could that happen when the tobacco companies are in presumably fierce competition with each other? And I think the answer to that is also fairly obvious. If all the tobacco companies got together and discussed this problem and worked out a way in which they could all release the data together, the same kind of data with the same kind of quality, that would help drive the policy debate. And the more the policy debate is driven, the more the sales of the reduced risk products would go up. So I'd suggest that if you think that's a reasonable suggestion, I'd hope you could take that back to your colleagues that you work with and make that suggestion. Now, I have to acknowledge that this is something that David Sweenall from Ottawa has been banging on about frequently and regularly for years, and I think he's right. It's a difficult issue, it's stuck, and we need to have more things like this. And here's an advance that is really hiding in plain sight.
So I feel like by default, I'll pick that one up. I assume, having had the same conversation with David as well, part of the thought with this is that if you take the sales weighted data of cigarettes, you take the sales weighted data of reduced risk products over a point of time, what you, and correct me if I misstate this, that you could say, we've watched the sales of cigarettes do this in a specific geography, we've watched the sales of reduced risk products do this, and we see the inflection point, and we can say that, you know, here are the insights that you can gain from that, roughly. So we've talked a lot about this as a concept because I think at that level, like, that's an amazing story. Like, why wouldn't we say that? What I can say as a person who has dug through this to try to tell that story is, while our sales data can often look very flawless from the outside, it's only about 75 to 80 to 100 to numerous different inputs coming in to make a model. It's not necessarily as simple as it appears when you look at it in, you know, marketing presentations or when, you know, our senior leadership hits the street to talk about our numbers. So when we attempted to do this kind of thing, and you may ultimately walk away feeling like I'm trying to avoid the question for a thing that feels obvious, that when we start looking at the models, it's not as simple as that. And when we start trying to track over time, what we wind up seeing is if you start tracking in, you know, let's say a reduced risk product's introduced in May of 2012. And in May of 2012, we had one mechanism that was tracking the sales data of that. And in August, we had 17. And in, you know, October, we had 74. And next year, we had 378. Like, because you have so many moving inputs into that data over time, once you start trying to actually do the math, you have a bit of a garbage model. Because you've got such a good reporting mechanism up in FMC just of how long, or factory-made cigarettes, over how long it's just simply existed. As you look at the way that that sales data is captured for these other outlets, that's changing all the time. So you can never do a good one-to-one comparison on it. So while I appreciate, you know, David and probably now yourself, after hearing me talk about it, say, that's probably bullshit. But I will say that having looked at it, that becomes the problem in telling the story. That when we use this sort of proprietary company level data, there's just so many inputs into the model that it becomes really complicated to tell what appears like should be a simple story. I don't know if you have anything to add to that.
As the moderator, I think I get to bow out and not actually answer the question. So thank you. But no, I know that we've spoken with David Sweenall about this too, and expect that hopefully we can get to a place where those questions are answered. I know it's time to close the session. I'm going to leave us on one question to think about, which is came from Ignacio again, who's online. And I think it's a kind of an interesting question, and so we can all mull it over and discuss over the networking lunch. Is there any science which could be done which would satisfy the naysayers in tobacco control? I think we have a lot to think about. Thank you so much.
Yeah. Yeah.
Hello, my name is Sule Castro from Knowledge Action Change. Welcome to GFNTB. Today we will be talking about the illicit market of safer nicotine products in Latin America. And here with me is Ignacio Leiva from Secretariat of ARDT. Who is the Professor of Philosophy of Law and President of Mexico y El Mundo Vapeando. Some of the major markets in Latin America those are the major markets in Brazil. Argentina is one of them. However, it's common knowledge that those products are available everywhere, and there is a clear demand. Brazil, for instance, there is a considerable number of shops, physical shops, as well as a strong online presence, where people can buy those products. However, they do not know what is it that they buy and what is it that is inside. So I would like to ask my colleagues here today, what is the situation? By that I mean the legal situation as well as the actual situation on the ground. I would like you to cover a little bit Mexico in more detail, and then Ignacio can talk a little bit more about other countries in Latin America, especially the big markets one where those products are sold and are quite popular, but are forbidden.
Okay. I start? Okay. When we think about what's happening in Mexico, there is some special issues that have to be addressed. First of all, the prohibition doesn't come from the Congress making laws to prohibit it. The problem is that it comes to be passed as a law. So with this kind of prohibitions, kind of trial called juicio de amparo, where a judge can revise if there is a violation of human rights. And some companies already started these kind of actions, and they've already won these actions. So we have 3 scenarios with these legal procedures. First, companies or people who already won these actions and are entitled to sell these products legally, and they are selling them on the market with the permit of these legal actions. Second scenario is the people who didn't start these trials or didn't want to, and they are selling these products outside the legality. They are selling this on the black market. And the third is people or companies who just quit selling these products to avoid rates and fines or even prison. What is happening is that the market is moving in a very irregular way because there are products sold legally and some products sold on the black.
Thank you. So just summarizing, in Mexico, there is a presidential decree in which the products are not allowed to be sold unless you took part on this action. You were part of the companies that raised this legal action against the government. So you end up with shops that can sell and shops who cannot sell. And obviously, you always have the parallel market, which is the illicit trade market. Brazil, similar situation, but not as much because we have, since 2009, the commerce, promotion, and importation of what they describe legally as electronic devices for smoking banned based on a precautionary principle. I'm going to pass it on now to Ignacio, that we will discuss a little bit more of the other markets in Latin America and what is the situation at the moment.
Well, as you said, in some part of South America, these products are forbidden, mainly vaping. You have the case of Brazil, as you state. Also, we have Argentina and Uruguay, which also have this ban. And the problem is that bans never work, and in Latin America, even less. In case of Brazil, as you stated, you can find these products easily in the market, I mean in the black market or informal market. And in Argentina, you have mainly the same situation. But in Argentina, I will tell that they went in a step further, because even if it's totally, you can find physical shops where to buy, but these shops are hidden in normal
Yes.
houses where you knock the
You
door,
have
they
knock
need
on
to
the
know
door.
you,
Yes, I heard about it.
and they open the door and it's a normal family
Yes.
house, and then one of the rooms, it's a shop. And the thing is that Brazil and Argentina are getting all the products from Paraguay,
Yes.
who have not a ban in this product. Actually, they are the ones that produce more products of vaping in Latin America, and they are supplying because the borders are very open, widely open, through Brazil and Argentina. But the funny stuff that other countries that have these products forbidden, it's Uruguay. But Uruguay is receiving the black market not from Paraguay. They receive it through Brazil and through Argentina, what shows you that you can't try to ban the people to get access to it. It can even cross that country to go to another one, but it's the very bad part, because there it's the very problem. First, the quality of the product. If it's the black market, the one that is doing
You
this,
don't know what you get.
no one knows what it's inside of their e-liquids, or if the e-cigarettes are of good quality. And the second one, it's that the mafias grows, because obviously the ones to get this market, the legal market, it's people that will cross the law. And they said that this is to protect the young people, but someone that is acting illegal doesn't care who will get it. So that's the main problem of these countries. We have also the case of Chile. In Chile, the e-cigarettes are not banned.
Yes.
You can sell e-cigarettes, you can sell e-liquids, but they restricted the nicotine. So the nicotine can be only be sold by the pharmacies. And the pharmacies don't want to sell it because they are the ones to oppose the e-cigarettes. So in Chile, you have something that we call the gray market. You can sell electronic cigarettes, but you can't sell nicotine to the users. So it's like, I let you play football, but you can't have a ball. So there is a black market over the nicotine, but there is a formal market on cigarettes and e-liquids, what have no sense.
Yeah, but from what we've seen, there is a huge demand for those products because people find a way to buy it. From what I understand, speaking to some people I know in the country, the people that cross the border, buy the products and take back to Brazil. However, obviously they take a huge risk because if they stopped on the border, but apparently there is a fee to charge. It is a bit, in my opinion, naive of us in Brazil and obviously Argentina, who shares the border, to forbid a product beside a country which we share borders because we have a history of contraband. So it is not permitted in Brazil, but you can just cross the road and buy a whole container of it in Paraguay and bring it back. Although obviously the governments are losing a huge amount of money in taxes, and also the consumer, which is there and we should protect, don't know what they're getting, but are desperate to have some sort of alternative and probably can't understand why in some countries they are allowed and why we cannot have in Brazil. And we're not talking even about other countries in Latin America. We are talking about countries like the UK, Sweden, where we know the governments are not trying to commit mass murder. So what do you think? Do you think regulation would help to solve some of the issues related to that comes with buying products underground? Do you think that would help us a little bit more to control as well? Obviously, the primary purpose is to help consumers and help people to acquire products that are
Actually, regulation is the solution. Because if you regulate, you can know what products are coming in, who is selling them, you can see what's going on and you can protect the user. Finally here, the main thing is to protect the user and don't let the kids to get access to this product. Another stuff that I wanted to point out of something that you said before, you said they take a huge risk. Actually, there is no risk in LATAM. It's difficult to see it from Europe that there is no risk. How? It's banned, you cross the border. Until now, in Argentina, there was only one case
that was my next question, but thanks for answering.
I'm so sorry.
No, it's okay.
I'm so
That's
sorry.
fine. That's fine.
But
yes, I was going to ask about that. What is the
is-
actual in the self-prosecution
No, in
on
the
those countries?
prosecution,
If
it
you
barely
caught?
doesn't exist. We have only one case in Chile, only one case in Argentina. I think there is not even one case in Brazil that someone have to pay or go to jail. No one.
Yes, that's what I've been told, that there are sometimes, they are caught, but obviously being in Latin America, we know sometimes people can pay their way out of anything.
Yeah.
So there are
Or they just
prosecutions.
don't continue the prosecution.
They are caught, but they are never,
They
they
are
never go to
never-
prison. So in a sense, they
Not
don't
even
see
paying
it as a
not even
fine.
paying a fine. Not even
Yes.
paying a fine. There is only one case with fine in Argentina, 0 case with fine in Chile, and that's the reality. You said, I will ban it, but actually the people have access, but to products that you don't know the quality, and the kids can get it because the people that go for illegal stuff don't care who is selling. So the regulation is needed in these countries. Banning products have shown to be totally inefficient way to protect the users or to make them stop using these devices.
As Ignacio said, in Latin America, we know that the notion of law enforcement is very low. Even we have laws, the law enforcement does not apply regularly as it should be in all the countries. So in Mexico, for example, we have right now 20 bills that are trying to regulate the electronic cigarette market. Most of them are trying to make a differentiated regulation from cigarettes, from traditional cigarettes. Some of them want to make a equalization between both of them. And that is the only way we can solve the problem. What I told you, some people legally can sell, some people cannot legally sell. So the market is very irregular. Only with some regulation, we can put all the people that want to sell these products in the market, in a legal market, collect taxes, and protect the consumers from what they are buying.
And we know from experience, obviously, in other situations in Latin America, that border control has a very difficult time catching up with everything that is going on, let alone to try to control a border between Brazil, Argentina, and Paraguay. Sometimes I hear the comment that Paraguay is not actually keen that we regulate those products in Brazil, because as one of the biggest market in Latin America, if we regulate these products, Paraguay will obviously stop making as much money. Obviously, each country will have their own interests to defend, I guess. But what do you think about that? I mean, it is a difficult balance to get because we don't have enough money to control all of those crossings. But once we regulate, obviously we're going to have to devote money in education to make sure that those products are not going to be used by the wrong people. By that I mean the younger population. And that's obviously something that we have to discuss and think properly, that we can regulate, but we have to devote money and effort to make sure that those regulations are applied throughout the countries. But we know those countries are huge. Brazil has 26 states, therefore, but that is not an excuse for not regulating.
And having no regulation is worse when we talk about minors, for example, because A guy who is selling on the black market some product is the same for him to sell it to an adult than to sell it to a young.
Yeah.
And about the money, you're not collecting taxes now that could give you the money to
be
make
able
the
to-
policies not, or to educate the people and
To make the law enforcement.
to make the law enforcement
Enforcement.
not to let the kids to
Have
get
access.
these devices. But something that I might said, because it sounds like nothing or everything is going in the wrong way, actually in Latin America, even if we're talking about the countries that have problems, in Chile there is it's advancing in a very good way through the regulation. Actually, in this moment, it's being discussed the last part of the regulation. We hope that we will have a law at the end of the year or even at the first month of next year. In Peru also, they are working a lot enforcing the regulation. Colombia, it's also in a very good way discussing now in the senators or in the deputies chamber. So it's going forward. We were talking about the ones that are kind of a little stuck, but also there are coming good news from Latin America in the fight over to getting a regulation that it's acceptable and it's well done,
Workable.
thinking in the best for the users, for the kids, and for the governments.
So that's good news. I hope we are on the right path and that we have some countries in Latin America that will eventually start progressing in the right direction. I know that you are one specialist in the topic of human rights, and I would like, if it's possible, for you to expand a little bit the correlations between human rights
Yes.
in Latin America vis-a-vis the access to harm reduced products.
And when we talk about democratic states, that is a questionable affirmation for Latin America countries. We think that the law is supposed to protect the personal liberties of all the population. In our case, when we think about the concept of harm reduction, we see three human rights directly linked to this concept. The first one is the right of free development of personality, that says that everyone can choose whatever he wants to be or to do or to consume. In this case, you have the right to consume cigarettes, you have the right to consume vaping or tobacco-heated products. The second one is the right for information. And this is a very difficult situation in Latin America, because the ones who are spreading the false evidence about vaping are especially the governments in Latin America. So when there's a violation coming from the same government, then the human rights are violated very flagrantly, and that is what we must try to stop. And the third right is the right for health. Everyone has the right to have the maximum kind of health that can be achieved, but human right for health is not an obligation, it's a right. So when a government wants to impose a lifestyle, trying to forbid something for their population, they are violating the human right for health, because you are the one who can choose what is good for you and what is not good for you. When you connect these three human rights, then you get the concept of harm reduction, who has to be inserted in the regulations that has to be made by Latin American countries.
In what have to do with health, there is two human rights. One is to get the best kind of health or state of health that you can get. And the second one, it's that I have a human right that it's obviously that I have the right to choose over my health. When I've got cancer, I'm the one to choose if I want to go for this treatment, other treatment, or non-treatment. In the case of people that want to use nicotine, they have the right to choose which way they want to get the nicotine to their body. Tobacco, combustible tobacco, is the worst one. It's impossible to understand that the governments are trying to force the people to take the nicotine in the worst way that they can take it and making the most amount of damage that they can have. You have vaping that it's 95% less harmful than normal tobacco, heated, burned tobacco, sorry. You have nicotine pouches that nicotine pouches have shown to be like 99.7 less harmful than tobacco. And obviously, I have the human right to choose on my health in which way I want to protect it, and that it's totally against human rights.
And there's another thing, when you're a smoker, you can choose the treatment you want to use to quit smoking. And these alternatives are one of the treatments. Even they are consumer products, it can be chosen as a treatment to quit tobacco. It's like herbs or alternative medicine. They are not exactly medicine, but they are options for treatments according to the way anyone can solve the problem they are thinking.
And that it's proven by science. Science have shown that using e-cigarettes can be 2 times more effective than the best pharma products that you can have, even with the pharma products and with medical assistance and so on. Yes. From 2 to 5 times more successful you can be with using e-cigarettes than those meds. So
yes, obviously we don't advocate for one product or another. What is important that the people have a wide variety of products to choose, because people are people and people will have different tastes and needs. Some people will be okay with one product, some people won't know. But we won't go into detail talking about the illicit trade of the actual traditional cigarettes in Latin America. That will be discussion for another day, but we know, we didn't discuss here today, but we know that it's very big. In Brazil, it's considered as big as the actual legal market, and there is a huge demand for it as well. But considering the challenges in Latin America, the things that we just discussed about how much we lose in terms of revenue for the government, considering that our people, our fathers, our siblings, our friends do not have access to a product that can help them to have a much safer and better life, because I do find that a lot of the time we talk about the smokers, but the smokers do not come alone. They have families, they have people around them that is also affected by the habit. Personally, I have a personal stake because my father smokes 2 packets of illicit cigarette a day, and everything that we do around him has to be catered for him to be able to smoke a cigarette every minute or so. So considering the challenges, could we just summarize what is your advice for regulators to deal with the challenges and obviously look after the people that they're supposed to, which is the population? And
I think the main thing here, it's not to forget ever the main objective, that it's save lives. Those people that it's regulating now need to think that today, every single year, we are losing 8 million persons dying for combustible tobacco. So they need to think on that. In the case of Chile, 52 persons per day dying, and taking this regulation seriously, basing it on science, not what it's misinformation, will take them to make the best for their countries, for their people, and finally to those families that are losing members, that are having very, very sad endings towards most of the worst ways to die in this moment. So I just ask the regulators to focus on this, to see the evidence on science, to hear the users, and don't let the money of a philanthrocolonialism to force them to take very, very bad decisions that will affect all the countries in Latin America.
Thank you, Ignacio.
And
Juan?
and even it's very important that we have laws to control the market. Our governments have been taking a lot of time and haven't solved in many of the cases these issues. So just one word: regulate. What we need is that they regulate these products.
Okay, thank you very much for all your comments, the input. I know you two work on your respective countries as well, liaising with other colleagues in Latin America to raise awareness about the concept of harm reduction, that in some of the countries, they don't think much about it. But although this is where it's most needed, right? Because we know that the countries that has the highest smoking rates are low and middle income countries with huge populations, and people are not having access to, or when they do have access, the choices are very limited in the case of Latin America, or they don't have access. When I say don't have access at all, obviously I mean access to the legal products, but we know it's everywhere and you can buy anywhere or knock in anyone's door and you buy the product. It is a difficult situation that people are put in, people that tried, helped them, and then they decide to help others and they open a shop and then they are driven on the ground. You know, obviously, like you said, you knock in the door, there'll be a family having dinner and they'll stop to help you. And from what I heard, those people are not just selling those products because they want a quick profit, because there are many other products that you can buy in Paraguay if you cross the border and you make less, I would say, less troublesome sale and to you. So I am going to pass it on now to Lindsay Stroud, who will be doing session on science, regulation, and morality. So I'll pass it on to Lindsay now. Thank you very much for being with us and listening to us. So I'll see you soon.
Thank you. Thanks for the invitation.
Leon.
Thank you. Thanks a lot.
Okay. Cool. Oh, and here we go. It is that seamless.
那我
So
们现在就开始吧。非常感谢大家今天参加此次会议。我的名字是Lindsay Sharp，我是消费者中心的一位负责人。当然还有一些其他的事情我就不提了。你可以看到我们在台上还有很多其他的朋友。那再一次非常感谢大家能够加入我们。我们要开始介绍此次的会议。我们有 Barry Groban 来自新西兰，他有25年的经验来减少烟草减害。他同样也是新西兰的相关组织的一位负责人。他发表了100多篇文章，是一个非常具有魅力的女性。第二位是 John Austin， 他来自加拿大，他获得了医药学和医药研究的相关学位。同样呢，他也是英国和加拿大的一位专家，他研究了很多，但是他在2019年退休。他现在呢主要集中于烟草禁烟这一件这一个主题那其次我们来看到Ariel， 他来自美国，他是一位科学家，他同样为 Joel 提供咨询服务。他现在主要的重点也是放在烟草使用方面，主要注重于年轻人。他在医学学术方面研究有很多。那最后一位，他来自 美国，他叫 Kevin，他是一位研究生，主要是研究公共健康，并且注重于全球的健康。同样，他也是Filter 的一位成员。那我们
forms of nicotine. These are all different types of harm reduction, and we shouldn't be stigmatizing either one. We should support all forms of harm reduction, whether or not they're deemed socially acceptable at the time.
So in addition to what Lindsay mentioned, I also help Clive Bates with his literature review every week. So the literature is what I see. I see a lot of bad errors in the literature, but usually I try not to attribute intention behind it necessarily. Never attribute to bad intent, what you can attribute to ignorance instead. But one thing that I would say was really immoral was the claim out there on Twitter that Cochrane was funded by Big Tobacco or had Big Tobacco connections, because whether or not that was an honest mistake, if you're going to throw out a claim like that, you have a responsibility to fact check before you do a lot of damage. And that was, the Cochrane review obviously is the gold standard for why e-cigarettes are effective. And to throw out a claim like that really undermines the science.
There are so many things that have me upset, it's kind of hard to choose, but just three at random. The tobacco companies that claim that they're wanting to unsmoke the world and they're wanting to make transformations, but are refusing to produce medically licensed and prescribable vapes. In the vaping industry, been recently involved with a company called SpongeBob Vapes that produces a disposable vape based on a TV character aimed at 6 to 11-year-olds. They also sell a plush toy, a little teddy bear with a vape inside it. I think that's just disgusting. And then from the regulatory point of view, in Canada we have a smokers helpline, and they're sponsored by the Cancer Society. And so I went online there recently and asked them what their advice is about vaping, and they said, well, there's not enough evidence to recommend vaping as a way to quit smoking. And I asked them what they thought about EVALI and popcorn lung, and they said these are valid concerns and I should be worried about them. So this is what the Canadian Cancer Society is sponsoring. So there's plenty of problems to go around.
Thank you. And thank you everybody for coming today. I thought about this question, and obviously, you could say that what's most immoral is tobacco companies continuing to sell a product that kills people. But I see morals as being more at the individual level. And the most immoral thing to me is that I know many people in tobacco control, public health, they know these products save lives and they are blocking access to them. They are facilitating increased rates of disease.
但是呢，他们却不愿意去使用这一些产品，能够帮助我们减少疾病的发病率。他们不愿意去做，所以我认为这挺令人伤心的。好的，我们又回到话筒又回到我这里了。我想这一群人非常的棒，他们做了很好的工作。那接下来我想从 Mary 开始。你的视频展现了过去人类的发展，并且在不同领域的相关的理论，这对于我们人类所做的事情有着非常重要的角色。比如说从家庭到政府到规定，你可以简单的介绍一下你的视频，并且它是如何应用到烟草减害当中的吗？ 这有一点复杂，但是
Western training, but also indigenous worldview, which tends to be holistic. So more of a systems thinker. And I came across this unification
我
theologian, and it was polyspheric model.
偶然知道这一个理论的，这非常的复杂去展现，但是呢，我会简单的说一下。我们现在遇到了最大的一个问题，就是为什么人们会反对这一些风险更小的吸烟替代品呢？他们为什么呢？因为他们觉得这有着不同的风味，这在道德上面他们觉得自己过不去。还有一些人，他们可能是身体上的反应。所以我想，人们对于反对这一个烟草减害、反对电子烟，可能有不同的动机、不同的理由。那我想给你举一个例子，就是 Robert 他昨天提到的，人们对于电子烟有相应的禁用。我们现在主要强调的是电子烟，为什么人们会反对呢？这主要是而且这是非常反常的一种行为。他说的很对，因为他们不想要孩子们去看到周围的人都吸电子烟，所以你会看到为什么当你做某件事情的时候，这是非常重要的，就是你所做的每一个行为都代表着你的想法。如果你吸电子烟的话，那人们做的他们的反应可能会认为吸电子烟是对的。那人们吸电子烟是向其他人释放的信号，说他们认为吸电子烟是对的所以他们才会认为吸电子烟是一个合理的行为所以在语言层面呢，我们可以看到吸电子烟其实也是非常重要的，但是有一些人他设定了一些规定来尝试着控制他们，所以禁用它其实是不太好的行为，它也是有这样一群人认为他们禁用是对的，所以当我们这也就是所谓的什么烟草控制，他们有着自己的非常理想的状态，那就是社会将会成为什么样的，以及公共健康呢也成为了我们整个社会的梦想。没有人会吸烟，没有人会喝酒，没有人会吃不健康的东西，没有任何不健康的东西，所以这就是他们的想法，这也是他们尝试着控制，他们设定了这一些规定。所以问题就是我尝试着去解释，我们在世界上有着不同的社会，有着不同的群体，我们不能够完全的统一，所以我们应该停止去争辩，因为这可能是关于我们的宗教信仰，每一个人的想法不一样，所以当你去说某个人的宗教的时候，他可能会是冒犯性的，所以我们应该而且我们每一个东西都是有相关的规定的，所以你不能够直接跟别人说你应该做什么，不应该做什么。而且现在每一个定义都是在不断变化的。当然尼古丁产品也是一样，他们是一个非常新的东西，他们觉得他们自己需要去控制它。
The fundamentalist, which is one of the best way to describe them, anti-harm reduction fundamentalist.
这确是一个很好的方法去形容反对烟草减害。有很多人都是支持这个公共健康的，所以他们在公共场所不断的去宣扬自己的观点。 罗伯特说到呢，它其实是一种社会工程。所有说的事情，所有做的事情，都可能会是有不同的动机的。那我们来看一下 John， 他刚刚提到了，他的那个视频讨论了这个资本主义和公共健康之间的这个冲突。资本主义呢，它象征着个人的自由、个人的责任。但是呢，公共安全又会促进所有事物的发展。所以你可以再一次稍微解释一下，它是如何和烟草减害所联系在一起的吗？非常感谢你的介绍。那我提到的其中一个例子呢，就是将这个资本主义的目标和我们的公共安全所联系在一起。比如说在日本，他们的那个创新和生产力，以及资本主义的各种行为都和公共安全有着非常好的结合。在日本呢，每年有740亿的这个烟草产生。这确实是一个很好的进步。同时呢，他们还发明了很多的不同的产品，这也是他们为了戒烟所做的很多的这个努力。但是他们做的呢，也只是为了让他们自己在这个市场上面盈利。就比如说，它很像是孩子的玩具一样，他们只是把它作为一个产品去贩卖。所以这就是为什么我们今天会讨论对于青少年吸电子烟的这一个问题。所以我认为，在资本主义和公共健康之间有着非常大的矛盾。但是我们也需要意识到，我们如果将烟草产业看作是一个资本主义性质的组织的话，主要是依赖于它的那个利益。那医学的那个公司，他们就可能会将这一些电子烟产品看视作是一种威胁。所以对于某一些资本主义的人来说，他们非常关心谁到底去拥有这一些组织这整个之间的冲突是对我们的社会、对我们的这个任何活动都是有影响的。那我们继续来到下一位。你和那个 Clive 一起共同协作非常感谢你的一些研究也是非常出色的，而且你在你的视频当中提到了如何去看待背后的原因，以及所有的事情它可能都是存在一些偏见的。当然还有一些也展现在了你的文章当中的概要当中。当然我太忙了，我没有时间去阅读。那你是如何看待你的观众如何去辨别这一些问题的呢？我认为第一个我们需要学习的就是你应该意识到这个文章的这个概要呢，它并不能够代表所有的，也就是我们最后的结果可能无法展现出来。就正如我在我的视频当中所提到的，我去分析了很多问题，而且我也有很多阅读了很多的文章。那我今年我的这个讨论的主题很明显是关于我们如何去分析，如何去进行设计。最后的这一个结果，它可能会和我们之前的想法有一些偏差，但是在经过几周的实验之后，我会很好的去得出结论。在我一篇的研究当中，比如说这个结果是那一些从来没有吸过电子烟的人，他可能会让我去进行更多的分析。 以及现在正在吸烟的，以
smokers
及以前吸电子烟的人，他们之间到底有什么不同？事实上，结果最后呢，其实和我们想象的是完全相反的。所以在这个概要当中，它和最终的结果是有所区别的。所以我们需要寻找不同的要素来开始我们的研究，但是呢，你没有太多的时间，所以有的时候呢，我自己也只阅读了概要，但是呢，你也可以从概要当中找到一些明显的信息。最后 ，Kevin， 你提到了在科学当中可能会存在一些误导的信息，这也导致了最后的政策不太如意。你非常注重我们的药物，
Also, the ways of the vaping industry seemingly and ironically support some of the same stigmatization that you're seeing and misinformation and disinformation against these products that you saw in the drug war. Can you explain
当
that
然，
more?
你还提及了对于这些产品可能会有一些误导以及错误的宣传，你可以稍微解释一下吗？并且这些问题是如何解决的？我们并不是说去反对这一些产品，我们有一些传统性的也危害减少的一些活动，当然包括烟草减害。你会发现你如果去参加这些会议的话，你会发现有很多不同的群体涉及到其中。比如说，在你生活当中，你可能会不经意的会不自觉的去注意哪一些吸电子烟的人。但是呢，如果我们去关注科学的话，科学它其实背后是支持着烟草减害的相关政策的，并不会增加对于烟草的使用。我们都知道吸电子烟和雾化其实还是有一些区别的，它是通过热量来进行转换。我们现在正关注的就是这个吸电子烟，它其实是一种烟草减害的一个工具。那为什么会提到这个呢？我要举3个例子。第一个呢是关于我们公共健康方面的培训。有一些物理学家他也关注这个电子烟，他认为电子烟可能会损害这个人体的肺部。我去了一个活动，他在那里谈论了这个烟草减害。如果这一些不同的群体能够相互进行支持的话，那么我们可以通过一些规定。第3个例子就正如我之前提到的那一些会议，我当时参加了一个国家级的烟草减害危害减少的这个会议，它是在美国最大的一个危害减少的会议。我当时采访了一些人，了解。
For us to be able to support each other, we need to, respect basic science. And by respect,
信息非常的少，这对于我们群体来说也是没有太多的机会去了解。但是如果我们真的能够去互相支持的话，比如说你尊重最基本的科学，而且我们需要有一些共同的观点，这样的话，我们其实可以去了解电子烟它其实是一种烟草减害。我非常希望你们能够谈论更多你们的视频，但是呢，我们现在来到了问答环节。
work for everyone. How can we better address
如果
this?
遵循科学的话，并不能够对每个人来说都是有效的。那我们如何去解决这一个问题呢？我认为这一个问题很难，因为科学支持着这个危害减少，它确实是非常有帮助的。但是呢，我们一直持续着去发布一些文章，但是现在发表文章也变得非常的困难。所以我们应该更加努力的去引用，或者说去得到更多的支持和。但是我想说的是，科学的另一边并不是说一定要去说服某个人。我认为我们也不是科学所带来了一些反对面。但是我们需要去了解消费者的想法，他们的想法对于我们来说是非常重要的。
Some really compelling stories.
比如说青少年吸电子烟的这一个问题。
Those personal anecdotes out there is really important.
我们还可以去引用一些人他们在电子烟成功的戒烟的相关的故事，我们可以引用。我认为科学呢，我们进行了很多的研究。电子烟要相对于烟草有着更少的危害，电子烟能够帮助我们去戒烟。尼古丁不会导致癌症。这些都是一些确切的科学，都我们已经得出来的结论。但是呢，我们现在仍然在针对于这个话题进行一些辩论，人们仍然在使用着这一些论点去反驳。我不知道我们应该怎样去做。因为作为物理学家，确实有义务去告诉其他的物理学家这一个论点。而且加拿大呢，也并不会说让我专门的去聊这一个方面，所以这非常的令人沮丧。我想说的是，为什么人们一直在撒谎，他们一直误解科学呢？我认为我们很需要去注重他们应使用的什么样的语言去进行表达的。比如说在这个领域有很多的文章进行发表，还有一些活动，他们不断的去宣扬自己的理论，他们对于世界有着乌托邦式的这一个愿望。有一些它是通过发表完成的，是通过规定以及他们所使用的语言完成的。所以我认为有一种非常有用的分析的方法叫做课题分析。如果你使用这一种方法的话，它可以向你展现他们背后的相关理论。无论你是谁，你是哪一个人种。
How many times you should be having sex a week and whether or not
我们对于一切都有我们特定的规定。很明显，每一个东西呢都有相应的规定，你应该做什么。我想大多数人都像鱼缸里面的金鱼一样，他们并没有意识到周围的水，他们并没有意识到他们应该怎样去遵循这一些规定，比如说他们应该如何使用自己的语言。所以这一些谎言，这一些误导，他在尝试着
And we have people who are not like them, who just want to be
整个群体。
And the lies are all about that. They don't want us
当你出现一个不同的群体的时候
using substances. There's also the religious kind of many religions are So when people are
一些谎言，他们不
about
不
addiction,
想让我们喝
the
酒。
huge about
人们谈论
addiction.
到上瘾
Addiction
这
is bad. Addiction
话
is
题的
then you're not
时候，
healthy. What they're partly talking about is this
他们不好，上瘾是不健康的。
in the
他
spiritual
们
sense.
所谈
They're a fallen person.
论
If they would do something outside of the rules, what else would they do? They're a dangerous
是这一个人在成。那他们如果不喝酒的话，他们会做什么呢？这些人会认为他们是非常危险的。我们并不知道他们接下来会做什么。所以你会发现，他们所使用的这一些话语都是非常具有描述性的。他们自然而然的认为这些人做的事情会使人们害怕。所以，如果你不遵循规则的话，我认为你同样也指出了你的视频当中的一点，特别是那一些使用一些更加健康的产品、更加安全的产品的人。我想要强调一下，为什么我们必须去理解、必须去记住，这个危害减少是为人权而抗争的一种活动，它是关于人们是否能够使用药品的权利。所以我们不应该将药物使用直接定义为一个否面或者一个坏的东西。我们需要一些具体的了解，它可以是有利的，它也可以是不好的事情。所以我想强调，一个吸了电子烟10年的人，他们可能如果我们能够更多的去关注科学的话，他们会认为吸电子烟是有好处的。当然，我们也谈论的是语言，谈论了这个标准统一化，我们还谈论了烟草减害。当然，危害减少呢也并不是完全一样的。比如说，在美国我们的联邦政府它是支持一些危害减少的相关的规定的，但是呢，烟草减害又不太一样。我们需要大家一起进行合作，比如说包括我们的消费者，我们需要一个联合的群体，而并不是直接去统一标准对于危害减少的定义。我们需要不断的关注，因为人们有着不同的想法。我想要提及一点，就是你刚刚说的关于公共健康和资本主义之间的问题。要知道，现在学校其实也像是做一门生意一样，他们也是在牟利。有很多人都在研究公共健康，它也是一种资本主义性质的，它也是关于牟利的。还有一些人他可能是为了实现公平的问题。好的，我们现在来到下一个问题，谁到底应该有责任让公众知道这一些风险较小的产品呢？应该是制造者吗？还应该是公共安全、公共健康这一个群体吗？作为消费者来说，他们应该从哪里得到相关的信息？软件吗？奥利维亚他之前发表了一篇非常棒的文章，提到了一些产品它通过了 FDA 的批准， 有一些人他并没有意识到危害减少的潜力，特别是一些医生他并不相信这一些产品，除非它是通过了 FDA 的这个批准。所以我认为，这也有可能是政府给我们带来的错误信息，但是呢，他们也有的时候能够给予我们一些好的例子。事实就是公众呢可能会去相信那一些通过批准的产品，所以我认为非常重要去讨论这一些机构去进行宣传。
And as part of that discussion, they should be informed about all the options that are available to them.
我想在我们的讨论当中，他们应该知道所有的，他们可以有所有的选择。但是呢，他们并没有意识到这一点，也就是说，不知道自己能够去进行各种各样的选择。我们有的时候消费者呢，他可能会相信广告所说的，但是在加拿大有一个非常尴尬的局面，就是在这一个产业当中的人，比如说一些经营电子烟商铺的人，他们并不允许告诉消费者他们所使用的东西是相对于烟草更加安全的。所以我们其实是在禁止这一个行业去和消费者进行交流。所以当这一些物理学家不能够及时进行交流的时候，消费者肯定会变得非常困惑。好，非常感谢约翰，我有一些东西要说。你所说的，你所做的你的言行，在这一个非常具有竞争力的世界当中，你所说的和你做的是不一样的，所以我们可能有不同的意识，比如说你有不同的政党，你有不同的宗教。如果你吸电子烟的话，你会知道有好多人吸电子烟，他们做这些事情都是出于个人的选择。但是如果在一个环境当中，它变成了一个政治性的行动的话，它可能就成为了其他的意图。这种行为呢，其实是相对于去反对其他人的想法、其他人的宗教，我们并不完全同意其他人的想法。
Did you want to add? Well, did you want to do the Q&A that was specific to you, or did you want to do? Well, we'll do Paul Palmer's first.
你想要回答那一个针对你的问题吗？你想目前我们的科学展现给公众的科学是非常复杂的。他们应该将科学用作一种更加简单易懂的形式写出来吗？让人们更多的去了解烟草减害吗？我认为这一个问题，他其实也提到了我们这个危害减少的这些活动，它背后所带来的相关的好处。很明显，吸电子烟和其他的方式、其他的烟草是不一样的。但是它是真的有效的吗？我认为答案是对的。我认为科学应该用作一些更加简单易懂的形式写出来，让人们能够去理解。如果不这样展示的话，人们会 误导，它会变得更加的复杂。这也就是为什么人们可能会用科学去误导某一个群体，所以我们需要将其进行更加详细的分解，让它变得更加的简单。我们所听到的，它其实是关于道德。所以我认为，在提到科学的时候，它应该是去进行不同的交流的，而且是用不同的语言，针对不同的观众去进行交流。每一个人的想法都是重要的，不应该只是简单的分为好的科学，或者说简单的科学。每一个人的想法都应该被倾听。我们需要解决这一个问题。我认为，当你去在科学进行交流的时候，你有很多的事情要做，而且是不同层面的。比如说有些人像样，他在推特上面发布只能仅限140字之内，你可以这样做，但是你同样还需要知道，在推特上面呢，人们可以去发表任何观点。我非常同意 Kevin 的这一个观点，在不同的物化当中有着很大的相似性，这是非常重要的，特别是当你吸电子烟的时候。这给到我们消费者更多的选择，但是呢，你需要去解释这一些产品是不一样的，这也就解释了为什么有一些人更喜欢加热的而不是燃烧型的。我认为这是不太一样的，这是观众他们自己的想法，比如说他们到底是喜欢燃烧或者说加热的，这之间确实有一些不同，但是我认为这些不同是很好的。所以消费者需要知道的是，这种物化其实是为了减少危害。这样的话，当你不吸烟的时候，你也能够知道吸电子烟是非常重要的。当然，有一些吸电子烟的人，他更希望去了解政策制定者他们做出的决定。所以我们需要有一些区别，特别是学术方面的。
Vaping, heat not burn, and vaporization. I think it's the same thing because it all causes it's harm reduction, especially when you compare it to smoking. Yeah.
实验。
You have anything to add, Ariel? I mean, you work with the Kleenex of vaping, is what I call it, what I call Jewel, but so you know how much the language can matter.
Yeah, so I have mixed feelings on this. I think on one hand it is good
我
if possible.
对于这一个话题呢，有着非常复杂的想法。我认为一方面它是好的，因为你能够获取一些简单直观的信息，而且用一种非常清楚的方式去进行沟通交流。因为有一些学术语言它确实是挺令人费解的，但是另一方面呢，我又非常的担心，因为如果你真的把它很简单化的话，它可能会变得非常的让人不太容易去了解真正的本质。
To explain common liability and how, the youth that
所以
vape
它
have
有的时候可能会需要一些
otherwise
技术层面的解释来解
make. So I
释为什么
simplifying the language too much. So I think it's a fine balance.
我们要防止青少年去吸电子烟。所以我认为这 我对于这个之间的想法是非常中立的。你可能会忽视了人们，特别是消费者对于这层面的了解。有的人他可能会非常的认真对待，但是呢，还有一些人对于此非常的感兴趣。我认为对于加热和燃烧的产品之间是有很大的不同的，这一些信息应该告知我们的消费者，让他们自己去进行选择。
Excellent, thank you. Richard Prone from the Safer Nicotine Wiki. Would you be able to talk a little about going by Dr. Glover's kind of model? How do we try and bring those different?
我们应该如何尝试去了解不同的群体，并且让他们共同合作？你会发现我们有一些共同的地方，但是我们如何去发挥这一个共同目标的作用？同样，我们应该如何用正确的方法去展现信息，让他们去了解，让他们去发现更多技术层面的细节。同样，当他们去阅读某一些人的结论或者说信息的时候，是否真正的可信？同样，我还想问的是，比如说到电子烟的时候我选择了电子烟，它确实帮助了我，我也了解到了危害减少。比如说烟草减害、药物减害等等。我稍微总结一下，我们应该如何去解决对于科学的一些误导。我想这跟你的视频有所相关，所以你能够谈论一下吗？我想说 Carol 他帮助我写了。如果你认为不同的群体他们所组成了我们这一个社会，他们有着不同的信仰，他们有着不同的体系，我们有着不同的群体，我们并不能够统一我们的想法，而且我们未来也不会完全统一。所以对于反对电子烟那一些人，比如说来自不同领域的人，他们联合起来，他们并没有看到电子烟的任何需求，而且他们也没有互相去交流，他们认为我们是错的。
Right, so yeah, we're getting further and further apart because at some level it is a war, although it's a war
在
of
某个程度上面呢，这将是一种意识的战争。我们需要去战胜，我们需要去说服，你知道，对于社会的公平度，不管他们在哪里，他们在中心，我们都应该尝试着去理解他们的处境，但是呢，我们也会在一定程度上 去反对其他人的想法，所以我们需要做的是抗争，我们需要站起来为人权战争。这是关于公平的一场战争，他们需要展现出自己，表达自己的想法。目标是什么呢？我们需要不断的去展现，我们需要做更多，我们需要去解释为什么他们会这样说，他们为什么会制造这一些恐慌，特别是关于电子烟的这一种信息恐慌。他们在提到电子烟的危害的时候，他们却没有任何的证据。这20年以来，没有人因为吸电子烟而死亡，所以我们要持续的去斗争，我们需要去去说出他们对于电子烟的这一些谎言。我们应该如何去区分这一些人呢？因为我们没有选择。你刚刚也提到了，我们需要去抗争。对于危害减少的人们，我们需要去组成一个同盟。谢谢。如果你在另一面的话，你可能会需要面临一些花费，比如说受伤、你的损失、你的工资这一些损失，没有人会意识到这是不一样的，无论他们是否需要花费。你可以和更多的人去进行交流。
Yeah, I mean, like you just mentioned, we know that vape.
Kevin，就像你刚刚所提到的那样，我们都知道电子烟要比烟草更加的安全，而且它的危害更少。但是每当我去危害减少的会议的时候，并没有看到这一些观点，所以我非常鼓励在场的所有人去参加一些传统的危害减少的会议，去知道。去一些我们团结统一的地方，当我询问一些人关于电子烟的想法的时候，他们确实有很多不同的观点，但是还有一些人认为电子烟并不能够用作是危害减少的一个工具。我不知道在其他国家的情况是如何的，但是你并很少去进行沟通。但是在加拿大呢，我认为这是很难做到的。因为在加拿大有一些会议已经禁止举办，禁止我去参加，因为我之前写过一篇相关的文章，人们我去接触了一些在烟草控制方面的人群，有一些人是我的朋友，但是呢，大多数人都没有回复我的邮件。我邀请了一些我的同事，他们认为如果我参加我的活动的话，可能会导致他的信誉下降，会毁了他的名声。
And the sad thing is, I love this expression. I never learned anything by talking to people who agree with me, because when I do get,
我并没有和那些同意我的想法的人，进行交谈过，因为我除非给他们机会，让他们解释。
Well, now I know something about where he's coming from. He's not looking at the data as it exists. He's looking at some hypothetical data that may or may not exist in the future. Yeah.
Yeah, well, actually, and Ariel can, and then we also have another question. So if she goes, and then you'll go with
我
your
们
question.
来看一下下一个问题。我会简单的说一下，你刚刚提到了第3个问题，为什么烟草减害不能够和其他的危害减少所联系在一起呢？我认为这背后很大的一个原因就是学术层面的。学术层面，在学术层面呢，它可能是完全不同的领域。当然，有一些人也做了很多的研究，他们花费了整个事业、整个人生去做这一件事情，但是他们却忽略了一些因素，比如说有一些，比如说人们喝酒可能会导致心理健康方面的问题。
Preventive actions to prevent some of the issues that arise in the literature, starting with good peer review. And I know peer review is a problem, as you talked about this morning, especially for harm reduction journal and others. But peer reviewers have to do a really
今天早上的这个会议当中，其实也提到了对于危害减少期刊当中的一些评论。所以我和我的一些同事呢，也尝试着去做出平衡。
Oftentimes, if you write a
还有一些事情，比如说你需要去比如说发表相关的批评的时候，如果你真的去写信的话，他可能会进行相关的审查，也有可能完全不会进行发表。但是现在呢，我们有更多的选择。
Fantastic. We have a question over here.
Yeah, no, it's two very brief comments, Roberto Sussman. One is that, yeah, it's true that there are differences between the different harm reduction products.
在不同的这个危害减少之间有着很大的区别。我们也可以看到，有一些产品它之间有着相同点。
But in general, the issue is a lack of combustion, and in whether in that you produce an aerosol, whether it is from a liquid or from biomass, or as it is done in dabbing and different forms of cannabis from a solid, right? And it is important because it intersects all this usage. Cannabis
这些产品当中所使用到的都是不一样的，有一些是液体，有一些是固体。我们也看到了。
You put the stone and then you light it up, and you are also generating an aerosol there. So there is more unity in these things, and it intersects several substance usage. So and this has to be exploited, not separate in compartments, but to emphasize the unity of this. This is one comment. The other is on the fundamentalists, which we have all bumped with one of these, and I bumped with them personally, and there was a time around 2000, it ended in 2019, where you could still talk to them, right? Before happens what happened, what you are saying in Canada, but there was a time you could talk to them. And something important we have to understand about these people, is that they think they are doing something good for you, right? This is important because you have to distinguish between the scoundrel that wants to beat you up or hit you or whatever, wants to cause you harm, and those who are doing horrible things to you for your own good. These people, they will never repent. In the factory, the foreman who is hitting others, he feels sorry sometimes. He goes to church, confess, but the person who is crusading, it is never going to feel sorry. He's doing the right thing. He will say, or she will say, well, some people die, these are collaterals, whatever, but the goal is, etc., you know? So the model for understanding them, and I understand them because I come from a Spanish-speaking country, is the Spanish Inquisition. The Spanish Inquisition, officially, they said, we don't want dead people. We want repented people, right? And they were honest in that. And this is the type of thing we're facing. They don't want to kill us. They want to convert us, right? And they think they're doing it for our own good. It's important to bear this in mind, right? So these are my comments.
No, thank you for them. I kind of want to go to his first one though, and I think that's what's the harm and combustible cigarettes as combustion and this whole demonization of nicotine. I guess, I mean, we are looking at tobacco harm reduction the next decade. How can we try to solve that? And, getting
我们刚刚提到的是烟草减害，我们应该如何去解决这一些问题呢？比如说在之前呢，你可能会直接戒烟，但是我们现在是完全不一样的情况了。我非常赞同你刚刚所说的我们确实应该去关注更多的相似点。我想对于不同的信息，我们确实是需要的。但是考虑到这个烟草减害呢，我们也需要去谈论可燃烧性的产品和非可燃烧性的产品。而且我们需要让人们去不断的区分这一些不同的产品。就是大家的想法呢，它其实有点像某一种宗教，他们相信他们认为自己做的是正确的，他们认为自己做的是为了更好的结果。当然有一政治学家他想的可能不太一样，但我们很多人并不是政治学家，我们是研究性的，我们不愿意去有一些人呢，他不愿意去进行协商，所以你会发现这可能会出现一些争论。所以你会发现这个问题它更像是人们的宗教信仰。
There's a gentleman. Woo.
女士优先。
Thank you, Fiona Patton, Australia. So again, I'm sorry, but I take up your point because I've been a harm reduction.
引用你刚刚提到的一点，我在过去的10几年是一位烟草减害的活动学家， 当我和一些人进行讨论的时候，讨论烟草减害的时候，他认为这是在拯救很多人的生命，他们可能会因为吸烟所导致的相关疾病而死亡。我今年在墨尔本参加了一个国际性的危害减少的会议，我们在那里进行了交谈。他们去了解了卡洛因和海洛因的相关的危害。
In my ideal world, we would have 3 separate commercial sources, well, maybe 4 separate commercial sources of nicotine.
在我看来呢，我们可能会有3种或者说4种不同的源。我想所有的相关的产品，比如说口含烟，每一个人都有自己不同，对于产品都有着不同的选择。
Nicotine pouch product. I kind of regret the fact that Juul has been taken over by Altria because I think it would have been.
我之前也了解过一个生产尼古丁口含烟的公司，还有 Altria 它生产的产品。我想这一些都可能会成为一个独立的电子烟产业。但是呢，很遗憾的是，尼古丁替代疗法它正在被整个烟草行业所控制，所以我认为这很难让人们去接受烟草减害。
But I have a second professional hat, and that is a military medical professional. And the reason I'm bringing this up is one of the issues I'm encountering in Israel is the fact.
我想问的问题我是一位军事医疗专家，我想问的一个问题是我之前所遇到的一个，那就是电子烟，但公认的是电子烟要比吸烟更好。但是呢，军方不知道如何去解决。我的问题是我们应该如何去避免那一些独立的医疗组织。
Those who are willing to actually listen, learn, and create an independent opinion on a topic like tobacco harm reduction or harm reduction. Thank you.
比如说，在以色列有一些人，他愿意去倾听关于烟草减害这一个方面的内容。你刚刚说到的这一个呢，我想说一下你是来自军方的，这有很多策略，比如说在战争方面有不同的策略，所以他们有着自己的想法。你看，我现在如果这里有一个吸烟对于孩子来说是具有危害的。当我们去了解这一些证据的时候，这一些证据并不能够支持他们的观点。
Using very strong communication strategies, brainwashing, manipulating the way people think about things. So on the one hand, yes,
他们会使用一些非常强烈的交流手段，比如说洗脑这一种方式来控制人们的想法。
But look at what the purpose is. So
还有对于一次性的产品来说，它确实会对环境造成危害。但是 背后的目标是什么呢？
when we only had combustibles, and now they've dragged it out again. It's just a strategy, and try to look at their purpose.
这是一种策略，我们尝试着去了解背后的目的。我有一个
You can pack it out.
爱好
The stuff that you take, you bring back.
是徒步。在夏威夷呢，他们有一个想法就是，你需要把你所有的东西都带走。所以我认为，如果你们能够吸这一种一次性的电子烟的话，其实是更好的。但是呢，这方面不能够解决这个问题。所以我的想法，我的解决方案是，我们可能需要退一步，比如说像对于一次性产品来，让我想到的是 Harry 他在他所做的工作，表明在那一些使用烟草产品的成年人当中，他们的需求是非常稳定的。
Taking into context the wider picture, because there's a lot of great evidence from population level trends and econometrics showing the strong substitution between tobacco products. So always taking a step back and looking at other products is a good idea.
Okay, well, we're gonna be oh, we got another question or? Yep, I mean, well, there's, Richard, you're good. Okay, sorry. Tom.
It's on. Hello, Tom Gleason, Nicotine Alliance Ireland. I'm going to be devil's advocate. It's not tobacco harm reduction unless you're already addicted to tobacco. If a naive user uses these products, that's a harm imposition. So are we left with a situation, specifically to you, Maria, what we're facing in New Zealand, where you will have to sunset combustibles?
这个问题想特别问一下 Maria， 在新西兰是如何去解决这一个一次性产品它所带来的危害减少的问题的？可燃烧性产品是第一步，然后是
plan for the world. The people, one of the strategies is to co-opt every group to get on the board of the Society for Research on Nicotine.
这些人他的策略之一呢，就是和不同的组织去进行合作，去研究尼古丁和烟草，并且改变人们的目标。改变人们的政策，这其实是目前新西兰正在使用的一种方法。你会看到其实战争方面的策略在这一个领域是非常有用的。我想说，如果我是一个不太成熟的使用者的话，它可能并不会减少相应的危害，因为对于烟草的使用可能会有不同的风险因素。
Any more questions from the audience? Well, I've got my Martin.
还有一些观众想要问问题吗？我们只剩几分钟的时间了，所以我想问最后一个问题。接下来的这10年，对于烟草减害，你们是否有相关的想法吗？表达你们的想法，并且说给我们的消费者和政策制定者听。我第一个说吧，我认为我的态度是非常悲观的，但是呢，另一面我认为这其实是处于一个 循环，更多的人接受电子烟有着危害减少的潜力，他们最终也会逐渐的去接受这一种想法。我想我的观点是乐观的，因为我们现在生活在一个资本主义性质的社会，政府呢可能会去控制，可能会去平衡，所以当我们去看到底怎么样进行转变的时候，政府呢它其实是做好了准备的，而且加拿大政府呢也出资10几亿来建立一个电池的生产工厂。为什么政府不会去反对这个相关的公司呢？所以我们还是对于未来有着非常乐观的态度，而且政府呢也在不断的支持这个烟草方面的转换。我不太确定，当你看过去的时候，有一些国家，比如说民主国家，他们很快就改变，他们不再民主，他们用了一些政策，人们失去了自由。所以为了更好的去了解到底发生了什么呢？无论是殖民还是被侵略，这是非常
available online
有趣的。
It was a really interesting exercise with what I learned looking from Ottoman Empire to today, that around the world empires form.
我所了解，从过去到现在，有一些帝国它在不断的扩大，这是一直在发生的，我们都是这其中的一部分，我们深受着影响，我们在建立着一个新的帝国，比如说星球大战。它也很像黑客帝国，我们尝试着去控制人们的想法。我非常喜欢这个世界有着不同的文化，我们每一个人都是不同的，因为创新就来自于这一些不同之处，所以人们的未来可能会更加依赖于这一些不同。当然，还有一些人的想法是想着我们应该保持一致，我们应该都相信有共同的信仰。我只是非常的担心。所以我们应该从历史当中去进行学习，事物并不会永久的持续下去，它总会发生改变。那我最后再来说一下。
Let's learn from each other. Let's collaborate with each other.
去参加一些其他的烟草危害减少的会议吧，这样的话我们可以进行相互的学习，而且我们还可以互相合作。
And let's collaborate so that
让我们对于雾化的定义有一个统一。雾化到底是什么呢？电子烟它是加热，而并不是燃烧。所以当你知道这个烟草减害政策能够像其他的危害减少政策一样有支持性作用的时候，你也能够互相帮助，而并不是互相推搡。非常感谢大家参加，也非常感谢所有观看此次视频的 观众当然如果您还有更多想说的，你也可以给我发邮件或者是留下相应的评论。
Again, Moira.
Yeah, yeah, that was lovely. My name is Martin Colley. I am from Glasgow in
我
Scotland.
叫 Martin，我来自苏格兰。我首先想解释一下，我是做什么的。同样呢，因为我们的观众是来自世界各地的，所以我想我可能会有一些口音。
And if you're struggling to understand anything we say, just tune in to the translation service and turn it to English.
如果你
You'll be fine. My name is Martin
非
Colley.
常难懂我们正在说什么的话，那么你就使用一下翻译频道。我叫马丁，我是癌症机构的一个主管人，主要是帮助人们在癌症，同时呢，我还经营着一个组织，主要是为人们提供关于药品和酒精方面服务的。今天这一个主题呢是 谁在这个领域当中有利害关系。当然我们还会探讨更多的细节。其实也就是想在这个领域当中，谁有责任去负责我们的消费者。这是一个非常重要的方面，我们去进行思考，而且也正是目前这一个会议其中的话题。我想去分享一些我的观点。同时呢，也希望了解一些你们的想法。所以我发现，如果你坐在很后面的话，我就可能看见你的因为这个灯光很强烈，所以一定要必须手不看头，这样的话能够让我看见你，能够让我们进同学所以也让我来简单介绍一下我这一个问题在我的主编呢，是 Chris， 他是一位心理学家，也是一个咨询公司的主管。昨天也看了很多去谈论自己的生活。他知道了我们这个地方是一个非常美丽的地方。那他旁边呢是 Moria， 他来自苏格兰，也是跟我一样。同时呢，他是来自 PMI 飞沫国际的一位成员。他当时
I'm sorry. I'm sorry. Fiona, who's an ex-member of Parliament for Victoria in Australia.
那在我右边呢是 Fiona， 她是澳大利亚的一个组织的前成员。在旁边呢是 Summer， 是一位记者，能够给我们很多关于消费者的想法。所以我们今天的主题呢是谁在这一场游戏当中有着相应的利害关系，有哪一些因素是我们需要思考的。所以我将会在接下来的2到3分钟内，去解释一下我所做的行为学方面的一些研究。新安全对于电子烟的主要的忧虑是存在的，而且对于一些规定制造者来说，他们有很多的担忧，还有相关的健康机构，他们非常担心这一个产品当中到底是有什么，而且他们会担心这个里面是否存在一些具有毒性的风险因素。在当时呢，我们是不知道的。人们做了足够多的测试，这也是规定制造者他们所非常担心的，监管者非常担心的。那这种的时间呢，对这些监管者他们也很担心可燃烧性的烟草产品，这些产品究竟会对于人体有什么样的影响？是否会相对于其他的产品是否有更多的危害？而且对于个体来说，是有着急速影响的。我认为这对于产品制造商还有在这一个领域当中工作的人、研究团体来说，都是非常具有挑战性的。而且很明显，对于全球的监管机构来说，他们有着很大的不同，所以他们也尝试着去寻找相关的证据，比如说对于现在那些抽烟的成年人来说，如果想要戒烟的话，这些产品可能会带来什么影响？我会引用关于味道的那个例子，因为这可能是在烟草韭菜当中非常热门的话题，而且它也是有着不同的影响因素。 我认为行为学方面的研究无法成为一个必要的因素，而且在过去的几年内可能已经向我们展现了这个烟草它具有不同口味所带来的潜在的利益。而且今年呢，他发表了一些其他的同事一起发表了一篇文章，他们回顾了过去所做的29个调查。这个调查呢，主要是研究了关于戒烟所给别人带来的影响，并且也发现了不同的商品，比如说有些不同风味的商品，大多数是水果风味的商品，它们到底有什么区别？他们从这29个调查当中进行了一个总结。现在在做的动物呢，可能也尝试着去证明这个有风味的电子烟的不同的效力，而且尝试着有一些人尝试着从可燃烧性的烟草产品到电子烟。有很多人都使用，并且从这些产品中获益。所以我的观点就是，一些研究尝试着去证明有着风味的、有着口味的烟草产品要比那些烟草本身是口味的产品有着不同的作用，而且对一些调查研究它最后是如何去计量的，也是需要去进行研究的。当然，这一些调查它可能是在不同的国家有不同的语言，所以有一些信息不是特别的清楚。在过去的5年内，进行了很多的科学研究，也无法足以证明一些风味能够确实的增加人们的戒烟率。但问题就是我们现在看到监管人员他看到了这一些文章他们就支持利用。最后呢，有一些国家，比如说在美国就禁止使用一些口味，也在欧盟也是有着相关的规定禁止使用这一些个性化的口味以及加热的烟草产品。我们都非常同意，如果能够减少一些吸烟者的选择的话，它最后的这个影响也可能会减少。当然，有很多也有一些烟草使用者，他们反而去选择一些危害更小的产品。所以我想说的是，行为学是一个很大的因素。我们这一些行为学的科学家，比如说像我，还有一些其他的研究机构，还有一些公司，他们可能会有自己的行为学科学家，我们都应该去做出更多的研究来探讨如何为消费者提供更多的产品。同样呢，我们也需要不断的去展开实验，并且提供我们的结果。而且我们都非常同意去统一整个设计的标准。不好意思，可能 多说了几分钟。我其实想说的就是人类学它和它的关系是息息相关的。非常感谢。
My sister's called Fiona. That's
我们来
here's the third Scottish
邀请
accent,
下一位
the
讲
eighth
者，因为
version of the Scottish accent, which some would say is a harm reduction version of the Scottish accent.
不好意
So
思，我可能也会有一些口音。
So I'm here, I guess,
希
to
望
mark
能够
the
让你们听懂我
case of
所
why
说的
the
话。
industry should have a stake in,
我
in harm reduction.
问到了为什
Preface what I'm
么
going to say is by I don't speak for the
这
industry
个
as a whole.
产
I
业
speak
会
for the
在
company Philip Morris International, but
这个
I'll just give
现
some
在减少当中所
examples
看
of why
有
we
一
think
起
we have an
实际
important role to play
要知道
in
我的部
harm
分，也知道
reduction.
我的公
It
司，
really comes
希望
down
公司
to
国
two
际
main
或者
things.
是
First of all,
我想探讨一下我的
will
关
comes
系，为
from
什么我们会
ensuring
在
we
这一个
have
工作
a
点位当中
sustainable
扮演
business
着非常
model
重要的
over
角色，
time.
它主要是
And for my
有
company,
两个
this
点，我
vision
们现在
of
有
having a
一个
sustainable
非常
business
长期的可
started
持
more
续
than
性
20
的
years ago before I
生
was
意，
with the
而
company.
且我们的这一
And
个
the
生
vision
意
was
是
driven
在
by the
20年
acknowledgement
前开始的，
that
就是在我
smoking
在
is
加入到
harmful
这家公
and
司之
causes
前，
serious disease and
我
premature
们
death.
当时的
And probably we
当
should do
时
something about it.
大众的想法就
It
首
took us a
先是
long
它
time
可
to
能
do
会导
something
致
about
严重的
it.
疾
It took
病，
us a
也可能
long
会导
time
致
to develop the
死
products
亡
and the science that
所以我们
ended
需要
up
去解
in
决这样的
the
问题，就
state
花
we
费了
are
我们很
today,
长
which
的
is
时
having
间
bright
去
future
研发一
value
些
in
产品，
tobacco
用
harm
科学来
reduction.
解决这个问题。
Nevertheless, it's a
那
path
今
that
天
we
我们有
set
一个更加
ourselves
美好的未来，我相
20
信
years ago. And in
烟草
2016,
减
we
害，
announced that this is the future of our
这是
company.
我们
It's
家
in
10
fact
年前就
purpose
选择
of
了一
our
条道
company
路，而且
is
在
to replace
2016年我们
cigarettes
也
with
做了这张
non-combustible
是我们公司的
alternatives
未
that
来
are a。better choice
那我们
than
公司的
nicotine
目
or
的呢，
smoke.
就是提供一
The
些非可
second
燃
point
性的替代
of
品
why
来
we
替代
should
那
have
一
and
个
do
烟
have a
草。
stake in tobacco harm
那第二
reduction
点，为
is
什么
to
我们
protect
在
our
这个烟草品牌当
consumption
中占
and
有
money.
一席之地呢？
The money, the investment that we have been able to make, which is
我
$10
们
billion
用
since
金钱去
2008,
投资，就是2008年以来，我们投
so
资
we've been able
了
to design products, a range of different products
场
that
地，
meet the needs of adult consumers. That
我们能够自己
deliberately
去
also
设
what
计
we would
产
like
品，
to
一系列
see
不同的
is
产品来
to
满
go
足
to different
这一些
toxicology
消费者的需
profile
求。 同
than
时，我们还
cigarettes
需
will.
要去申请
The
成交
second。thing that money unlocks is science.
嗯，
We've invested extremely heavily on the highest quality
我们
science I think that
用
exists
金
in
钱
this field
去
today.
进行这一
That's
些
going
科学
from
的
laboratory science
研究，我
at
们
the
投
very
资，
basic
我
in
们
terms of
要求
chemistry
最高质
through
量
to
的
toxicology,
科
clinical
学。
studies,
但
behavioral
是因为
research,
此是存在的，我们
long-term
在实验室做了很多的
performance
研究，
studies.
比如说一些基础的，包括化学、
investment in science,
毒药
I
性
believe,
学、
has come an
临床
ability
研究、
to
行为学研
build
究
trust with
等等。
consumers,
我们投资了很多在
with
科
the
学
health
领域，
community, and
这
build trust
使
with
得我们
regulators
有
and
能力
policy
和消
makers.
费者之间
We
建
don't
立
assume
信
trust,
任，
we make
也
things
让
data
我们
available
能
and
够
ask
和
people to
公
make
共
up their own
健康
minds.
这个领域建立
The third thing
是
that we bring
才
to
能
the
够和
table
天上
under
的
the
同
sort
学。
of money bucket is an ability to
我们取得
understand
这一些数
consumers.
据，能够让大
So
众
we
得
are
知，让
smart
人们自
before,
己
but
所
we've
做出
invested in
决定。那
understanding
第三
how
件
to
事情呢，
switch
就
them
是
and switch them as quickly
我
as
们
we
有
possibly
能力
can
去
away
了
from
解消
combustible
费者。
cigarettes
我
to
们
better
知道，我们
alternatives. That has
我
required
们投资了
diligence,
很
that
多
has
去了
required
解他们
one-on-one
为什么做
conversations
出
all across the globe,
的
which we
烟
have
草
carried
选择的改变，
since even before the products were
从
on the
自然
market.
香薰烟草到
And
更
then the
好
final
的
thing that
替
this
代品，
investment brings is
我们总是会做
is
一些
also
1对1
scale.
的
So
交
we're
流，
not knocking
特别
startup
是在我
companies.
们发布
I
新产品之
believe they
前，
have a really important role to play. I'm not knocking
也
small
是
individual mom and pop vape shops. They have a really
第
important
3个
role
事
to
情呢，
play.
就是我们
But
不
what you
断
just
扩大，
can
第
kind
4
of
个
bring
事
to
情
the
呢，我
table
们不断
is
扩大
scale,
我们的
scale of
范
distribution,
围，
scale of
扩大
manufacturing,
我们的规模，这是非
and
常
simply
重要
getting
的。
these products
特
out
别是
there
在
as
一个产
quickly
业，
as we
比如说我
possibly
们扩大
can to
我们
the
的分
biggest
销，扩大我们
possible
的制造，
audience that we can in as short a time frame as possible.
这
So
是我
that's
们
why
所
I
能
believe my
做的，
company has a
而
stake
且
at the
去涉
table.
及更多
We
的
kind of way too
消费
fast. We
者，
kind of went and
特别
did
是在有
it
限的时间内，所以这也就是为什么我相信我们公司今天能够在这里 能够在这个领域当中占有一席之地。我们做了很多，当然我们未来也会继续不断的前进。我呼吁所有人一起来进行合作。非常感谢。
Thank you.
那 Fiona，
thinking about, you know, where my position might be in
当
this
你
as a former
去
member of parliament.
思考我到底是站在什么样位置的时候，我是议会的程序员，我
particularly as a harm reduction
我
activist. So I've
将
spent
会继
decades
续
in this
去
area,
影响，甚至
establishing
去
supervised
影响
supervised
危害
injecting
减
room,
少的这一个领
in
域。特别
decriminalising
是作为一个
sexual
危害减
in
少的活动学家，我花费
reforms
了
around the
40年的时间在这一
decriminalisation
个领
of
域
use and
去
possession
监
of
督、
all drugs. With
去做
those
更多的工作，
campaigns, I've had allies.
去
I've
消
had
除非法
the
行
medical
为。我们
associations, the
特别
college
是
of,
对
you know,
于
the college of
一
GPs,
些
the
非法
medical
烟
marijuana
烟草的
associations.
拥有这
When
些行
we
为。
start to speak about tobacco harm reduction, those
当我们
advocacies
谈
are
论烟草减
advocacies
碳的
standing
时
there
候，
alone.
呃，
That's why,
我们
you know,
却
I think
没有
it's
任
really
何的
important to
帮
have a
手。
stake here and
我
to
们
continue
这也
to
就是
grow.
为什么
And
我今
from
天在
the
这
point
里
of the conference,
今天
particularly today,
不断
is
的
the
继续
justice
工
issue
作。
as well.
我们从这一
It's an
个
equity
会议，
issue
特别是今天的会议当
because
中，
in
我们
Australia,
谈
we
论到
are
了
a
这个
relatively
供给
wealthy
性的问
country.
题，因为在澳大利
Most
亚，我
Australians
们
who
是
are
一个非
relatively
常
well
富裕
off
的国
are
家，大
also,
多数澳大利人、澳大利亚
unfortunately,
人，
if you are one
他
of
们
the
都
First
生活非
Nations
常富
people
裕，他们
or
不仅
Indigenous in our country,
如果你
then you'll probably
是
know about
是一个国
your
家
rates around 40% smoking. If you are experiencing poverty, if you're from
你会了解
disadvantaged
到
or vulnerable communities
我们
in
的
my
烟
country,
率大
you
概
are
是
much
在
more likely to smoke.
40%。当
It
然，
is going to have
如
a
果你来
significant
自一
effect
些
on
不太发
everybody.
达的
I've been involved in,
国家的
you know,
话，你会发
inquiries
现
into homelessness,
那一些
inquiries
人
into
更
criminal
多
justice system, inquiries into
更多人
drugs
去抽
every
烟，
time.
这可能会
Disadvantage
对于所有
is
事
one of the
情有着
components
非常
and
深刻
one
的
of
影
the
响。
issues that we need to address. So we need to address that equity
这
issue
也是我们
in
所需
tobacco
要
harm
去
reduction
解决
as
的问
well.
题，也就是在烟草
I'm
减
very
害当中的公
frustrated
平性问
because,
题。
as an example,
我非常的困
I
惑
was。speaking to the medical director of the supervised injecting room. Now here is a room where
我
people
之前
use
和
heroin,
一
come
位
into the space with their
药学
heroin,
的
inject
主任、
under
药
supervision
学
so
监
they
管的
don't
人员进行
overdose
了
and
沟通。
die. They then go outside and have a
他
cigarette.
们将海洛因进行了
99%
监
of
管，
them go outside and have a
这
cigarette.
样的话
Now, when I broach the topic of tobacco
有一
harm
些人他
reduction
不能够注册
with the
海
medical
洛
director
因，
there, he
也
just looked at
于
me
是
and
他
he
们
just took
去
askance like, what?
吸
You
烟。
should be supporting big tobacco in here?
我当我和他谈论到 和他谈论到烟草问题的时候，他就问我：“你觉得我们会支持烟草吗？” 所以我非常担心，在这个烟草减害这个领域当中，我们还是没有足够的信任。所以，作为一个澳大利亚人，我们现在在一些领域是非常领先的，所以我非常希望我们不会影响到你们的国家，特别是在某一些国家也有很多的进步。我们也有着一个，我们现在有着一个非常巨大的优势。当然，我刚刚说的是成年人，但是呢，我们也还需要考虑到，我们需要保护那一些青少年，保护儿童。
We were able to argue for far more sensible restrictions on adult access to this product. The same as we need to be arguing for
比如说，
similar restrictions on adult
我在我
access
们国
for
家
this product.
去保护这个儿童接触一些非法毒片，这对于烟草来说，它其实是非常相似的。
that they should legally be allowed to access, but also fighting for the
所以
rights of
我们需要
businesses
去
to provide these
维护
products.
人们的
Now, in
权利，
Australia,
希望他能够让他们去接触到一些合法的产品。当然，我们也还需要为一些企业
to
所
sell an ends with tobacco. They can
为
say
他
they
们
sell
去
a
赢得
unit
一些
without
权利。
tobacco. I'm yet to
当
find
然，有很
they can't
如果吸电子烟没有12吸电子烟的人，他可能会触及到一些黑市。所以从这个企业的角度来说，我们应该让这一些企业去经营一些合法的商店，让他们不断的提供电子烟的产品。但是，我们也需要注意，在未来的5年，我们为成年人提供产品是非常具有争议的。如果在澳大利亚我们不去努力的话，我恐怕，澳大利亚也可能会影响其他的国家。当然，我们也要去消除澳大利亚和新西兰之间的这个矛盾。我们一直做的都比新西兰好不止，但是现在不一样，我们在不断的落后。我们可以看到新西兰在这个领域做的比我们更好，但是我并不确定我们是否能够赢得他们。但是目前在烟草减害当中，我们确实是失去了优势的。我的观点呢，主要是站在消费者的这一个观点上去进行阐述。因为你要知道，这一个领域呢，它主要还是为了烟草使用者去进行讨论的。我认为有很多的风险，比如说来自经济方面的风险，还有对于这一些消费者的治疗问题，你需要去进行抗争。有一些势力要保护消费者的人，他们并不把我们看作是真正的人，他们只是让我们做出相应的决定。这本来应该是一个合作型的方法，但是呢，我们这一个群体实在是太多人了，我们没有具有代表性的人群。所以，如果我们没有一些消费者能够去讨论这些话题的话，可能会产生一些影响。所以，这一个体系它就是和我们消费者是相对抗的，我们消费者没有发言权。我认为这是不太公平的，因为我们算作是弱势群体，而且有很多人都很因为80%的消费者都居住在这个发展中国家，他们没有很好的公共安全、公共健康，所以有很多人就介入了这一个公共健康，但是我们现在所拥有的是限制着我们的选择。每一个国家都做出了自己的决定。他们做了很多相关的调查，关于公共健康方面的调查。所以我们非常的沮丧，因为没有人听从我们的想法，没有人真正的站在我们这一边。我们并不存在，就像我们并不存在一样，我们没有任何的权利。比如说，来自我国家印度一个非常有名的医生，他就做了一些相关的经验。有很少的人愿意戒烟，这也是我们所面临的问题。我们看到这些人他们在尝试着做 选择，但是他们没有明确的方向。而甚
use
至
over
呢，
time.
还有一些受到了启发，这样的问题将会继续持续下去。当然，所以当这是一些更加安全的商品的时候，它能够保护我们的话，是很愿意的，而且药品的使用者也是值得尊重的。在烟草方面呢，有更多的人。
Okay, thank you very much, colleagues. I mean,
非常感谢。
an array of different perspectives there.
我想我们已经知道了来自不同领域不同的想法比如说关于消费者的权利，还有政治观点，当然还提到了一些社会公平等等，还提到了烟草产业的想法，以及如何增大这个市场最大利益。当然还有从行为学科学这一个方面，它会对于人类的行为产生什么样的影响，以及让他们做出什么样的决定。所以请问观众有什么问题吗？让我们来一起听一下大家。
I'll come to you next, sir.
Hi, John Oyston. I'm a doctor from Toronto, Canada. Particularly for Moira.
John Oyston. 来自加拿大。考虑到在这个药学领域，这个不信任的因素太多，特别是在这个烟草减害方面。为什么这些烟草公司不会花费更多的资源去为这个电子烟产品取得这个医学方面的许可证呢？我认为，其实这些烟草公司做了，比如说 BAT， 它在英国就有一些药用许可的产品。我们作为公司并不会追求这一种道路。但是你想想，从这个吸烟者的角度来说，比如说我之前我自己就是吸烟的，这些吸烟者他很少会向医生承认他们吸烟，所以你把给他们放在了一个非常尴尬的地位。第二个呢，就是这可能会限制到我们产品的创新。可以看到，美国 FDA 它对于烟草产品，还有一些他们会不断的回顾这个进程，而且你会发现，创新它正在以光速不断的发展。而且你会发现，这一些产品它已经出现了2、3、4代，已经是超过于 FDA 所批准的那一些产品了。这确实是会存在一些担忧，因为如果你真的把这些产品进行限制的话，是为了获得这一个监管批准的话，你是无法进行创新的，而且你也无法去满足这一些消费者的需求。但是呢，我并不是说我们不会做，我们只是去思考更好的路径。
Commercial product that may be more up to date.
Just on the commercial front, I mean, a question that's floating around my head listening to your introduction, Moira, those motivations, where do they lie if there was a
这些动机到底是有哪一些动机呢？如果对于市场来说是一个机会去改变行为的话，那对于 PMI 来说，我们的平衡点到底在哪里呢？我不能说我们最开始的这个东西在哪里，但是我可以说，在2005年，在我加入这一家公司之前，我接触到了一些人。
the more he would advocate for investment in science
他
and
可能会
research
建
to
议
solve
在
problems
科
with
学和研究
national
方面
parks.
去进行更多的投资，这样的话才能够解决吸烟的问题。 那他最后成为了我们公司的 CEO， 他现在也是我们董事会的主席。
Who had the courage to say we can do better than this, and he also had the courage to stick with
他不喜欢这一个故事被叙述，但是呢，他想说的是，我们只要有勇气去做，说我们才能够做得更好。而且现在我们在这个研发方面也会投入到更多，无论是在教学领域，无论是你需要去设计一个产品的时候，你都需要更多的时间以及更多的投资。 那他把他的资金投入到了进去，而且他也相信这是在做生意的时候必须做的。
I'm not going to say that it was a dream scenario from day one. You have an organization where people's careers were built on knowledge of combustible.
你在一个组织里面，你每一个人的想法都，每一个人的梦想都是去建立一个去做好自己的生意。 我们之前这个可燃烧的产品做的是很好的，那他们在进行转换，就是在转换无烟草的替代品当中是如何发挥作用的呢？那是我们需要去进行更多的交谈，这样的话才能够让这些人有勇气去转向没有烟草的产品。 好的，前面这一位先生，我是来自澳大利亚的科林。我刚刚对于这所提到的，我想有一些观点。这一个结果是非常具有包容性的，因为味道它确实发挥了很大的作用，但是呢，有很多的这个研究也是正在探讨这个口味的问题。 我们要知道，口味对于很多人转向吸电子烟是一个非常重要的因素，它确实能够扮演着非常重要的角色。而且有研究表明，当你禁止使用味道的时候，人们又重新开始吸烟。还有一些人尝试着在非法的市场去找这一些具有风味的产品。所以我认为。 风味口味确实是一个主要的动力因素，还有一些研究表明，那一些使用具有丰富口味的电子烟产品的人更愿意去戒烟。所以我们需要意识到，我们还有很多可以做的事情，这是我想提出的一点。那一篇文章的这一个作者呢，他们在总结的时候。 也总结到了这个有口味的产品，确实有着更好的戒烟效果。当然，这一个研究的质量，在最终是没有展现出来的。我们只是，但是我们也不是去探索这个假想，但是非常重要。如果你真的想要去询问或者说去测试这一个假想的话，也就是有口味的产品是否能够产生更好的戒烟效果。 有很多的这个研究，它的目标群，它的研究对象呢，其实包含了有意向或者是没意向去吸烟的人。你会发现，比如说，在75%的对象，他是没有意向去戒烟的，但是可能6个月之后，你会发现有一些人他 你会发现他们并没有成功的戒烟，这也就是为什么在一开始这一些研究对象他们本身的意愿是非常重要的。但是你要知道，一些更高质量的这一个研究也确实表明了，风味而不是烟草风味本身风味的一些产品，确实对于人们戒烟的这个想法有着更多的联系，让他们更愿意去尝试戒烟。在美国还有一些欧洲国家，都做了相应的研究。但是我们会发现这一些研究的质量是高等不一的。我们也尝试着去设计研究，去对话更多的人去决定一个更好的方法，并且去定义一个更好的标准。
That's precisely, yeah, the conclusion of the abstract of the paper, which is unfortunately all many politicians will ever be pointed to, says there is.
文章当中的这一个结论呢，也提出了很多的这个政治学家，他们不愿意去指出相应的观点。而且有的时候戒烟和口味之间的关系并没有考虑到其中，所以很多人都没有了解到这一些文章它的局限性。
Samara, do you have a view at all, or do you want to make any observations just from a consumer perspective?
Samara, 你是否有一些相关的想法呢？特别是从消费者的角度来说，对于这个口味有什么想法？我们去餐馆的时候，你会发现，我不懂为什么我不知道它是否能给你更多的享受，但是呢，它确实，确实是有这一些电子烟产品，它的危害更小，所以风味却是很重要的。对于很多人来说，是风味是很重要的，因为比如说拿我自己来说吧，我自己开始吸这个有风味的电子烟的时候，我突然意识到了，为什么要这样做呢？其实是因为我想戒烟，我想要去远离那一些味道。
There are a lot of things which kids could have access to. I mean, alcohol comes in so many flavors nowadays, but no one talks about
但
that.
是呢，对于这些有风味、有口味的电子烟来说，孩子、未成年人是有机会能够获取的。就正如酒精是一样的。如果我们没有更好的举措去实行的话，我们不如就公开去谈论这一些产品之间的关系。电子烟它的危害确实更小、更少。
Even in India, when very few people know about vaping, when they did surveys,
比如说在印度有很少的人知道电子烟。
So flavors are important. If you took
所以我认为口味是非常重要的。如果你没有风味的话，它确实不太能够吸引人。好，我们来下一个问题。
Yeah, sorry, Martin, I'm not sure if this is going to be moving on, but I just wanted to ask an additional question in relation to this
我
this
想再额外的问一个问题，
flavors, and I apologise, Chris, this
还
this
是
is
关
not
于
to
种
sound
类
like
的
an
问
attack on
题。
you or behavioural science, which is not intended as at all. But it strikes me that the problem is that you're having
非常
improving
让我
efficiencies.
惊讶的就
What
是，你
most
提到
research
了
in this
这
realm
个
would tell you.
对于这些
You know,
研
I
究是
imagine there
很
is
难
a bit
去
of
证
a fear
明
of
的，
regulators
但
and
是在
academia
很
not
多的
giving
消费者
proper
可以
weight
告诉
to
你，
what
这
consumers
对于监管者或者说学术者来说，并不是一个很
you
大的
agree
问
with
题。
that? Do you think that's true? And why is it? And is there perhaps more of a role for a sociological or anthropological approach and just giving more weight to what people say?
你应该更加关注消费者的想法。我相信，我们会给予这些监管者他们所需要的信息，而且我们通常会去讨论研究领域还有制造者之间的这一个区别。同时呢，他们想要什么样的信息，我们都会进行给予。
demonstrates reliably that a change in smoking behavior is attributable to use of the products under a
有研究表明呢，在吸烟行为方面的转变也可能会导致对于商品的使用。
research is necessary. FDA is saying it is, I interpret. The problem then is that those types of study designs cost
认为问题是不同的研究，它可能会需要不同的资金，也会需要很长的一段时间去做，所以我们无法很快的得到答案。我们通常可能需要很长时间，将人们在烟草选择的方面进行一个转换，你需要至少6个月的时间去投资，去利用相应的资源，但是只有很少一部分的公司有足够的资金等这么久去进行投资。所以当这些监管者去设定一个标准，或者说去分辨信息的时候，他们无法得到非常清晰的结果。
allow us to attribute the change to any intervention or any product. So we can certainly, there's a great deal we can learn, and I certainly have learned in 12 plus years of sitting down one-on-one listening to smokers and vapors, people who use other products, especially from people who have who smoked all their life, tried using e-cigarettes or something else, and ultimately went back to smoking, to understand what was it about the product experience which didn't stick and they felt they needed to go back to smoking. There's a great deal that can be learned about how to innovate products to be more satisfying and appealing and affordable.
我们想让他们知道这些创新的产品是如何更加吸引人，而且是物美价廉的。所以要去劝服或者是说服一个监管者，特定的味道可能是一个产品的特点，而且这一些相应的研究是非常规模非常大，而且非常耗费资金的。
There are a few people who wanted to ask a question. Are your questions around this particular theme?
还有一些人想要问问题。
Okay, let's take Alex and then I'll sort of shift it on a wee bit. I'll come to you shortly, Sharon.
Thank you, Alex. We're at Australia, and
谢谢来自澳大利亚的 Alex。我非常高兴你们所有人能够在此次会议上回答我们的问题。一些进行贸易的烟草公司，他们总体的价值达到8000亿。 我们知道这一些烟草公司的
for over a century.
价值也在过去的一个世纪当中增加非常的迅速。但是在2014年，他们在2017到2021年，他们的价值下降了50%。可能是因为，他们非常担心，这个烟草减害对于烟草公司的影响。所以我的第一个问题是，这些投资者是否有相应的利害关系？我的第二个问题是，全球的烟草公司的劳动力大概有1亿多人，当然这个数据不是很准确，因为我们是经济学家。他们是否参与到了其中？非常感谢来自 Alex 的提问。对于你所提到的第一点，我很难说我们将这一个产业看作是一个整体。我只能谈论我自己的公司。当我们在2008年从 Alka 当中分离开来的时候，我认为我们的这个股票大概是在35到40，但是呢，今天大概增长到了95到96。我认为，这对于我们作为一个组织来说，是烟草减害所带来的，而且这个股份价值增加的原因，当然我不是这个财政方面的专家，我们花费了很多的时间和精力去分析，去引领这一些投资者和分析学家。在我们2014年发布第一个我们的产品的时候，我们也解释了我们的创新来源，我们解释了我们的科学，背后的科学。如果他们不相信我们所做的，他们也就不会进行投资，我们就无法得到相应的支持。
I think I have a wee follow-up question there. I'm not sure if it's a fair one, but I mean, so you're suggesting there that investors are making the decision to invest in PMI for the reasons of
说到了很多投资者他们决定要投资 PMI，那很大一部分原因可能是因为你们的盈利。我不是这一个财政方面的专家，但是我想有不同种类的投资者。当然有一些他是考虑的长期的发展。不好意思 ，Alex， 我刚刚忘记你所说的那一点了。所有的这一个职员都应该在这一个领域当中有一席之地。比如说，我记得我就是第一个去了解这一个项目的人，我也学习到了很多。你本身有了解这一些知识的欲望，你想要了解这一些产品，而且在这一公司，几乎每一个人都看到了他们自己的作用。比如说，无论是和这一些消费者进行沟通，无论是清理打扫清理这些实验室的设备，还是简单的跟他们同事讲相关的故事，每一个人其实都扮演着自己的角色。你是否对于目前的这个进程是否满意呢？
Is that question directed to Moira or
all four, really?
All four. Why don't I come to you first, Fiona?
那先把这个问题交给您。我们先想从我个人的角度来讲这个问题。我们现在看到的是在澳大利亚的事情。澳大利亚的有很大的一个非法市场。我们现在在整个烟草市场，这个从来都没有看到过。但是在 电子烟领域已经有非常集成的这种犯罪行为，在做这个非法电子烟。这个相比于毒品来说，这个是更简单的。他们的渠道分销，以及怎么样在当地的超市来卖，都是更简单的，包括烟草店。所以对我们来说，我们想要去禁止澳大利亚的这种犯罪，我们怎么样把这个澳大利亚非法市场的这个来消失掉？那恐怕就要通过一系列的这种禁止的禁令和一系列的执法。但是仍然我是非常乐观的，并且我也认为合法市场最终会战胜这个非法的市场。我们会改变澳大利亚的政策，让澳大利亚变得有一个正常的、合法的一次性电子烟的合法市场，来帮助人们使用尼古丁，使用更加减害的尼古丁。目前情况的话，大多数人们都是没办法能够买到正常价格的合法电子烟。对我来说，这个事情它不是一个斗争的问题。你知道对我们国家的人来说，每一个人活着都是一种困难。所以这件事情对我们来说非常简单，那就是我们现在很多人都抽烟，但是我想让他们能够抽到更加减害的尼古丁。你知道我们已经体验到减害产品有很多的好处，所以我们做这件事情，它完全基于的出发点，并不是说要这个，并不是说公众健康，而是一些更加基础的，人们应当怎么去应对这样的改变，怎么样从卷烟的状态变成其他产品的状态，这不是一个
traction. They didn't have a wide buy-in, but now it is genuinely about saving lives because people should have access.
人们通过此也可以去拯救生命，同时人们转换过来也是应该是非常简单的。我们要做的就是怎么样让人们更加简单的去找到相关的产品。所以我们应当投资更多来让有更多的商店买这些东西。同时我还是想说，我是一个科学家，同时我也是非常乐观的。我觉得这件事情已经变得很积极，同时人们已经不能忽略它。但是可能对于大多数人来说，这只是需要有时间来等待。我们是一个系统化的一个建模的过程。现在大家的讨论的重点就是说这件事情它的一个潜力，以及它背后人们要遭遇什么样的困难和挑战。所以我们这个世界卫生组织，它也在进行这样的一个建模的过程，他们也在考虑这样的一个监管框架应当是如何的。我们现在应当怎么预测这样的一个行为，就是所有的吸烟者都会变成这个减害香烟的这个减害产品的使用者。这是一个非常难以预测的话题。他们是非常认同这件事情，吸烟这件事情在时过境迁是总是会消失的。只是什么时候卷烟的销售和卷烟的使用会完全的减少和消失？所以这件事告诉我，它不是不论是减害还是说 从政策端进行一系列的推进。它其实的目的都是为了让人们减少疾病的困扰和卷烟带来的相关疾病的困扰。您聊的这些问题是给我们的这个整个事业是带来了增光了。我不来自澳大利亚，我来自瑞典。提到口味，它口味是非常重要的，因为它保证了尼古丁带的一个顺滑的使用，所以说它是非常重要的。有口味是对于尼古丁带的企业能够成功非常重要的一个关键点。所以说，有任何人在去做这样的研究，他们去把这个研究发给政策制定者，告诉他们真的能够去禁止掉尼古丁贴的口味吗？这个事情真的可以吗？我曾经看到俄罗斯他们做的尼古丁贴，他们的尼古丁贴有很多不同的外包装，比如说有卡通的，所以他们这样的行为会让吸引人们去使用它。我认为你已经问了一个非常好的问题，比如说像你刚才说的，它有这种像什么，棉花糖或者巧克力，这样的一些口味。这些口味的存在目的就是为了让促进人们去买这样的产品，但是它可能会导致一些孩子、青少年去买这样的东西。但是我们其实这个东西并不是去指向儿童的，而不是像很多反对者他们在社交媒体上说的那样，这些东西如果设计成这样的外包装和这样的口味，就会指向儿童。但是这些产品，比如说这些使用了像泰迪熊、像卡通形象的这些产品，他们其实是在积极的进入到这个市场。这个确实是会对于孩童有害，所以可能因此许多政策制定者就因此把所有的有关的东西就一棒子打死了。在去年，瑞典就成为了第一个禁止尼古丁带的这个国家。我只想重复刚才这位女士说的话，那就是对于整个烟草杆减害的一个事业，我们要保证2030年前所有的卷烟都消失的话，我们需要的不仅是有财政资助的一系列的科学研究，同时还有就是要保证全世界数亿的烟民他们能够真正戒烟。这些其实就是我们现在正在做的，同时我们也应当去更多的增加这个烟草的控制，从政策端进行一系列的压力。同时刚才说到了这个包装的问题，我目前仍然不知道人们许多的这个政策制定者他们正在监管什么东西。我同意你刚刚说的。Judy 已经等了很久了，这是我的。我们今天的主题是谁在这个 斗争当中是有筹码的。我们首先看到了世卫组织、布隆伯格以及许多大的药厂，还有很多个人研究者，他们都在去年11月的这个 COP10 会议上，表示了，烟草真的应该存在吗？比如说像布隆伯格，他们就认为目前已经有太多的这样的像。
It's not now a drip against, epidemic, children vaping. It's become a river. I mean, we're almost drowning in it. I wonder if
它已经变成了一条很湍急的河流，就导致许多的孩童可能会跌入其中。所有的这些人，我认为他们确定是非常希望能够有烟草减害产品出现的。但是你们应当更多的在这种科学的领域来进行你们的贡献。但是你知道吗？我没有我没有非常一个好的答案对这个你说的这个问题，因为你如果想要去指责 WHO 这种大的机构的话，这是非常难的。对于他们这些机构来说，他们确实是有一个发言权，有能力，也有筹码去做这样的事情。但是目前的问题就是，我们应当做的回应应当是一个很快速的回应，还是应当做一个比较沉稳的回应，来将这些人他们的思维进行一个转向，来说服他们转向去观看一下消费者目前的体验和生活。所以说我们才能会看到如此多的有政策相关的一系列的辩论，甚至是吵架。比如说布隆伯格他也有支持一系列的机构来促进这样政策的实施，所以目前我们应当去保证这个消费者群体和鼓励消费者群体，因为他们才是更重要的。Judy 刚才讲的点是非常有趣的，因为目前许多这个健康的监管机构，他们都在讨论的问题都是偏离主题的。如果我们将这个性工作者与之类比的话，我们可以看到，这是基本上是整个事情当中的一个竞争和争论的中心。我认为这是这应当是不能是随波逐流的一件事情，而是应当随着时间去逐渐我们应该走上正轨的。因为许多事情它是不应该就这样出现的。我们看到很多时间我们做这个烟草减害，尤其是来自各个国家的人，他们混淆了烟草减害这样的一个事情的概念，这也是为什么人们一直在争论。我们去的上一个框架会议，他们像 WHO 也表示，电子烟应当被禁止。这其实就是一个来自争论中心的一个问题。像大的烟草公司像大的医药公司，他们的一些实验数据和研究结果，人们事实上是不懂他们在讲什么的。 不知道如何去处理上瘾这件事情，因为尼古丁是上瘾的，所以他们认为所有含有这样尼古丁的产品都应当被禁止。这不是发生在我的国家，但是很多国家都是一样的。我知道的有一个来自哈佛的心理学家，他也做了相关的调查。他告诉，他说，如果我们做这样的一个，在这件事件上，既然有这样的争论和争辩，那我们应当去寻找问题的根源，而不是说在不同的议题上进行争论。这样的话只会让我们去阻止或者说否认当前大好的一个时机。那刚才您提到的，许多人都在做错误的争论，像你刚才提到的，像世卫组织等等一些机构他们做的那样，对我来说，最多被讨论的事情就是利益攸关者他们是不是正在关注和保护青少年。我知道，像烟草减害应该是针对烟民的，因为吸烟这件事情是引发众多疾病的罪魁祸首。但是对于儿童来说，吸烟是非常有害的。对所有人来说，但是对于儿童来说，一些烟草减害产品对儿童也是有害的，甚至会对儿童的整个人生造成很重要的影响，很大很坏的影响。所以，我们每当聊到烟草减害的话题的时候，总是绕不开去讨论保护儿童的问题。所以，对于很多利益攸关者来说，他们的一些烟草使用者，他们的父母可能会因此更早的死亡。我们应当如何去寻找对于他们来说很重要的一些替代品，来减少这个过早死亡，由于使用烟草过早死亡的问题。所以说，我们其实做这件事情是为了帮助孩子们，帮助孩子们的父母以及更老的一些人，他们能够健康的过完一生，快乐的过完一生。当我们想到这一点时，我们比如说，我们想到在美国有很多的这样的烟草减害的组织，所以说我们认为烟草减害应当是作为一个儿童福利的一个机构或者说事业来做。所以说，人们刚才你也提到了有孩子的问题，以及有人口的问题。这才是我们应当在2030年午夜目标当中关注的问题。我来自中国，非常有趣的一些话题。我不是这个专业的很专业的人，但是我听到刚才的讨论，我就想到了2点。第一点就是上瘾，第2点是尼古丁。我们刚才聊到有一些人，他们都在误解尼古丁，因为当我们讨论尼古丁时，许多人立即就会想到有毒的东西，或者说这个东西有问题。它是会上瘾的，它是非常危险的。但是事实上，上瘾，比如说还有尼古丁，它们都是中性词，它们都不是说很积极或者很消极的，它们是中性的。但是提到像儿童的问题，人们不会在意它是否会引发疾病，他们不在乎健康的问题。一旦 有一些事情他们被禁止了，那么儿童们他们就会有这种反叛心理，会买它。所以我们对于未来的这个下一代人，尼古丁，这是一种像糖、像咖啡因一样的一种化学品，它不应当被禁止，它不应当被考虑是否有风险禁止。比如说，我们就可以看到这个咖啡，它就一直在这当前的社会当中，它是良性的存在。尼古丁也应当一样。所以说，我们应当是给人们足够的这种公众教育，告诉他们尼古丁是一个中性词。第二件事就是上瘾。我们现在在场有任何人他是没有对任何东西上瘾的吗？你总会对一件事情上瘾，比如说糖，比如说咖啡因。许多人都对上瘾这件事情是非常满意的，因为我们不应当对上瘾感到愧疚或者感到自己做错了什么。上瘾，所以不是也更不是一个问题。那所以我们今天在谈论吸烟的时候，不论它是一个加热烟草，还是雾化，还是说自烟吸烟，我们为什么要做有关于我为什么要认为这些人是有错的？为什么要认为这些人是有病的？这就是我们作为媒体和作为一些其他的机构应当去承担的义务，那就是我们应当去教育公众，告诉人们吸烟和告诉人们尼古丁它不是有害的，然后上瘾它也不是有害的，所以这才是我们作为烟草减害的一个主题，这就是我想说的。我并不在这上面并不是专家，我只是一个平白的消费者。在澳大利亚，如果你看尼古丁在这个药房或者药店卖的时候，他们的这个年龄界限是12岁。比如说像尼古丁糖，他说这上面会写着他不支持或者说不推荐12岁以下的人使用。所以说技术上来讲，12岁以上的人在澳大利亚就可以使用尼古丁了。
Someone asked a question online. Has nicotine gum?
有人在线上问了问题，稍等。烟草口味这件事情你怎么看？它是不是一个方法让人们能够更简单的获得尼古丁？不论我们谈论尼古丁的它的毒性也好，还是说儿童保护也好，这是一些，比如说像你说它是污名化尼古丁吗？还是说污名化吸烟吗？你能再解释一遍你的问题吗？人们在不断的去污名化尼古丁这件事，你认为呢？确实，尼古丁已经被很长时间都在污名化。包括对吸烟者的一个敌视等等，人们确实一直在不断在污名化吸烟和尼古丁。我不是说，我们是推荐人们去尝试一些更加减害的产品，以及我不是说所有的这些信息都是来自于大家信息传递失误，而是很多人他们都选错了方向，他们没有去真正的把矛头指向吸烟这件事情，而是针对整个尼古丁的所有产品，这样会使人们渐渐的对尼古丁这个东西失去信任，所以人们就会越来越认为尼古丁是有害的，而不是吸烟是有害的。 世卫组织就是用这样的一系列语言去攻击和污名化尼古丁，但是我们知道，我们一直都在尝试着改变这一现状。在澳大利亚，我看到的是更多的这种吸烟，更多这种吸电子烟的人，而不是吸烟的人。他们也有在国会上提出，应当去合法化电子烟。这件事是为了解决有很多穷人，他们如果吸烟上瘾的话，那可能会导致他花费更多的钱。在澳大利亚，这件事情已经并不新鲜了，他已经在国会讨论了很多个月了。我刚才一直在想有关于污名化尼古丁这件事情。如果我们污名化尼古丁的减害产品，比如说加热烟草，比如说雾化产品，将它们去比作吸烟的另一种形式，比如说有的人想，你曾经抽烟，哦，你现在抽尼古丁，的其他产品，但是目前没有一些信号能保证能表示那些吸电子烟的人，他们跟吸烟的人是一样会有造成身体上的伤害。
Users as it starts to get more prevalent around the world, and that kind of worries me. What sort of tricks and devices are going to be thought up by those in tobacco control who are simply focused, I think, in my mind, on the wrong goal?
所以我认为大多数这种禁烟，包括禁止尼古丁的一系列动作，都是方向都错了。所以说，我现在想讲的就是对于公众的教育问题。这是一个历史持续时间很长，这是一个历史持续时间很长的事件。我们有非常多的人，他都在理解这个整个吸烟民群体，把他们当做整个尼古丁使用市场。所以说这造成了很大的误解。许多成年的烟民，他们也因此不得不去继续的抽烟，而不是选择更多的更减害的产品。所以对于整个许多的这个行业的机构来说，比如说很多在英国的一些机构，他们就会去游说当地的政府来进行一系列的这个减害的教育。我并不是想说这个减害他们的这些减害的公司和机构，他们是相互依赖的，而是说我们应当去更多的去了解、去沟通，让大家知道这件事情的真正利害关系。如果有人他们是非常依赖电子烟的，那么他们就我们后面也会有这个问答环节来解释这一问题。目前我们在英国的很多有关公众卫生的一系列问题，一系列的这个活动都在进行。他们其实都是在告诉人们这样的一个概念，到底是什么东西给人体带来伤害？是尼古丁还是其他的焦油什么的？当然了。
Using a nicotine product that is decoupled from combustion, and I'm sure that these types of education efforts are taking place in many countries.
我们现在做出的这些教育也是在发挥作用的。从我自己的这一个角度看来，我们确实在英国，它做出了很大的努力，而且是在引领整个进程。而且我们通过 医院，还有一些医疗机构、民phòng和我们的消费者进行交流，我们去了解烟草还有电子烟之间，向他们去解释这之间的不同，以及向他们去解释这可能会对未来我们的健康有哪一些影响。当然，我想澳大利亚的情况可能是不一样的，这是我的想法。我想知道在澳大利亚还有印度的情况是如何不一样的。女士们、先生们，我们现在将要结束我们的会议，那我想最后再让你们所有演讲的人来进行一个总结。我们星期三的晚上参加了 Clyde 他所举办的一个非常棒的会议。他提到了一些可替代的产品，他也提到了我们目前的这一个进程是从2017年到2023年的。我们需要去不断的思考。那你对于这个问题，从你们的角度有哪一些想法呢？所以不好意思，我想问一下你的想法。你刚刚的问题是什么呢？是关于我们在接下来5年或者是10年内我们的想法吗？当然，我想说，如果真的是预计这一个合法性的话，我想太过于冲动了。当然会对于这一个无烟草的产品有一些危害。当然，这一些产品呢，它也有一些特定因素，比如说它的风味。我非常担心，我们在过去的一段时间内所做出的这一些进步会退步。因为我们所谈论的是人们的生活质量，他们可能会在我的预测看来，他们可能会可能会接受这一些限制。当然，合法性可能会一直维持，或者说扩大我们吸烟者的选择，让他们选择更加满意的一些无烟草的产品，而且这也可能会使得我们的吸烟率发生改变。当然，有一些政策呢，背后也是由一些科学所决定的。在英国还有一些大学或者是组织也是在不断的开展研究，所以我预测政府可能会寻求更多的吸烟率的降低。我想在未来澳大利亚将会是什么样子呢？我想是有更多的选择，而且会出现相应的数据或者说科学依据，让政府能够无法反驳。当然，我还希望我们并不会迷失未来事情发展的方向。我对于我们未来吸烟是否会成为我们人生的这一个问题，我对于这一个问题呢是非常具有是充满希望的，因为电子烟它确实所带来的危害是很小的，无论从哪一个角度来看。而且你会发现在一些其他的国家也是在讨论这些问题，比如说中国的香港。当然在那些地方他们的政策没有去执行，所以我相信 我们在科学方面的证据会变得更加的坚定、更加的稳定，而且更多的消费者也会意识到这一点而且他可能会花费我们更多的时间。当人们需要更多的需求的时候，我想我们也需要去考虑在政策方面的影响。我想，确认一下他多是说的呢，我想做一些回应。我们很明显看到，对于这一些无烟草的替代品有很多的限制。当然，这也是和我们的吸烟所的相关影响所息息相关的。人们也开始注意相关的一些证据。那我们接下来将要做什么呢？我有2个额外的想法。我们需要去决定我们的目标是什么，我们到底应该需要达成什么样的目标？这应该是烟草行业的最终结果吗？还是说这是无理上的结局？比如说它和一些疾病和死亡所紧紧的联系在一起。这让我想起了我之前参加的一个讨论，那是在伦敦的几个周以前。它不是跟我们的今天的话题不太一样，它是关于监管和政策制定的。当时呢，有一位发言人，他的那个想法我非常的惊讶。他说我们需要去了解彼此的想法，无论是喜欢还是不喜欢，我们应该相互理解。在澳大利亚，这一些投票的人，他需要去说服那一些政策学家。如果他们想要重新被选择的话，那么他们需要去改变自己的政策，而且更加具有同理心。这样的话，特别是对于那些选择更加安全的烟草替代品的人，而且这一个趋势在不断的增加。我们所需要做的，我是一个共产共和党，所以我想，澳大利亚有属于自己的想法。我也非常希望我们所学习到的，我们和英国之间的联系相互继续下去，而且我们会做出更多的工作来促进烟草减害。非常感谢今天所有来自不同国家的、来自不同考虑角度的发言人。我也记得我之前参加了一个会议，每个人有10分钟时间去谈论。当然，这里没有宗教，所以我也不能去督促大家。我希望你们能够享受这一次的会议，非常感谢。